We will get started very shortly and proceed with our agenda.
Wache Misoe Miligisha Bio. I'm going to be asking the drum to start and all rise for the opening drum song, Walking Bear. Please and thank you. Wow, Miigwech, thank you so much for that powerful song to begin our morning. I'm going to be asking Lucy Long Peter to come up and share a morning prayer with us, please. And I'd also like to say, go Leafs, go. Yeah. Isn't that a good way to start our day? Good morning.
Well, Jake, bonjour, good morning. Yesterday was a hard day for me. And I came across an issue yesterday morning, and it reminded me of myself, that what I went through, very similar to this young woman, what was going on with her. And I realized this morning, actually, when I woke up and I was thinking about her. But then I realized this morning, it came to me that, when Creator, they say we choose our parents, and when we are born, our path is already set for us. Creator has set a path for us. And we're to walk that path, but there are times when we walk off our path and we find our way back in. And when we go through hardship, I always ask, please God, kshemanto, wichihin, koyestitutman. And I forget sometimes to ask Creator to help me when I go through a rough patch in my life, even to this day. So we've gone through some rough patches this past few days here in the gathering. And some of our communities are going through a very, very rough patch for their losses. And I am sure that Creator is watching over them, as we do when we say our morning prayers, to pray for them, for those that are going through those rough patches in their lives. Anyways, I just want to say thank you for listening to that little piece of words that I had in my mind. Oh, kshimanto. Uska jona beko skonda shinahasa na mendo dem. Migwesh kshimanto pe mata sonia mini ayach. Wichenan ko yeste totamach anuska kishigach e matasiach. Ko jest jiamiach. Ko jest jitotamach. Nesta ega chona kasasiach aneke kasag hegach nakatagach nakat when we leave them. Kushemanto chanaga chajik. Migwesh kshimanto nesta de don pe mata son. Kshemanto kinapoke kaskenten tante ki tanespiki nakatamahumaski. Ekushemakan despenamun kshemanto chikitamagen miyakan nuskaki shikak. Chiwichiak nista. Kuyesti tutamach. Kshemanto kstamin kwashke kon meserga minia yakutaski chmatasiach. Meserge kon kayayach. Chmatasiach chimandapaniach. Nestamagan despenamun kash chiwichiach. Chiwichach chikaneke ushkata sakapeche nigan peche teje chamka peche mutechik. Mesuta kekakashehawayach. Kina no pokoka ki nagacha chuicha chakanege washkatasak mashkut askomona nisadottamuk tande teje kishi mutejik isabogoye etwejik guano kanikasasis toganege washkatasak wichenan koyeschi yamiach anege washkatasakusche koyeschi tututahege metasachiknesta wino Nestamaga kashemanto minkwashtatano gokata utamahegechik anikamuchik kashchiminahtagasok kashemanto Nesta knenemik anike ushkaniko kumagato tahek nina nusche Nestamaga kaya patasachakota Nashnaveaski nation gatono kashemanto which heganega kaya patasachik kashemanto Koyesatote kaya patasat Eapatasachekino usche utinanimo. Ekamaga despenemon mikshemento. Masweo takaya kaipi kaitaya huta. Koyesatotamach masweta shenehan. Mauchanuska kishagak. Ekuma mashacha kishagak chi chamamohet despenemon maga chatamenopanek. Maswe koyesche chimenentamach ekioyach kashemento. Mikoes kashemento. Maswe Pasegewan katutaman chuichiach. Minguas kashemanto. Kisti minguas taton. Minguas.
Miigwech Lucy Long Peter for that beautiful prayer and for Walking Bear for opening our day in a good way. I'm just going to do the brief summary of what happened in day 2, and then I'll probably pass it over to Alvin Fiddler following that. So yesterday, the day began with Walking Bear and the opening drum, opening prayer, and a call to order by the chairpersons. And we heard updates from the Elders Council, Women's Council, and the Oshkatisak Youth Council, followed by updates on aviation, remote airport safety, water initiatives, nuclear waste, and the impact assessment process. The afternoon reflected updates on the Ontario final settlement agreement updates and in an in-camera session on the off-reserve class action and motion for NAN to act as an intervener. Additionally, an address from Chief Coroner of Ontario, Dirk Heyer, I don't know how to say it. How do you say his name? Dirk Heyer, on the Child and Youth Death Review and Analysis Unit and understanding the tragic outcomes and seeking guidance and moving forward. 2 resolutions were passed. Resolution 2604, support NAN to seek leave to intervene in BMV Ontario to support off-reserve Indigenous children and families. Resolution 2605, Anishinaabe Aski Nation's strategic approach to working with the Ontario Office of the Chief Coroner, Child and Youth Death Review and Analysis Unit. The day adjourned with a closing prayer and a drum. So today on the agenda, we have health transformation, Wawat Communication Society, border control. After lunch, we have ISK's Minister Gull Masty's address with a Q&A period. Followed by that is a mental health and addictions discussion, and then an open chiefs forum. Following the 3:15 break, we'll have the NAN IRS response strategy and resolution. 4 p.m. will be resolutions, and then by 5, we're hoping to have closing remarks, closing prayer, and a drum song. I'm hoping that this afternoon flows well with Minister Galmasty being here. So moving forwards, I'd like to call up Grand Chief Alvin Fiddler, Ken Miller, and Kennedy Ling to begin their... Oh, am I rushing or what?
Ready?
Y'all ready? Oh, okay. Okay, you want to come up?
Yep.
Actually, I'll be welcoming up my other co-chair, actually. Okay, you good? All right. Hold on, start grabbing. All right, there you go.
Miigwech, Mayabin. So before we get to health transformation, we have it on the agenda 9:30. So we're doing okay for timing right now. But I will explain a little bit about what's happening with health transformation. Just some housekeeping announcements. Remember the big announcement on Monday regarding the tribunal decision? That'll be happening Monday. Of course, NAN is inviting you to be here and participate. I don't know if they know the location yet, but that's being worked on. But if you would like to be here, please see Lori. And I think Lori was just out the hall, out this door to the right. And you can go see her. She'll help with accommodations and your travel. The second thing is Simon. Are you? Oh, there you are. Can you just stand up again? Is your team here? Oh, okay. Okay. So Simon is still here. And we want to encourage all chiefs to please reach out or respond and provide input to Simon. So thank you. Simon is still here. You're here all day, I hope? Okay. Again, this is really important. This is having a look at the structure of the organization, Anishinaabe Nation. And we heard the presentation earlier this week, and it's having a look at, I'll say, ourselves, and to see how we want to reshape ourselves. It's too early in the morning. And it's really important. And I just want to mention some things that I heard, just to trigger, and I know you need to think about it. It was mentioned, actually, by Apangan Zaghang, that NAN is actually comprised of 3 nations. There's 3 nations. There's the Anishinaabe, the Ojibwe to the south. There's the Mashkiguk, Innuit, and then there's the Anishinaabe. Anishinaabe more recently started being called Ojikri, but we're trying to move away from that term. So NAN is actually 3 nations. In a way, this is like a United Nations. It's 3 nations coming together collectively to stand strong and advocate for each other. So that's one thought that I heard here, and something I just want you to think about as you think about the structure of NAN. And what is the process? Because it's been said that for funding reasons, NAN is a corporation. Yes, NAN is a corporation. But we need to move away from that as the Anishinaabe people, Anishinaabe people. We can't run as a corporation. If we want to come together truly as a United Nations to make decisions that will collectively help and support each other moving forward, we need to operate differently, not as a corporation. And I've said this before, the way we run our meetings, it's true. We have a rules of procedure. And I've said this before, I really hate the fact that I've become an expert at Robert's Rules of Order, because that's not our way. That's not our way. It's been even said the way we structure our table. So the question is, how do we operate? How do we come together collectively from the 3 nations and to be able to help each other, to make decisions? And it's been said, NAN is not a government. NAN is not a government. NAN is not a rights holder, a treaty rights holder. But NAN is there to advocate. Collectively, we work together, make decisions to be stronger. So how do we do that? So there's a lot of those things. And give it some thought. And please go back and see Simon. Simon is here. Even if you don't get to do that today, they'll be reaching out. So think about it. What should NAN look like? And I just wanted to mention that. So that was a couple of housekeeping announcements. Also, as part of that is the role of the elders, the role of the youth, the role of the women. I know the youth have a lot of energy, a lot of drive, like the warriors. They're ready to move, vision for the future. There was talk about the treaties and the elders. And I'm really glad that Lucy talked about this in the prayer this morning. there was talk about when the treaties were signed. I usually say there's two versions of the treaty. There's the written text of the treaty, what's written in English, and then the true treaty, what was agreed to, the oral treaty, what was discussed, and what those that signed the treaty agreed to. And what they agreed to is the real treaty, the real promises, the commitments that were made. And they did not make a mistake. They were not tricked in my mind. They did not make a mistake. They were very spiritual people. They were very strong, and they knew what they agreed to in their hearts. And today, as leaders, they were very spiritual people. And I'm just going to use an example because I really value the elders that are here. When I was sitting around the table here, 2008, when I was chief for my community, very young, I did not have that spiritual strength, that spiritual background that I know those leaders had when they signed treaty. And that's where I really relied on the elders, that spiritual backbone. And so there is a strong role for the elders, that we rely on the Creator. And that's the role of the elders here, to help us, ground us in our discussions, that we have that spiritual strength. That's all part of it. And I'm just saying some of this because I was asked to announce, chiefs, that please go see Simon. What do you envision Anishinaabe Nation as like in the future? And I just wanted to share some of that, just to trigger some thought as we move forward. Chair, Migach. I usually tell Connie, as co-chairs, we don't give our opinions. Nobody cares what we think, but I wanted to share some of my thoughts a little bit. But we're going to go to health transformation. So on the agenda, it's for an hour, but it's actually going to be shorter. The team is going to make a quick presentation because we want to open it up to hear your thoughts on immediate needs of health. And I think they're going to explain that. And so I'll be facilitating that part of the discussion. So Grand Chief and the team. Yeah.
Miigwech, Adam. Good morning, good now. I was in the Minagama Duskaik, Gumakanik. Miigwech, the Naga Gin Gamwach, Minaga Games to get Lucy. Miigwech. I also just want to acknowledge all the Leafs fans, including Chief Adluka, and they must be happy. I'm not sure if the Leafs will make it to the playoffs, but they won yesterday, so no way. No way. I don't think so. Not maybe next year. So we're here to, as you know, Minister Galmasti will be here later on today, and I know her office informed us that they want to make some announcements while they're here, including on health. So we'll see what those the details of that announcement will be. But I just want to acknowledge the comments you've made so far on Tuesday and again yesterday when you were expressing the concerns that you hear from your members regarding health and just the how difficult it is more and more to access quality healthcare for themselves and their families, and the many challenges that come with it. So I just want to acknowledge the feedback you've given us so far. Also, just acknowledge the contributions that you've made so far to the health transformation process, including the Chiefs Council on health transformation, and just recently some more chiefs joined that Chiefs Council, which I'm really grateful for, to see our leadership commit themselves to this work. As you know, back in 2015, you gave us direction to issue a state of emergency on health and public health. And that's what happened a few months later. In fact, it was the Sulcode Zone chiefs that first made that declaration, and then the Schnabasket Nation Chiefs Assembly joined in making that public health emergency declaration, and then which led to in 2017. In the summer of 2017, we signed a very, what I would call a historic document on health with Ontario and with Canada. And we called that document the Charter of Relationship Principles Governing Health System Transformation in NAN Territory. And since that time, you, the Chiefs Assembly, have given and reaffirmed that mandate and through a number of resolutions, which I'm really grateful for. And so when we were preparing to give you an update at this assembly, our team worked really hard to prepare slides and to give you the most up-to-date and accurate information, which led to a more longer presentation. But after hearing your comments yesterday and the day before, we thought it would be better if we took on a bit of a different approach. That we need to, in addition to telling you about the health transformation work that's been done to date, we also need to address the issues that you've raised with us. And so I want to acknowledge, for example, I know she's not here in the room, Chief Sherry Taylor, her comments from day one. And so our presentation today, and we're very much aware that we're also running low on time. That's why we decided to change our approach with our presentation this morning. So the first part of the presentation will be on governance, that we need to, as Chiefs Assembly, you need to begin to make some decisions in terms of what that governance structure will look like that will govern health throughout the NAN territory. And we've been working on some models with our team to begin to look at what that should look like. So we will talk a little bit about that. And then after that, I will turn it over to Ken to talk about the innovation table that we are now in the process of developing in partnership with Ontario and with Canada to address not just the immediate issues that you hear from your members on a daily basis, but when we say innovation, how do we begin to change some of the things that are preventing our people from accessing quality healthcare for themselves and for their families. So slide 3. So this is a current system, and I'll move as quickly as I can through these slides. This is what the current system looks like, and this is just a provincial system. And look at how confusing it is, how confusing it looks like. And imagine if you're sick, trying to navigate your way through that is very challenging. And that doesn't even include the federal piece of it. So that is why I am sure you directed us that we need to redesign health and healthcare and to make it our own, and that we need to govern it ourselves. And we know that it cannot look like that. So the next slide talks about some of the possible models that could work for our people. And there has been a lot of work that has been done since 2016, 2017, even during COVID. There were a lot of discussions that happened with our team, with the elders. Many of it was through Zoom meetings, talking about traditional governance, for example. And so there are models that have been developed or begin to frame out some of those models. But I think the important message for this slide is that you need to be involved, that we need to make sure that we involve you in creating and begin to finalizing what that model should look like on health transformation. So the next slide is, how do we make sure that happens, that you are informed? And this involves community engagement. And there are different forms, as you know, of community engagement. We can arrange phone calls directly with you and your council, Zoom calls or Teams calls, or if you want a face-to-face meeting in your community, we can come and visit you and spend some time with you, your council, your frontline workers, your youth, your elders, your frontline workers, to ensure that you are provided the opportunity to provide your knowledge or to contribute the gifts that you have. I also just want to acknowledge our advisory councils that are here, the elders, the youth, the women, that they too need to be involved in doing this work. And we will make sure that there are processes set up to allow that to happen. So the next slide is on timelines. So that's sort of an outline of the process since we started in 2017 and where we are now, 2026, and where we need to go in 2027, 2028, and beyond. And so the purpose of this slide is just to show you that even though it's very difficult to see the progress sometimes in our communities, that there is movement, albeit very slow, in the process of health transformation. And we want to make sure that the next steps are clearly outlined, so that all of us can understand what that process looks like. So at this time, I'll turn over to Ken to give you an update on the innovation table that we are in the process of developing and setting up.
Miigwech, thank you. I just want to acknowledge the drum and the elders, the women, and the youth councils. Thank you, Miigwech, for being here. Thank you for the chiefs for joining us and the proxies. So the idea for the innovation table has come from years of conversations, much like what has happened over the last couple of days. It's come from advocacy, direct to federal and provincial governments. and it's based off of what we're hearing. Right now, it's sitting on a draft terms of reference. I just want to really highlight its draft. This is not something that is fully like set in stone in any way. We need more conversation and input before we consider there to be a final terms of reference that we'll be working off of. But the one we currently have is based off of the COVID-19 trilateral table, where NAN played a coordinating role in the federal and provincial, or to the federal and provincial governments to support communities. While this table is intended to focus on large-scale priorities, sorry about that, I didn't realize I hadn't switched the slide yet. So priorities that are transformative in nature, it has a critical role in the large transformed system, but also speaks to pressing and urgent needs. We hear quite often, where's health transformation at? Like, what are we doing now about the issues that we're facing in communities? And we consider this to be one of the things that we can help to do, to provide, to try and support those issues. So on the draft terms of reference, we have finally received the news from both levels, or the federal and provincial governments, that they are in fact on board and they are in fact committing to this process. We know that the next step, although part of it is narrowing down the priorities, the other is ensuring that the appropriate people are involved at the table. We know we are not the experts in any one piece of what we have to work on. And so ensuring that the appropriate service providers, as well as tribal councils, are there, and any communities will have the ability to have their say as well. On the piece around service providers, I want to give a shout out to Sonia at SLIFNA. It was calling it, or talking about an innovation table. It came directly from her in conversations that we had in Timmins at the Partners in Health Forum. So one of the difficulties with health transformation has always been balancing long-term planning with acute needs, like I was just saying. But we do believe this is one solution. We know that we have to be purposeful and intentional with an agenda. And part of what we want to do today is listen to what you have to say. So going back to that change in the presentation, we wanted to originally speak about the recovery network. We wanted to speak about different like projects that we have ongoing. We were going to spend a little bit more time talking about the mental health forum that we just partnered with SLIFNA on, because again, we're listening, we're hearing what people are saying. And I think every single assembly I've been to, someone has asked, but what are you doing with SLIFNA? Or how are you including Wawat? And so we know these are two places that we need to intentionally pull in to be a part of this process. We know that Matawa Health Co-op is another health authority service provider that is integral to supporting the communities as well. So some priorities that we have identified through these conversations and through engagements are NIHB and mental health. I think we can also all agree that those are very large topics. And the risk that we would face if those just were the topics would be not being able to reach any kind of forward movement, because there are so many individual pieces within each. So what we've heard within NIHB, we believe may be a priority is medical transportation. But mental health is entirely different. There are so many pieces of that that do not clearly speak to us as a number one or two priority. Possibly substance use. I mean, we heard yesterday also youth suicide. But what we wanted to request is that during the conversation in open forum that Adam is going to facilitate pretty soon here, is that we can discuss how do we narrow that mental health piece down even further so we can identify some clear steps to take within this table, within this new initiative that will guide us in starting to plan and create actual like real change. And finally, just on the forum, since I brought it up, just a really quick update. To my knowledge, this has been one of the first large partnership or partnered conferences that we've done with SLIFNA. We chose mental health because we knew it was an important issue. We had 170 registrants come or be involved with the forum, and we covered different areas from crisis to tools and trainings as presentations. But then half of the forum was more focused around engagement. Things that we engaged on were what are current successes in communities, and then also did some service mapping around like what is actually available to communities, either from the community, from the tribal council, from the service provider, and what do people have to leave community for? Those two questions give us a snapshot of where the current state is. So from there, we can use engagement that we've done in the past and in the future on health priorities to know exactly what that gap is and where we need to go. We also engaged on what the guiding principles would need to be when trying to develop a strategy in terms of how to address mental health in the North. Some guiding principles that can help just, I guess, guide the work, but flow through all of the different pieces. I say this knowing that we are not a service provider, we are not implementing a strategy, we are not anywhere near the end of development or even the start. These types of things need to come to chiefs to make decisions on. I just say this as so people know that we are creating a baseline and we are working with the appropriate people across Anishinaabe Nation to try to ensure that this is incorporating what the real needs are. Miigwech.
Miigwech, Ken and Grant Chief for that presentation. So the discussion is, so we've just had a quick presentation on health transformation and the fact that where things are moving now is right now to have these innovation tables. So the question is, what are the priorities? What are the top priorities that need to be dealt with? Not later, but right now, today. And so we'd like to open it up and hear some of those things. And I think what we heard from Ken was two things that we've already heard this week that people are talking about. Immediately, we need to deal with medical transportation, NHP travel. That's an issue. That's one thing that Ken mentioned. The other is Chief Taylor had another meeting, so she had to step out for a couple of minutes. But on day one, she talked about the mental health and addictions issues that we have in our communities. That is a health matter as well, but as we heard from Ken, that is such a broad issue that there are many aspects regarding mental health and addictions. I'll say the crisis that our communities are in. So those are two aspects. So the question is, what else are top priorities and how can we delve into those? And also dealing with the mental health and addictions, how can we break it down into areas that can be tackled, Shemak, immediately? So we'd like to open it up, spend some time and focus on that. And I know, hear some of your thoughts. One of my cautions is, before I go to Chief Batiste, we know what the issues are. We know, and we can, one of the previous meetings, one of the chiefs made a comment, we're talking in circles. We can continue talking. We know what the challenges are. So what we're looking for is some suggestions. Engagement dan kinanong, how do we start? Engagement dan kinanong Shemak. So, Chief Batiste.
Chief Sonny Batiste from Metacoan First Nation. Yeah, I guess well, there are a number of things, I sat on this health committee since it first started, and a lot of it was progress that wasn't being done. And at different meetings, we always chatted about immediate needs for our communities. And it always comes out to the funding sources of it. I mean, something has to be done to help out the people. I know some of the First Nations, they're in a lot financial better than others, but that's one of the big issues right now. And another is the financial aspect of it. Last year when I was at a meeting in Thunder Bay, I questioned at the financial part where how much we spent up to date was up to $42 million. I mean, in 4 years, that's $10 million a year. I mean, what services do we really got out of that? And, we talk about addictions and stuff like that. Was some of that somehow channeled to the First Nations that really need it for immediate needs for day to day? And, that was my concern, and it's still my concern today. Like our First Nation, we have issues like that, and just to say, we do help out, with our own source revenue as well, in which we sent a few people on treatment just within the last couple of months. But it's own source revenue, and what is the financial forecast for the future? Where are we with the governments that's funding this? I mean, is it going to be depleted or is it going to be a continuance of it? How it's going to be dispersed if we get more money? And I guess the main thing is, when are we going to get this done? That's one of my concerns. Like I always advocate for kids, but this is a big issue too for our members at Dixon. I mean, it goes down to everybody on the community. And it's hard to see that, it's our kids. Again, that, brothers or sisters or dads or whatever they are, and it's not a good feeling. Like, I'll be very blunt too, I lost a son just in December, due to, drinking and driving in an accident. I mean, that devastated me. And, the people need the help out there today. Tomorrow would be good, but tomorrow we don't know what tomorrow brings. Something has to click, I mean, immediately. Whatever funding the First Nations need out there, there has to be some way to get this to them so they can do what they got to do to help their members. It's hard out there, and we talk about off reserve children too. Well, a lot of our members at that age that are addicted, they do live off reserve. I mean, it's just they have to get that help as well too. Thank you.
You got Chief Kazis.
Hey, good morning. Minugisheba gitinim ma mechanic migach yep matagan gicha gemachigach migach and everybody here Minugisheba, the staff, everybody that's here, saying good morning. I want to bring up an HIB issue. I think this is one of the immediate needs for the community. For our community, we're having very, very difficult time to get accommodated for travels, appointments, and it's getting worse. You know, I think the accountability of NHIB is not there no more. You know, we shouldn't be paying our own travel or accommodations for our people. The program is there. You know, the program is there where we have to push together to get this thing in place. You know, or NAN could take over the travel because it's not working. And it's really impacting our mental health. And I like to see this move forward. You know, and I think it's an immediate need for everyone. Yeah, because we're gonna be probably in bankruptcy if we keep doing this, paying all these medical travels, accommodations, and it's not getting any better. You know, we've been meeting with ISC. They keep telling us they hire 7 new people. Where are they? Seems like there's nobody working. I don't know how many times we went to Ottawa office just for this. And we have to stand up, get this thing straight. The health director of our community is very exhausted. Probably everybody's health director. You know, trying to help these patients that are going out, because there's not only one appointment in one area. You know, there's appointments pretty much the whole country. I assume, you know, there's different specialties, special assets they have, and it's very troubling right now. And I like to see this improve. Like, this is an immediate action, and it's it's very very hard. You know, like seeing patient waiting for a medevac. There was one recently just refused, a baby with one of these flus that are on, a very high one, and the nurse refused to do a medevac. The doctor approved it, and the nurse refused it. So I think we have to stand together on this very hard. So miigwech.
Migach, Chief Kazis. So I think the point is I'll go to Chief Loon, Proxy Morris, and then did I see a hand up over here? Okay, Chief Abbas. So maybe help me out. The point is NIHB medical transportation. So I think we all know the issue. The team hears the issue. It's an urgent situation. It's a crisis. We all have examples. Even me, I've missed an appointment because of travel. I usually say to Connie, our opinion doesn't count. Don't talk about. But my daughter right now is in Thunder Bay. Had to go out for an appointment. Medical wouldn't do it. One of the issues right now is they're saying in Thunder Bay, they're canceling all appointments because there's no accommodations. But if you can find a place to stay, they'll send you out. So we had to find her a place to stay. Otherwise, she would not have made her urgent appointment. So that's one example. Another example, my son broke his ankle, 2 spots on his ankle a couple of weeks ago. So they were going to send him out on a skedevac on the airline, and they were waiting for NIHB. They waited 2 days. The doctors, nurses got really frustrated because he needed emergency surgery. And NIHB wouldn't do it because they said there's no accommodations in Thunder Bay. They finally got so frustrated that they put him on an air ambulance, which probably costs $15,000 just to get him to the hospital to get his emergency surgery. And NIHB would not send him out for that process. So we've all got examples. Each one of us knows exactly. And so what we're hearing is something's got to be done. Something's got to be done now. So, okay, Antagin, Chief Loon.
Good morning, Chief Loon, Mushkegongwan First Nation. Just before I make my comments, I'd just like to acknowledge today. I apologize for showing up late this morning. And I say may wish to Creator in my way this morning as well. And I always extend my prayers to all our nations, our community, our surroundings, and their struggles as a First Nation groups, communities, nations. When we're talking about any suggestions, solutions, or ideas on how to push this forward, other than spinning our wheels, I mean, one of the ideas that I came across or thought about, not only by myself but other past leadership and current leadership, and we all experience in all different sectors that I seem to find, and I'm sure every other nation finds this, that we're always dealing with the bureaucrats and how they try and implement the programs in whatever sectors they are, and that they're all policy driven, and that's where it seems to start when we're spinning our wheels. One of the reasons why I wasn't here yesterday is I took the opportunity to go to Ottawa and meet with the minister face to face, because I felt it's that important to not only pass that message, but also to obviously advocate for my nation, but also NAN Nation. One of the suggestions that we were talking about or thinking about is maybe having more of the political nation or the politicians have these types of talks, because it does come from them, the ministers, the bosses, if you will, to push this forward. And one of the ideas we've had was maybe perhaps try to have a meeting of sorts once every month or 2 months, whatever, what have you, to make sure some of these issues that we're dealing with are pushed forward at those levels. Because when it gets down to the bureaucrats, it's just all policy and they go by the book. I mean, we all experience sometimes when your boss tells you to do something, you're going to do it. And if we're going to start thinking about some ideas, and I think that's what we need to do, like we have to sit at those tables, whether it be a trilateral table or a bilateral table with some of these government officials, and that's what we need to do. And I'm finding now as a First Nation leader that's what I need to do to really push some of those efforts I have on behalf of my nation. And it does work, but sometimes I think that's one of the ideas I'd like to extend to the nation here. Thank you.
Because Chief Loon, so really good recommendation on how to move forward. So to avoid spinning our wheels. Before I go to Mike Morris, just a reminder, so Ken is still here. There was originally a full presentation on the background, the governance structure, and everything about health transformation. If you want that information, Ken is around all day today and tomorrow morning, so he is here if you want some of the background. Proxy Mike Morris.
Yeah, good morning. Mike Morris, proxy for Wagaboon. I want to say something about myself. Was 2.5 years ago, in front of my family at the nursing station at Casablanca. The doctor sat us down and told me I was going to die from cancer. That's 2.5 years ago. There's no cure for stage 4. I can only be treated with chemo. I don't know how much time I have to bug the rest of you, but I do have that time. The other problem I have is diabetes. And first thing I want to ask is, can we have on the screen there this structure, governance structure that is being mentioned here? If we could have that structure to look at what we're talking about with this health transformation. And I asked the director in Moosonee, what is health transformation all about? Slifna has been doing their work for the last 30 years. They have a lot of staff. Their budget is way up high. So they're operating and offering services to our people. I asked him, is that the plan to take over Slifna? And his answer was yes. And that's something that needs more discussion. Like to all of a sudden take over an organization that's been providing health service to our people for over 30 years, 20 years is not good. The other thing I want to bring out is I brought it out one time. I went into a wrong meeting at Thunder Bay. It was a health transformation meeting, and I listened. And after listening for so long, I asked the presenter, why aren't you basing what you're doing on a treaty right to health? There was no mention about the treaty right to health in that presentation, and I don't see it here either in this paper that's being handed out. My own problem is diabetes, and I have that too. I have diabetes, and I know that I'm gonna face amputation. I don't know when, but it's on its way. But I never see a doctor about where I am with this diabetes, and all I get is a blister pack of pills to take each and every day. That's all I have. Nobody from the medical profession has ever come forward to say, this is where you're at and this is what you can do. Nothing at all. And if the idea is to take over Slifna, and that goes with the hostels that they operate, the 3 hostels they operate in Solacott, there has been cases of discrimination by the staff at these Slifna facilities. Never mind the discrimination at Minnehaha Hospital. So we need to. I'm hoping that what you're doing will address what is happening. I don't think it's nice to take over a Slifna or Minnehaha Hospital if the discrimination is present among the staff. The only thing I want to ask about for Casablanca is where I live and work. That I'm very glad because of, I guess, haggling all the time that various service providers have been coming to Casablanca. You know, counselors, whole bunch of them. You know, we have a whole bunch of them that come in, but sometimes they can't come because we don't have accommodations for them to stay when they want to come and work with our people. So you know those nurse health services buildings in our communities, we need to ask for them. We cannot allow professionals that come and help our people not to be able to come to work on our people. So that's all I have to say, and thank you very much to everybody.
Good. I'll get Grant Chief to respond. Proxy Mike Morris, proxy for Wawa Gabiyun. Mike is also a band counselor in Casablanca, so that's why he refers to his home in Casablanca. Grant Chief.
Yeah, miigwech, Mike, for your comments. I think it's very important for everyone to understand that this new entity that we are in the process of creating together, that we will build together, will not take over anything. Like, will not take over SLIFTA or WAHA. They have their own mandates. For example, with SLIFTA, you know, the panel report that our elder Wally McKay was a part of 35 years ago, along with Dr. Bain and Ted Scott. They traveled throughout our territory that winter after 5 men from Sandy Lake sacrificed their health to stage a fast at the Old Zone Hospital. And you may recall, and I remember this because the meeting happened, the Quorum conference in the summer of 1989 happened in Musquata. It was hosted by my community, and I was there just as a conference coordinator. That was my role. And that report was presented to the leadership. And I remember after hearing all the recommendations, they said, we will accept only one recommendation, which is to create a regional First Nations health authority, which they did. And then they also said that this new health authority that we are creating will, their role and their task is to implement the other recommendations that are in the report. And that's how SLIFTA's role or mandate came about. I tell the story that SLIFTA was born in my community of Musqueam because that's where it happened. And we know that they're struggling. You know, they have a huge mandate, but because of the demand that they are struggling. Like, for example, last week we heard or we saw in social media that they're eliminating the local transportation service in Thunder Bay, which is a big deal for someone who does not have resources to pay for a taxi, to try to get to a hospital or a clinic. And even right now in Thunder Bay, with the renovation that's happening in the hospital, it's not readily accessible. You get dropped off somewhere, then you have to try to find your way to the door, the main entrance at the hospital. If someone's on a wheelchair or someone is not mobile, that's a challenge. And so these are some of I think the real needs that we need to work together on. And we had hoped that tomorrow's Friday, that we would meet with some of the leadership from SLIFNA, from the Swillicode Zone Chiefs Committee on Health, along with our NAN Chiefs Council on Health Transformation to meet and collaborate. But unfortunately, because of what happened in KI and also a tragic event in Laxwell, that meeting is called off. But we hope to have that meeting very soon because it's important that we clarify our roles and responsibilities. But just quickly on governance, you know, that decision belongs to you. And it's so important that we engage in these conversations. That's why we are committed to working with you directly, whether it's by video or an in-camp or a community visit, to talk to you directly along with your council and your people.
Miigwech, Grand Chief, Chief Wabas.
Miigwech, Chairman. Miigwech, ganin janano dawas yan. Ego, nikagote naban recognize one of our elders, our former Grand Chief Stan Birdie. Pinama ganano dawas, and I'll get him to speak up as well on this issue. What's happening with our health services up north is non-NIHB, non-insured health benefit office in Sulakaut cannot manage. It seems like they cannot manage the number of patients that need to get to their appointments. There are so many patients that need to travel, and they are the ones that pay the travel for them from their community to their appointment, Sulakaut, Thunder Bay, or whatever. So what's happening is people are waiting for their travel confirmation. They're waiting for travel confirmation from non-insured to confirm that. And sometimes they have to call, or most of the times everybody calls them. And non-insured staff, what they've done now is hired more staff to manage those calls and make those travel arrangements. That's what I was told. But it's not working. Like the administration of travel or patient's appointment and all that kind of stuff is not working for some reason. I don't know what's going on. Like we need to find out what's going on in order to determine a solution. We need to find out what's happening there at the non-insured office, or whoever is arranging these travel arrangements, accommodations and everything. From my experience, if you want to be a contractor, for example, if you want to be a contractor to do accommodations in a city for patients, you're a contractor, and then you provide accommodations and everything. You have to claim those costs to non-insured health ISC. What happens is when you make a claim, there's a detailed claim that you have to submit every transaction that you had made, and then what happens is they won't pay it right away. They'll probably pay it the earliest they'll pay it is 3 months or 6 months to a year. So that operator, that contractor, is carrying the debt. That's what's happening with the Wikwaidung, and that's what's happening with Slipna. And others that are the hotel owners in Thunder Bay are having that issue. It's because of the claims, and you submit the invoice and you don't get paid right away. That's what's happening. Like if you operate something like transportation or accommodation, you're going to be out of business in no time. You're carrying a lot of debt, and ISC Health non-insured are not paying right away. You know, that's the reality of it. And I think we need to really look at the administration part of the program. You know, that it's an isolated incident between the patient, the escort, and the non-insured. There are so many out there, so many issues. If you gather up all that grievances and everything, there's going to be a lot of people having problems with the services. So people are demanding better services. You know, immediate response from non-insured. You know, get things organized. Like they need to know their travel to get to their appointment 1 week, at least 1 week ahead of time. So it's the administration of non-insured or like medical services for our people. That's the problem. It's the operation. It's the operation. And the other thing is the flights that go to our communities. Sometimes they have to cancel. Sometimes they have to delay. Sometimes they have to, you know, reschedule their flights, and that affects their people's that want to go to their appointments. They miss their appointments. It's because of an airline made those changes or canceled a flight. And then when a patient says, I need to rebook my you know, travel, and uninsured says, you were booked already. You know, you were booked already. You were supposed to be there at that time, but airline canceled that flight or delayed that flight or made changes, and it affected the appointment. You didn't attend your appointment. It's because of weather delay, airline delays, you know, and it's affecting everybody, you know. And they see it as you didn't attend you didn't go to your medical appointment. No, we're not going to pay for your travel. You know, there are these issues that's happening with people, remote and isolated community patients that want to go to their appointment. So that's what I wanted to present. It's the operation administration of the services, the people that are operating there. I don't know if I don't know if they're being restricted to you know, to a certain policy that will kind of limit the flexibility. Yeah? So we need to look at that. I would like to call upon our former Grand Chief Stan Birdie to you know, speak up on this issue as well. As you know, if you follow on my Facebook, I talk about this medical services on my Facebook. So anyway, so I'm getting a lot of response from everybody. So anyway, Stan.
Stan Beardy.
Watje, staan weer in de ziekenhuis. What's going to make doji? I used to sit with you a while back. I had the privilege to be a Grand Chief, and I worked with a lot of you, and I learned a lot. I was also a regional chief. When I was a regional chief, I had a health portfolio for all of Canada, and I learned a lot what's happening at the very top. One of the things I want to mention is the position of thinking they have in Ottawa I think what we're talking about is very critical. We're talking about the very health of our people, our children, our elders, and help is needed right now. Right now, help is needed. And I know you're talking about transformation, what will happen hopefully sometime in the future. But the urgency is today, where the people need help today. So when we talk about the issue, I think it's really important that we understand what the issue is. As I mentioned, when I was at the FN, I had a privilege to meet with the Prime Minister on this as well. And I asked this very question because the underfunding of health across Canada for our First Nation people. And I asked the Prime Minister, I said, when are you going to begin to address the health issues, urgencies, matters for our people? And he looked at me and says, why do we need to duplicate delivery mechanisms? That was his response. So as far as the government is concerned, the system they had developed, imposed on us, is working for them. And I think when we talk about how do you begin to address the issue, we need to understand what the issue is. So the problem we have then is that when we look at the services we get on reserve as First Nation people, they're all policy driven. On reserve, all those services are policy driven. What that means is we get leftovers, whatever's left. And we don't have a legal mechanism because they're not legislated on reserve what is minimum and what is the standard that should be there. So when we talk about the issues, one thing's trying to do patchwork, but I think it's going to get worse with the challenges we have today. So I think when we talk about the issue, if we wanted some action, it's good to have meetings, but I think we need the chiefs need to put pressure on the governments to get that message out there. Because in the mainstream media, you don't hear about the challenges that our people are experiencing. We've lost a lot of our people because of missed appointments, lack of cooperation from the health departments, the frontline workers, the practitioners, the doctors, nurses are trying their best, but it's the funding aspect that we're struggling with. So I think we need to get the message out to the general public to say, we are suffering. Our children, our people, our elders are suffering. Something has to be done. A few years ago, when we were after a new health center, new hospital in Solcode, there were people that took direct action where they went on a fast for a number of days and they attract national attention, and that's how the new hospital came about. That's how the health authority came about. So I think we need to talk about, is it time to take some direct action and get our point out there? Because as I mentioned, it's one thing to have a strategy. We can continue to have our dialogue for immediate improvement of health services. But if we're going to stop and improve what we have, I think there has to be stronger action. Maybe a direct action is required in Ottawa and Toronto to get our message across. We had to get a national media to support the struggle we're having. I think right now, when you look at what the government's plans are, the Prime Minister's plans in terms of developing, strengthening the economy and funding partners across the world, they're looking at that developing our natural resources within Shnabyaski. So I think when you look at the scenario today in terms of what the government wants, I think you have a leverage to do something today to improve the health services for our people. Miigwech.
Miigwech, Stan. So we've heard some recommendations. Chief Loon recommended sort of a political table. I know that's part of the strategy, but I think what I'm hearing is immediate priorities. Let's deal with those at a political table with the actual decision makers at government. And I think that's what I'm just hearing as well from Stan's comments. We need the politicians' government to hear. And as Chief Wabas indicated, there's operational and administrative roadblocks, and those are at the bottom end. And that needs to be heard at the top. So there needs to be some kind of a strategy, is what I'm hearing, a PR strategy, some form of direct action. Something has to happen to make the politicians understand and make those changes to avoid those roadblocks, is what I'm hearing. I'm going to go online on Zoom. Chief Kustajan Mitarawaban. I think I saw your hand up earlier. Chief Kustajan Mitarawaban.
Good morning. Wajik, Mr. Nahanik. Mr. Nahanik and the Gatayak, Mr. Bogatachi Mitana. Egama just Pamashikitayan. Miskasita, and Nigga Mr. When a kind of Gaguna Hatchikasaga Hagano. Ninistimana Nanustiking Hanan. Payakuniga Hegamo, Hepe Hoyak Mabo to Betsy Haganot to Betsy Masters what you Maya, Mr. Chinihoya. What you mamma send the dog and again. Usaga Hagana, Kaka, Mr. Boom, Mr. Gana Mr. Chick. My gosh, good morning, everybody. You know, this is a very sensitive topic as well, because when you talk about health, everything is interrelated from everything. We can't just talk about land when you don't talk about health or the water or everything. It's all interrelated, and especially the mind, the physical aspects, and from everything. And it's very dear heart to me because I often heard my dad spoke of the challenges in just accessing healthcare and just getting service within our regions. And that was the most frustrating part, and it continues today. And I find it very frustrating because we're a diverse nation, and there's 49 in our NAN community. How do we ensure that every regions, every points, whether you're southern, north, east, west, that we all get service under Anishinaabe Nation and the work that they want to do under health transformation. No region should be left alone, because I want to ensure that the work we have been doing and trying to work with our regional hospital continues and does not hinder the process where we want to go today. Because I've been trying to bring out the issues on how our regional hospital has not been servicing our people to where it needs to be. And as a chief, it's frustrating for me just to have my voice heard within the structure that doesn't allow me to have a voice. Because a lot of our members do come to us, and a lot of our members do experience the challenges, the shortfalls, a lot of things. And the things with NHIB, there's a lot of stories that continue to happen till this today. And we're at different levels, I think. And I want to make sure that that's addressed in these discussions. It can't be just one part of the nationhood. We have to address like the southern communities, they have challenges too. They have unique challenges when it comes to accessing their health care as well. And we can't forget them as well. And how do we make it inclusive for everybody? It's just what I'm saying. It's going to be a quite a challenge. And I'm not saying there's not people that work within these systems, or especially in our area, a lot of them are our own. It's just the structures and the policies at play that continue to control our life is still, that's the question. And the policies and the laws that continue to keep us where we can't advance. And I agree we should have more political discussions on top political tables, but we've been creating our own tables on the side too. Even in our region, the regional hospital has a trilateral table, which I'm not even a part of. They have a seat there, not us. And that shouldn't be. How do we move from that? Although you recognize SNFNA and WAHA, but they're not the voice of us. It's through structures, the corporations. So how do we ensure that our voice gets to be heard and our people's voice gets to be heard? And it's also a treaty right. You know, how do we ensure that no matter which tables we engage, that we don't erode that right? And that's the question I have. And yet we did look at the document that was set forward by Grand Chief Fiddler, and we did our own analysis of it. So we're going to forward that to him, just to have say of what we thought of it and what our recommendations would be in moving forward. But you can share that with the group later if you wish, the own group that you are working with. But that's what I'm afraid of when moving forward, because we're at different levels. And they already had their trilateral tables, I think. But what's happening, I find, and most of the time when we engage with political officials or the ministers, is that, yeah, they say good words, good feeling words, but it actually just gets trapped in bureaucracy. Bureaucracy, no matter what they say. And that's where we have to push more, to push that policies, to push the change and reform in policies that continues to undermine our worth and our dignities. I'll leave it at that. There's so much to say on this file, but you know, there's so much that could be said and have been said, and so much work has been done, and yet so much work needs to be done. But it's the very heart of who we are. My camera's not working. I didn't test my camera, but sorry. So, okay, I'll leave it at that for now, but you know, Minglish,
Thank you, Chief, for those comments. So as of right now, we have Chief Benson and then Chief Gagnon, and then we'll be able to take one more after that, Chief Kakigamic, and then we'll close the discussion as part of this forum. Chief Benson.
Thank you, and good morning to you all. I'm a Nigajaba. My name is Cornelius Benson from North Caribou, Round Lake, Wiagama, whatever you prefer. Wawiagamang. Good I want to go on record that North Caribou voices concern regarding this issue in IBA, Erminuez, Slifna. Yesterday, Jnagok, Kenina and Ematsian, web music and gas, music attic, Wagagizigak. Miashes Segban, Chiki, Mamin Nagatic, Chiki Mamo, the Nojagatic, Hukumakanik. Kenin Tendian, the Batsamun, When the most this ni mag-eso at Gajawat's appointments. I have heard many stories from my people regarding the appointments they go to, whether it be in Sulcoat, Thunder Bay, or Winnipeg. You know, most of these that travel don't have jobs back home. They don't have money to spend for themselves. I know because I myself have experienced this as a patient. I travel myself to the appointment by road, like in Thunder Bay or Sulcoat. And I end up spending quite a bit of money, my own pocket money. Igapan gagi sigigi shuchigon, chigiwichigon bandish. Again in guys the bendauzian mo treaty. When uge gab me watch travel and accommodations, meals. And when uge ni no in the 7 we go by air or by road. And those people that travel by road, some of us make claims or some don't. You know, when you look at the reimbursements of kilometers that you're supposed to get back, it's not even enough. The way it is now, the gas is very expensive. You know, these are the type of things that my people go through. And I think, you know, when I hear other people, other chiefs speak their concerns, we are in the same. Mima bejo kung ganyan deang. Ami ay chasha jigi sig. Jigi yung bagabunanong. Jigi ang kategwe. Wagaj matsuats. Itin snimnanak. Kebuge kchakamatoats. They need translators. I don't know. Honestly, translation service. There are some I understand, but not always. Smagi gonji sigesh may misdiagnose a gonjats. Igagagi kanujitamas. So I think this mess that we're in should be cleaned up now, not tomorrow. And that's the reason why I'm speaking now, that I support the other chiefs, their concern. And I went on behalf of my people to clean this up. Thank you.
Rich, so we've got 2 more. I had previously said we could take 3 more. We identified those 3, but I see a hand up. So again, I see 2 more hands up. We've gone into our break. We're approaching the next agenda item. So again, this is the challenge we have as co-chairs, because we know you want to get to the next very important agenda items, and yet we don't want to rush the discussion. So I see 2 more hands that were raised. So if we can, I'll recognize the 2, Chief Wesley and Proxy Wesley. So I'm going to add those 2 and then close it for real this time. But please, again, help us help you if you can try and be brief and concise, because we need to move on to the next important items. So I think we were going to go to Chief Gagnon, Chief Kakagamek, and then Chief Wesley, and then Proxy Wesley.
Yeah, good morning, all. Yeah, I just I guess I was trying to save this to save what I wanted to say on open forum, but I think it needs to be said because what I'm hearing for the past 2 days are issues from the community. Like yesterday, we talked about airport safety, water, and I heard a lot of issues, but solutions I didn't hear. And again, this morning, we're talking about health. We talk about issues, concerns, problems that we encounter. But we never ever discuss solutions. And I'm going to point fingers here, but I think as advocates of my First Nation, I think NAN has a lot of, lot to do on what issues that we have to correct what is wrong, especially in our health. I live in a, drive-in, road access community, but I got the same issues. Our people go to Geraldton District Hospital. The first thing they ask is that we don't, the first thing they say is that we don't, give opiates or drugs. That's the first thing they say. And the second thing is that they send them home. I've had 2 deaths that happened in Ireland because of patients being turned around at the hospital. And we're talking transformation. That's going to happen in what, 2020? I can't hardly see this, 2029, 27. And people need assistance today, yesterday, even tomorrow. I think we need to be a little more political will needs to happen so that we don't lose another patient. They don't lose another important appointment. And sometimes, direct action is something that we need to do, sometimes as politicians, to save a life. Again, I don't want to blame, point fingers. I come to these meetings to look for solutions. How can we work together as 49 communities to say, here's what we can do. Here's how we could move forward. I'm seeing resolutions dated back, the 20s, and it's kind of sad to see that things are not moving forward as quickly as we intend them to move forward, so that we can properly represent our membership, be it education, social, health. So again, I just can't go home today with status quo, because that's not good enough. I have members I got to take care of, especially with this agenda here right now in health. We have the same issues: missed appointments, no rides available, and it is their treaty right to have access to all the services that they need to look after their health. So what I'm saying now is that we need this organization to roll up their sleeves and start doing things that are priority to our communities. Now, this transformation started in 2017, and to me, that's a little too long. How many lives have we lost since
we started talking about transforming our health. So again, without having to play the blame game here, I'd like to see some action being taken by our organization to address the needs that are being addressed today, the concerns that are being talked about today. We just can't go home knowing that your conscience is telling you that, you know, you came to a big city and that was it. You got to go home and tell your people, here's what I achieved. Here's what we achieved as a collective 49 communities. That's what we need to do. We got to come up with solutions. We hear the concerns, we hear the issues, but to every concern or issue, there is a solution. And that's what we need to direct this organization to go work on, is the solutions that we need, so we don't have to lose people dying because, you know, the system is failing them. But I'll save it, like I said, saving this for open forum, but I think we need to really streamline on what we do collectively and make, you know, give it the political will that is required to make the necessary changes so that our airports are safe, or our water is, you know, clean, and so forth. Every issue that we come up with, resolutions are fine, but usually they collect dust. Again, take no offense, but that's what I see and what needs to happen is direct action sometimes that we need to do. And you know, losing a 3-year-old grandson, that's not acceptable in this day and age. Simply not acceptable. So with that, I thank you for listening to me, and you know, I feel that I need to say this because the fact that we're always spinning our tires, there's no traction. So we got to find traction to move forward in the issues that we have in our communities. Thank you.
Miigwech. Thank you, Chief Gagnon, for reminding us all that this open forum on priorities is about solutions, finding solutions. And that's what we're looking for. Give us solutions. And so I thank you for that. Just a reminder, as part of the brief presentation, there were 2 things identified already as priorities. One was medical transportation. The team has identified that. They've also identified mental health and addictions. Those are 2 that they've identified. We're asking, what other immediate priorities do you have? And what is the solution? How does the team move forward on that? So thank you for bringing us back to that and reminding us. We're looking for solutions. We've already got solutions presented. Chief Loon said have a political table. That was actually part of the plan, but that is the requirement. Chief Wabas talked about the bureaucracy, the challenges there. Well, take it to the political table is what I'm hearing. Chief Benson said, we have to stand up for the people. And that's what I'm hearing is potential solutions. So, Chief Kakayamak.
Good morning. While we're on the issue of health, I'd like to introduce Cynthia Fiddler. She's the chair for SLIFNA. If anybody has, if anybody would like to have a chat with her regarding SLIFNA, she's open to talking with anybody. Cynthia, can you please stand up? And that's Cynthia Fiddler, chair of SLIFNA. If anybody has questions regarding SLIFNA, she's open to discuss whatever might be on your mind. Yeah.
Chief Wesley.
Anyways, that's supposed to show how mad I am. It's Chief Wesley Catholic. So I'm going to try and make this short. And I'm a little irritated by our own procedures and inaction on issues like health transformation, health issues experienced by our nations in general. You know, all the communities describe what's happening to them in all sectors, every sector in the health experience. But I kind of want to remind, following along with what the Chief Gagnon said earlier, and some of the other chiefs are saying the same thing. Back in the fall assembly, I had raised the issue about taking greater action on the ongoing FINIB issues, and to the point where I had said that maybe we need to come back around and re-engage the 85 Sandy Lake experience, something at that scale. But it has to have a significant impact where government has to focus on the ongoing health crisis. So that's what I said in, I believe it was November. And what irritates me about this whole discussion, ongoing discussion around these issues that we keep raising from our communities, is that NAN is too focused on program-based agendas. There was an opportunity in Timmins to advance this issue on behalf of our communities. That's why the directors had the opportunity to voice these same concerns that we keep facing. And we're here again. And like everybody's saying, we're just spinning our wheels. It's part of health transformation. One of the things that I'm encountering, trying to change the in-community health delivery system with the Title Care project, which is an innovation of a telehealth program, is we're running into a lot of policy issues, just basically every level of the way. But one of the most saddening things about working with Title Care and trying to improve the telehealth system is our own community silos. My money. And that's sad because, when you think about a project like that, you're actually changing the health system, you're improving health systems, you're cutting short the patient experience, you're achieving early detection of significant diseases. But I'm just saying that how my council is actually paying for their own patient charges 5 at a time. That's costing a lot of money because of the cancellations. Yesterday, when we were talking about the aviation part with Mike McKay's presentation, I was explaining the situation that Cat Lake is in because we're uniquely geographically isolated. And it's costly for us because these patients are specialist appointments. Sometimes they're waiting up to 9 months just to get this appointment. If they miss that appointment, and then they get on the shit list, pardon my French, with FINIB. And then they don't get that specialist appointment. And by the time they get to an actual appointment, they're dying. And this is an everyday occurrence for our communities. And I just want to echo what the other communities are saying, is that we have to elevate this to a policy and funding level. We can't be sitting around here talking about it the next assembly. Next assembly, the executive should be presenting what the results were of a sit-in or something. Because next assembly, I won't find acceptable if we're talking about program-based agendas again. I want to see some tangible results on some action taken by us at the next assembly. I don't know. It's getting to the point maybe we take the minister hostage in the next hour or so because she's here. She's going to be here. That's just how it is. It's bad. It's bad. I don't know how else we can describe it. Anyways, I'm just going to leave it at that. We need to do something big.
Miigwech. Thank you, Chief Wesley. So we're about to wrap up. This is a forum on immediate priorities dealing with health. So we're one more. I had said one more, and then we would close. Proxy Wesley.
Proxy Wesley from Constance Lake, Roger Wesley. As long as we have Mr. Gooch running our show, we'll always be in this problem. We will always be in crisis as long as we let the white men run their show. That's what's happening here. INAC, maybe they're not white men anymore because they hire all kind of people from foreign countries, but they're still running our show. And they could give a rat's, you know what, about us and our sick and our kids, our elders, our specialist appointments. This has been going on a long time. This is why we fought for health transformation. Health transformation is a bigger picture to address the bigger picture. But this NHIB travel right now, that's crisis state. And we need to do something. As you heard all the chiefs speak, we need to take action here. What actions do we need to take? And that's where I'm going to throw some ideas out. I think we need to take some political advocacy from all of us. And NAN can help us with that. If NAN can draft us up some letters that we can all sign as leaders of our communities and send out to all the ministers, all the MPs, all the MPPs right across this country, not just Ontario, we need to get on the national radar. Right now, we're just an afterthought and some bureaucratic front desk clerk who happens to be white. That's who we're at the mercy of. We're not, this is not a government ploy. This is a bureaucratic nightmare. And it's killing a lot of our people. It's ending and shortening lives. When someone doesn't get to their appointment after waiting 9 months, their next appointment's another 9 months. They're not going to make it to their appointment. And we're experiencing this in Constance Lake. And I'm guessing a lot of other communities are going through that right now. Civil unrest, Constance Lake is famous for. Standing up, protesting, blockading, taking physical action against the oppressors. Most often Ontario or industry. Well, we never really taken a fight to Canada. Maybe it's time we start that. Marches. Let's get on the radar. Let's get in the media. Let's get on the front page news. That's the only time Canadians, not Canadian politicians, but Canadians will actually feel some sympathy for our plight here. And legal action. Yesterday we touched on it, too much legal for my first introduction to all the legal action we've been working on. But that's good to see. This is something that we need to explore. Not the health transformation focus. NIBJ supports. That's it. If they're failing, and I've heard how many examples just here, 6, 7 chiefs. all sharing 8, 9 examples each. We have the evidence that that program is failing, and yet it's designed for us. So I think we got legal grounds here to take action. We need to explore. NAN, you need to explore that for us. And there's other jurisdictions have this problem right across the country. I don't hear any barking coming out of BC. What are they doing over there? I have no idea. Maybe we need to go find out what's happening in BC. Why? My understanding is the BC First Nations have taken over NIHAB. They're managing it themselves. Maybe that's why we don't hear any noise coming out there, because they are taking care of their people. So those are some of the ideas that that are coming up out here, you know. And I don't know if we have a chiefs committee on this file itself. I'm guessing we might have one on the health transformation, but I think we might want to strike up a committee just focus on NIHP services and failures. And you know, NAN's got a lot of staff here, a lot of good people that can write stuff, that can do this stuff for us. And Grand Chief, I urge you to put your staff to task and get these letters in our communities ASAP, so we can bombard Canada with this information. This is one of Canada's best kept secrets. Once again, how they messing us over, how they're killing our people, and we can take action with political letters, with some civil disobedience or awareness efforts, and explore our legal options here. Those are 3 of the key things I see, and I'm calling it a multi-action strategy because it's required. Our people are dying right now, and in the end, someone take the minister hostage. Yeah, I'm all in, but let's make sure we got CBC, CTV, and everybody else outside these doors when we let them in, and she's right there, sitting tied up to a chair. Let's we can do that today, albeit that's not our way. But you know, those are kind of thoughts running through my head, because I got people calling me, missing appointments because of they don't have a transportation ride there. And we've heard our communities, you know, we're not the mainstream Canada where, you know, 95% of them are working and they got money to pay a taxi. Just paying a taxi is a challenge for many of our people, just because we've been oppressed and removed from the employment factor in this country and locked on reservations. So, you know, a lot of pressure. We talk about trying to change that. And we're talking through economic development and lands and resource opportunities. But the fact of the matter is this is a treaty right that's supposed to be instilled and upheld for our care and our health. And right now it's in jeopardy because of bureaucrats. 3 years ago, I had a call with NIHB when I was running our health center, and my lead contact said, "I'm sorry, sir, but we're in transition right now. We've just hired 4 new clerks to help us take your phone calls." I said, "Then how come I've been talking to 15 different people in the last week?" Because there was not one person there. There was 15 people answering my calls. So I don't believe anything that comes out of that office. And I just heard Chief Kazee say they hired 7 more. I don't believe it. They already got 15 people there. They're just not doing their job, or someone higher up's telling them not to do their job. At the end of the day, we need to get control of that program. And if they're doing that in BC, let's replicate it here. Miigwech, everyone.
Miigwech, Proxy Wesley. So I recognize that we've gone way over. We've gone way over time because this is such an important issue. And I'd like to thank everybody for your recommendations. Chief Wabas, is that about this? I did see another hand.
Yeah.
Chief Batiste. Okay, you're good with it? Before I go to you, Chief Wabas, If it's about this topic, is it just, no,
No.
it's about something else?
Yeah.
totally? Okay.
Yeah.
Let's finish this topic.
Okay.
Grant Chief's going to provide
Okay.
closing comments to this, and then we can come back to you.
I wanted to recognize one of our youth.
Okay,
to
is it
speak up
about
on this
health?
issue? Yeah.
Okay,
But
that's what I
have
was asking. Is it
have
about this
a
topic?
resolution that I wanted to present to the chiefs. That's a different matter. So
So two separate issues?
yeah,
Okay,
two
okay.
things that I need to do here:
Yep.
a resolution and recognizing the youth to
So
speak.
you want to do two things? Okay.
Yeah.
Thank you, Chief. I'll come back to you.
Yeah.
So we've gone way over. We recognize we're eating into the time for other discussions. We may not get to all the resolutions now. Just recognize that. We may not get to all the resolutions because we have already gone way over. Hopefully we'll get to the last agenda item. But just recognize that is the case. I had already closed it a number of times, but I mean, we want to recognize the youth. One recommendation I have is that next time that maybe we have the youth come earlier, like we when I see hands go up, I write your name down. I provide advance notice that we're going to close the list because we have to move on. So I encourage the youth for future assemblies, if you can approach earlier, just so that we can do that. I really encourage that because again, we want to be fair, but we are now eating away at the resolutions, so we may not get to all the resolutions. So are we comfortable proceeding? The other option is we could end up having a working lunch. So that's what we may end up doing. We already forego the break, so we may have a working lunch. So Chief Wawat.
Thank you. Quickly, this resolution, I was given this resolution on our last meeting to present. It's to support for quilts for survivors and continued healing for survivors. It's a resolution, so I'm second this resolution and moved by Chief Jason Godchair, Ms. Nabi Cree First Nation. Yeah. I don't know, like they've been waiting for this resolution, and they wanted to me to kind of lead the presentation and get the chiefs to look at it and decide on this resolution. Support for quilts for survivors and continued healing for survivors. Yeah, I don't know when will that be. Okay, I guess it's up to the chair. Okay, I would like to recognize. I'd like to recognize you to speak on this issue, on this health crisis issue. All right.
Okay, Migach.
Yeah.
Thank you for allowing me time to speak on the health transformation. I did have something to say after Sunny spoke, which was like, I don't know how many speakers ago, but I think I want to ask about okay, so what I'm noticing here is our chiefs seem pretty confused about who's directing NAN to carry out our priorities and the way the health transformation is run. And so I'm asking, is there a mandate or is there a resolution that solidifies what the roles, the mandate of the Chiefs Committee and who is selected to be on there? Is there terms of references? Is there a resolution, a mandate? What do we have backing this?
Thank you. So there is a mandate. It was a mandate of resolution from the Assembly. The mandate is given to the Chiefs Committee on Health Transformation. And so there is a Chiefs Committee that leads that work. There's also, as part of that Chiefs Committee, I believe a member of the Uskadizag Youth Council. Do we know who the member is?
That would be me, but
okay.
Yeah. So that again, like this is where I'm also confused. Is like I don't really have the history or the much information, I guess, on the Chiefs Committee.
So I don't have that either, but I know that there was a resolution There is a sort of a terms of reference, I think, for the Chiefs Committee.
Okay, maybe if somebody is within the health transformation, are they able to answer some of these questions?
Yes, now, here's the thing. We are over time. I think these are very technical. We're getting into the weeds, very highly technical questions, which is really important to ask. But that will take up another lengthy discussion, and which is unfair because Archie had just told us that he has his own resolution to deal with, and we're not going to get to them. So that is a very important question. My recommendation is that maybe the Euskadza Council, and I'm glad to hear that you're the actual representative on the Chiefs Committee on Health, dealing with health transformation. My recommendation is that you meet with the team, maybe shortly after this, and Ken is available, to go through those questions, because as a member of the Chief Steering Committee, you should be aware of that. And it's very important that you're aware, because you've received a strong mandate from this assembly, the chiefs, that have mandated the Chiefs Committee on Health, including yourself, to do the work. So important questions. My challenge right now is if I get them to come up, we're going to deal with very in-depth administrative questions when we're dealing with broader. Right now, where the question has been, what are the priorities? What do we need to do now? So that'd be my recommendation. But if you want to continue.
Yeah. So my concern is that it is not only myself that is confused about the direction of the Chiefs Committee, but it is, I'm hearing it across the room. So if we can get answers to that as a whole, rather than for myself, and relaying it to my leadership is very unfair. But I do understand the time constraints. Yeah. No.
Oh, no, I'm also being recognized by Archie.
I'll get the chair to recognize Rowan too. Thank you.
Roman, just a few thoughts that came to mind about something to think about is developing a community health code. So when I was watching the presentation and being made aware of health transformation the last couple of years as a youth council member, I see that there's a lot of issue with encompassing NAN as a whole, with having one set health transformation program. But to work with the communities to help develop their health codes, community by community basis, and using the research and development of the already established program to assist in that front. And another question that I did have is, and I think they'll also touch on a bit later, what would hold up more, the treaty right to health or something developed by a community with their health code? Because right in the treaty, the right to health is very general. It's nothing emphasized. And it also opens up a can of worms of thinking about the treaty in the modern interpretation. So how can that be interpreted to today for them having to provide that right to health versus us developing our own land code? What would hold up more? Those are just questions that I wanted people to think about. And Migotch.
Miigwech. So thank you to the Youth Council members, Miigwech and Chief Wabas. So I will now turn it over to Grand Chief to conclude. We're about an hour over now, but to conclude the presentation.
Miigwech, Chiefs. I'm very grateful to hear you for the very valuable feedback that you're giving us. I really appreciate what you had to say, Proxy Roger, Wesley. That's what we need to hear, all of us. Not just to hear, but actually act on what you're telling us. I think for me, what we are struggling with here today is the the two-tiered health system that was put in place many years ago, many generations ago by Canada. And we saw that with Indian hospitals. I was born in one. And even though these Indian hospitals are now gone, I was in Swillicott 2 weeks ago. I drove by the old site there. It's not there anymore, that old Indian hospital where I was born. But the remnants of that system are still very much working in our communities and working against our people. And that is why we need to keep working on health transformation, is to continue to dismantle those old colonial systems and structures that continue to oppress our people and deny them the right to quality healthcare. And that is why we are recommitting ourselves to continuing on with this work, to not just to dismantle these old colonial systems, but to rebuild our own systems. And we know, thinking about my own parents, my own mother, who was a healer, who delivered babies and during her life, that we had our own medicines, our own healers. And that needs to be part of the work that we need to do. And also our treaty right to health, that it needs to be central to the work that we will do. There's some immediate things that we need to follow up on. If we need to call for a special assembly just on health and health transformation, that is what we will do in April or in May. But also, how do we take the statement of principles that we signed in 2017, how do we operationalize that document? And we are working on what we call a CIP, a Charter Implementation Protocol, that we are working with the Chiefs Council on Health Transformation to finalize that document so we can sign that with Ontario and Canada. But even as we are talking about these important issues, like how do we begin to take over some of these services? That was a recommendation by Chief Quizis to look at non-insured, for example. And we know that SLIFNA, I recognize Chairperson Cynthia Fiddler and Miigwech for being here, that they are doing some of that already. For example, on non-insured, they have taken over sort of the middle part of SLIF, or the middle part of NIHB for local transportation, meals, accommodations. But they haven't taken over the front end or the back end. And so I think that's the work that we need to do, whether it's SLIFNA or other parts of the NAN territory, to look at how you begin to assume these services and programs that are currently operating or not operating in our region. So there are some immediate things that we will follow up on, and I am sure that when a minister is here this afternoon, that you will also have that opportunity to express to her directly of the things that we talked about here this morning. So, Miigwech.
Thank you, Grand Chief, for bringing that important subject to a close. And I like the word for today, and the words is for real. So for real, we are at almost at 11:30. We do have an update. So at this time, I'm going to call Matthew Angies to come and give an update on the Wawat Communication Society, the work that he's been doing. And then we're going to get right into the border security right after. And within that topic, there's actually two distinct presentations. One will be given by Gary Quizens and Brad Deuce. So with that, I'd like to call Matthew Angies up. And what we're going to suggest and recommend is that we go into a working lunch. So we grab lunch, sit down and resume the meeting, just so that we can get to the 1 o'clock when the minister is here. Because I think it is very important that you are heard, the issues that you're having in your communities. Chinano Dagwek, you guys sick?
Yeah. He's coming. Maybe I'll just take him. I'll just thank him. While Matthew is making his way up here, I just want to just acknowledge him and just for his personal leadership and commitment to Wawat over the last year and a half. This volunteering, even though he's been struggling with his own health, he's so committed to Wawat, and I know you are as well. That he calls me, he texts me sometimes at 11:30 at night, and we've been working with them very closely over the last couple of weeks to ensure that Wawat, the lights are still on, that they're able to operate. And I believe he has a little bit of maybe some positive news that he will share with us, but also the ongoing help that we all need to do to make sure that Wawat still keeps operating. So here's Matthew.
Miigwech. Yeah, I've been supporting Wawat since COVID, right after COVID. It was 5 years. Mi bugay na guan kchihak ton jikagawichiwe mi ando daman. Stam nakumanawa kumakanak kchihak skadsak magay kaya ikagoke patagan. Egoge kanujiketamago debitamagik Wawat debitamagik. Yeah, Nick Bay as a president. Ego Vivian Warsaw, vice president. Ego Mike Hunter. Those are the remaining board members. You can't make. Ginanakmagunawa inako kawichuek. Iwe kagoge match to week. Uwe Wawate. Kajikadik. He news match there's a report that has been given to you. A report. Aya anim seog naduk. Anim seog ikun ehag Wawate. Gibamujganoa. Miwe kidingina gubane Frank McKay, but he's not here. Kinoa shaho. Kagyustuig. Kinoa gigyustuna ogaban 1974. A resolution gipagdana ogaban. Eonastuig Wawate. Iwe tiyan kadang kadodank. Kagogel match to chehi kitishigisherna. Eko kakinagkendana kibabamzono. Ani gikoge dojigadegban. Chigikoge washme. Bematsgadegban. Kidenshnabi ortzonang. Egoge kitishigisherna. Watsinawin. Awashme butikoge anhkadeg. And to go give magak. Right now, Wawat is very close to phasing out. I hate to say that. That's the message I'm going to bring. But there's an opportunity for us to be able to save it. I just want to go back on my report just to clearly outline and the overview. I kind of classify this as an urgent situation with the Wawat Native Communication Society. The summary, Wawat met with you in the summer of 2023 at Kiwewen gathering. They shared their substantial debt to the creditors. And then they also provided another report to you, February 2024. Just to summarize, besides the debts, another major challenge facing the organization was lack of funding from the Heritage Canada for 2023-24 and future years. Over the years, the board had made progress in addressing the issues facing Wawat and also working on the action plans that the assessment identified. They've been doing that. But unfortunately, there are certain things that they could not do. One of them was to initiate the remittance that we provide to CRA. They couldn't do that because of the way they're funded now by Heritage Canada. Yun kapag Shunyan and Heritage Canada, what they're doing now is they have this what they call reimbursement model, meaning that you have to report on the actual expenses, and also if it's already paid, then you submit your report, and then you get your money. So that's causing cash flow problems to Skinamake. Also, Heritage Canada is waiting to see how Wawat is going to resolve with CRA matters. So our funder is waiting on that. The bookkeeper has completed the expenditures and made payment reports, and we should be getting the rest of the 300,000 at the end of the month. We did receive 180,000 out of that. For your information, Wawat, they get 500,000 every year. That's what they get. They already received 180,000, but they haven't received that 300,000. It's been kept until the reports are in. Just to compare, back in January 24, these were the creditors. On page 4, you see the creditors. Bank of Montreal, at that time, noted how much they owe on the outstanding mortgage amounts for Timmins and also Solicout building. Town of Solicout. Also, there's at that time, January 24, 2024, 134, and the rest. And CRAs, there's 2 of them there. That was a snapshot in 2024. Now, moving forward, I just want to read. Moving forward, page 5. This is the current amounts, the debts of Wawat. Municipalities for property taxes, 200,424. City of Timmins for property taxes, 149,862. BMO, it's a loan, 21,358. BMO, outstanding overdraft, 192,717. Now these are the big ones. A CRA, apparently, Wawat, they had a registered charitable number many years ago, and somehow with lack of reporting and not submitting their audit, then they were revoked. Out of that, they owe $603,958. Now, another one, CRA, they have 3 accounts. This is the big one, a payroll remittance, 1.2 million as of June. And the last one, the third one is HST, 939,602,000. Altogether, Wawat owes 3.1 million with all these creditors. Wawat, we had a good communication with CRA previously. We were negotiating with them. There was an agent that we were working with, and she was very sympathetic of the situation and understood what happened, and she really wanted to help. And we were negotiating with her, and they were willing to entertain a lump sum settlement, and they would erase all the debts. But we had to come up with a lump sum amount. And as you know, Wawat doesn't have any money. So Shibogma First Nations Council chiefs stepped up. They made an offer to purchase Wawat's building for $500,000, providing the liens are removed. So that's what BDO, our negotiator, used to negotiate with CRA. And the negotiations were going well at that time. But couple weeks, 3 weeks, last month, I would say last month, we lost that. That agent was moved to another department under CRA. And then there was a new compliance officer. And this new compliance officer didn't give a shit about Wawat. Sorry, pardon my language. So, yeah. So this person is uncooperative. He doesn't really want to work with us. And he's the one that sent the notices that was sent to Wawat. There were 57 notices that were sent to the vendors. 57. What that notice says is that, for example, like Wasea is directed not to pay Wawat, but to CRA. And all of those 57 vendors were directed by CRA not to pay Wawat. And that caused some issues with Wawat. Just to let you know about the remittance, we have started to work on setting up accounts and setting up the system in a way that they will start paying the remittance that this compliance officer wants us to do. So we're starting that. We haven't. Just keep in mind, this is not a new issue. It started in 2014. You see, that's when it started, 2014. I cannot explain why would an organization not submit their remittance. I don't know. They had the money because under the heritage funds that they get, they can use that funds to pay the payroll remittance. So I don't have an answer to why they haven't done that, because it just accumulates when you don't pay. In terms of the action plans before, pretty well the board has done everything, like the policies, and also the governance training, and also hiring a bookkeeper. They didn't have 4 years of accounting. There was no accounting for 4 years. So we had to hire a BMO to create financial statements in a way that the funder could accept it, as well as the government. So the other thing that we haven't done is we haven't hired a new CEO because of security and also a lack of money. They like to hire a board, but they just don't know whether they can afford the person. And they have posted the advertisements on Wawat every time. I think we have received three resumes, and again, the challenge that they have is they can't just make a long-term commitment because of the situation that they're in. And on March 16, we received, Wawat received an official letter from Minister Mark Miller. And it's a letter, I thought he was giving us extra money, but he's not. He's not. I've been dealing with that this morning, yesterday, trying to get clarification from his office. What he's approving is advanced dollars for next 2 years, from 2026-27 to 27-28. That's what he's doing. And anyways, the board was very happy that they were getting extra $1 million, 1.1, but that's just the money from the regular funds. But at least we know that Wawat is going to be funded up to 2028. And I did write back to the minister, trying to explain the situation that he needs to find more extra monies to help the organization. So I hope he does that. But anyways, that's that. And in terms of the Wawat's revenue, if they continue to receive their funding and also making some little bit of profits, they can be able to operate without major problems. But the major problem that we have is we have to pay back those creditors. We have to start creating. How are we going to create those repayment plans to BMO, to municipalities, and also to CRA? Solacode, the mayor, I talked to their staff. They're willing to come up with a more of a affordable repayment plan. So we haven't proceeded with that yet. I've never talked to Timmins, but I asked my friend Leo Friday to go talk to him when he gets back. Now, the options for addressing the big one, the CRA debt. I already mentioned that we were hoping that we would successfully come up with a settlement to remove all the accounts, but that's not available anymore. The only way that they would be able to generate revenue is to sell the buildings. Wawat has 2 buildings, one in Solacode and one in Timmins. Solacode is what I've already talked about. Shibogma chiefs are interested. in purchasing that as long as the liens are removed. We would continue to allow Wawat to lease the basement where they can broadcast from. The recent email that we got from the new compliance officer, they're willing to entertain the sale of so-called building, but they only want to remove their liens, not BMOs. That's their problem. I don't know if Shibogma is willing to proceed, and but I don't know. But anyways, the compliance officer is willing to do that. The other one, the building, we lost that opportunity of negotiating a settlement. We lost that. Okay, the other thing that we were strategizing about is the importance of the archives. As you know, there's a lot of archives at Wawat, newspapers that are written in our language from 1974 to now. We have these audio tapes, those old reel-to-reel tapes. We have lots of them. We kind of checked them out too to see if they're actually still working. They're in good condition. And there's cassette tapes, and also the ones that they saved in a server. We also have a video archives that are in Betamax, VHS, and also shows about puppets, whatever. There's a lot of them. It's kind of scary, or not scary. I kind of feel that one of these days, if CRA suddenly decides we're going to freeze all of Wawat's assets, they can close the door, lock the door, and then we would lose everything. So we were talking about that. How can we prevent losing or protecting the archives properly? But anyways, the idea that we had about making sure that the archives remain as it is to try to integrate it into the selling of that building with Shibogama. It will be included as one of the cheddars. I know what is that now, lawyer cheddars. You must think I dig new in one that it will come with the cheddars, it will come with the archives. Then that, at least in this way, it was still Wawat would have it. I mean, not Wawat. Shibogma would protect it for now, and it would be protected. So that way we don't lose it. That was one strategy that we're talking about. Now, in terms of the Timmins building, I saw a picture of it. It's in a rough shape. I don't think it's worth that much being vandalized, and I think we can get something for the property, the land. If we can get one of the Muskego communities to purchase the land, then that way we could use that purchase of the land to pay the taxes. Yeah, that's a plan. Now, the last big one that Wawat has to generate revenue is to sell the archives. I was given the authorization to look for a buyer, which I did. There are a lot of interest from universities, museums, and all that. But I would prefer it remains with us, the First Nations. My original crazy idea was to have the local education authorities purchase all their archives. And then we digitize all the archives and transfer the audio tapes and the videotapes into a server, a big server. And we would create a library system similar to the libraries, what they do. And all that archives, the information, everything would be under one devoted server. And once the library system is created, then we would allow the communities to access what they need, but for a fee, access fee. I came up with crazy numbers based on populations of all the NAN communities in terms of how much they would pay. And that was my plan. And when I started to meet with other tribal councils, KO and Windigo, it kind of changed because the main emphasis was what can we do so that way the ownership of archives stay with Wawat. So we came up with an idea that the ownership, the intellectual property remains with Wawat. We said that we will just when I say we, I'm talking about the tribal councils, independent First Nations, and the schools. Tribal councils would pay an access fee of 50,000 to cover their schools. Once it's ready, the schools would access anything they want from the server for free. So I already made a commitment for me, for Shibogama, our Shibogama schools would be covered for that 50,000 arrangement. Same thing with KO, Kobe, they made a commitment, and same thing with Windigo. And all that money will go to Wawat to help them. And we're hoping that the other tribal councils, Matawa, Efna, Waban, they would do the same thing, and even the large independent First Nations. So that way, they would pay a one-time access fee. And but for the rest of interested parties, we would charge them an access fee. And those access fee would be a means of Wawat to generate some revenue. So I don't know the rates yet, but that is the plan. In my last meeting, when we met with you, we talked about the utilization of AI. I'm not sure if that's, but we haven't reached that stage yet. We're just starting to plan how we're going to digitize all the newspapers and how we're going to transfer the audio tapes into a new technology format. So we're just it's going to be a 7-year project. We did the presentation and there was a PowerPoint if you need more information. And I believe that is the best way to go. That way, the ownership of all that archives will remain with Wawat. And other than that, the big message that I'm bringing is that Wawat is in trouble because of CRA notices. I don't know what else is coming. CRA has not frozen their bank accounts. With your information, we sneakily created another bank account on the side, okay? And anyways, the issue here is, what are we going to do? What are we going to do now? In 2023, you directed us, or you directed Wawat board to save Wawat. Now, today, I'm asking you, what do you want to do? Do you want to save it, or do you just want it to go down the drain? I did ask about bankruptcy with the lawyers. The only issue is that it's going to expose the board of directors for liability. They'll go after the board of directors. And we have to protect the board of directors, not just the current ones. I know that the former directors are still getting letters. They're still getting letters from CRA. And we're asking you to intervene as chiefs, to intervene and direct a NAN executive to go to the ministers and to have them halt the imposition of CRA. And also, the board has asked me at the last meeting that we had in 2023, when you told them that you want to save the organization, you did not give any funds for them to use to repay those debts. You just toss the issue to them without any financial support. At that time, it was really bad. And the only way that they survived was because of the generous contributions from those people that are listed there. I listed the ones that contributed. Mainly it's Shibogama communities and Weendigo communities that have contributed, NAN and TKG. And also, I thought Muskego, Five Nations was, anyways, Five Nations chairman shaked my hand that he will give us 25,000, but that was never received, according to the bookkeeper. So the other thing that I wanted to mention, I'm almost done. The membership fees. According to the bylaw number 1, section on page 16, section members number 2, the membership fee is $500 per year for each community. So when we were working, trying to find money, we found out nobody was paying. So we sent an invoice of $5,000. $5,000 consists of $500 times 10 years. So the invoice of 5,000 was sent to each of you, all of you, all the NAN communities, to pay for those outstanding membership fees. Only six paid, 6 communities. So I hope you will take the time to look for that invoice. If you can't find it, contact Mark or Angel, the bookkeeper. That money can be used for dealing with the creditors. So there's a resolution that we drafted. You guys have it, eh? We draft a resolution for non-executive for your consideration. So I hope you will support the resolution. For myself, in closing, mawad ganing chinedan ay kujisikusyonan itan shnabiot zonan ego gekishkunomai. All of you know the status of our language. We're losing it on a daily basis. And this is one way where through radio, we listen to our elders, we listen to their legends, we listen to gospel songs in our language. And that is one way of for us to keep our language. And if it just dies down, and then we're going to lose one media to be able to preserve our language. Even in education, they are struggling too. They need resources. The same resource that I'm talking about under archives. Just imagine once we finish digitizing all the archives, all the newspapers, and the audio tapes, we're going to have a very valuable resource that everyone will want. And I just wanted to kind of share how passionate I am with language. We have to do something. We can't just let this organization die. That's just one strategy of keeping our language going. I think our elders will cut our head if we let us die. And it's important. Elders like Wawat, they listen to each other. They enjoy the stories, and also they enjoy telling legends and in their language. I just wanted to kind of encourage all the chiefs, proxies, to support the resolution. But we need the Executive Council to intervene immediately. I don't know when CRA is going to move on Wawate in terms of freezing their assets, like the bank accounts, and also locking up the buildings. I don't know. It can happen any time, any day. So, me, I could now, or the other, I forgot to share something. Occasionally, Elder Bill Morris comes to my office. I'm not his boss, so I'm just a volunteer. He comes to my office and he talks about what is going to happen after he retires. He's expecting a pension plan, or he's expecting something. For your information, their pension plan was terminated many, many years ago. They don't have pension plan. So Jerry, Shawanas, and also Bill Morris, when they decide to retire, they won't have anything. Same thing with Mark. I just wanted to let you know on that. Mia, got you.
Thank you, Matthew, for being a champion for our for Wawat, and he's going to be here all day. So if you have any questions for him, he's going to be here. And the process that we follow is that on day 2 at 3 o'clock, any resolutions to be brought forth need to be reviewed by the resolution committee. So he will give that resolution that he's drafted to the committee to review. Because of the urgency. I see 2 hands up. Very quickly, then we're going to go into prayer for the lunch, grabbing lunch, coming right back and continuing on because right at 1 o'clock. Yeah, it's going to be a lunch meeting. Get to go. Get in them. All right, very quick. Chief Nagachi, Chief Wesley.
Hello. Thank you for the report. And yes, I think it will be important that we find ways to keep Wawate around. And regarding to, because I still have elders reaching out to me that ask, where's Wawate? I still want to hear the news, hear each other speak, or that's their way of communication, how we use Facebook today. I think that's why it'd be important to keep that, and especially our language to Agachonistai Ishikishunanon. Agone Simonashik. Agone Maga Kachabatan Hegagona Kandagaistega. Gaganinjagatega. Mingus.
Chief Wesley Catholic, I've been noted by the elders over there to ask the question on whether Wawate should consider bankruptcy to get the creditors off their backs. They can reemerge with a new name like Wawate Shnave Tibachimwin or something like that. And I guess the question is that they should get corporate law advice on bankruptcy proceedings and benefits of that. And I guess the question is towards Matthew to see if he's looked at that option.
So Matthew, the question is, have you looked at corporate bankruptcy options and renaming Wawate? This is a question coming from the elders. So if you can look at that. And also with the resolution being dealt with later today, there'll be opportunity for further comments on the presentation that Matthew had. So if you can respond.
Yeah, just to reply, we look at the the first thing that we checked was what's going to happen if we declare bankruptcy. And the most, I guess, the drastic negative effect would be exposing the board of directors. The next thing that we asked that we checked was whether it would be easy to declare bankruptcy and come back with Wawate number 2. And we were told that it's going to be hard because of the involvement of CRA and other things. Anyways, that's the short answer of it.
Okay, all right. So thank you for your response, Matthew. So I'm going to ask Wally. Where is Wally? Oh. Yeah. Okay, so it's gonna be a lunch meeting. Wally's gonna do Grace. You're gonna go grab your lunch and you're gonna come right back and we're gonna continue on with the agenda, because right at 1 o'clock, the minister will be here. During the lunch break, the residential school survivors, group have quilts that they have left over. They are at the back and they were offering those quilts to, residential school survivors. There are extra quilts there and they are in the back. Catherine, Clara, and Vanessa are at the back. So if there are any residential school survivors or you want to take one for a survivor, you can take them. They're at the back. All right.
I just want to clarify that they're not extra quilts. They're not leftovers. They were made for people in this room who are survivors.
Okay.
Because we need to honor them. We need to acknowledge the trauma that they suffer, that we all carry with us. You're here talking about our nations and healing, healthcare, the deaths of our loved ones. And you're talking about building strong nations. You can't build a strong nation on the backs of broken people. So Quilts for Survivors was founded by myself because the creator said, you quilt, do that. I said, I don't know what that means. I just started making quilts. I'm from Missinabie Cree First Nation. I live in Timmins. I have 5 amazing children, one who is on your youth council. And I just started making quilts out of my home. And the creator has blessed me with a building in Timmins to make these quilts. And we have presented over 8,500 quilts to survivors across Canada, many in our territories. My first husband went to residential school, and it caused a lot of pain and suffering in our family. And still to this day, my kids suffer because of the trauma my husband suffered. And if you are a survivor of residential school, day school, 60 scoops, you've been through the foster care system, we have a quilt for you here. Come to the back and see me. If you want us to make quilts for your nation, I don't care if that's 5 people or 500, I will make all of them. You have to give me time. I actually just came down from a sewing machine because I'm still working on quilts that are getting presented while we're still here. I really believe that these quilts are healing. I really believe that they help and they acknowledge the child that didn't get a childhood. And I'm not saying that because I'm some wise person. I'm saying that because survivors tell me that. I'm just me. I'm just a woman who loves to sew. And I'm using my gift that the creator gave me to honor my people where they're at. And I'm very grateful. Thank you for allowing me to speak. I know I'm not supposed to talk about this, but there is a resolution because we get no government funding at all, and we've been running for 5 years. I don't want your money. I want your support. So I hope that you'll pass the resolution that the chief Archie brought up and my chief brought up, because our people need us, and this is one way we can help. Miigwech.
Thank you. Don't forgive my choice of words. So at this time, I'll call Wally to do the prayer.
Miigwech. Stay on the mochkeun pag din gati na nagatuin sa monan. Hikotas ise kita na kumiyak. Michim ke mi kami ni kuyak kita menskakik. Ksemando kina na kumano kum ka se kishka. Mina ka se unaptaj uniganich tamagik. Ukan ab makono baksen makono. Kina na kumakote benchikin. Kaknagekong kaje uchistamagyak ta an kinaganak. I thank you, Father, for this day. I thank you for all your blessings. For I know there is abundance on your table. And Father, I thank you for the food. I ask you for a blessing upon each one. I pray this in Jesus' name. Amen. Oh, thank you.
All right, welcome back, everyone. I know, chiefs, you're still getting your lunch, but this is a lunch meeting that we're going to be having. We'd like to get started. We got two more topics before 1 o'clock when the Minister of Indigenous Services Canada is going to be joining us. So we need to get through these two issues. If the drum was here, I'd get them to. So can I have your attention, please? We will get started. We're dealing with border control. Chief Gary Quizis from Niskandaga will be talking about winter road security. NAPS is here. Deputy Chief Brad Deuce will be talking about border control in general. And so we'll do that first, and then we'll come back to Chief Quizis for his presentation. So this one, we'll try and keep it at 15 minutes, and that'll give about 25 minutes to Chief Quizis. So if I can tone down the discussions, please. I know we're still getting food. If we can get your plate quietly, come back, and we will start the presentation. We got you.
Thank you, sir. Good afternoon, everyone. I just want to say thank you for allowing me to speak on behalf of Anishinaabe Police and the communities to discuss what we refer commonly as border control. I know that this was presented in October of last year, where we call it the NAPS border control, where it initiates our special constables to look and to help out our communities when it comes to the ingress and egress of individuals entering our communities. So that was a pilot phase. It's still continuing. So it's one of the areas that we are looking for to help us protect the border entries that we have, and that's with hiring special constables that are employed by NAPS to help do searches at the airport, to help do searches at winter road checks, things of that nature. There's three phases that were, just to reiterate back on that, there was three phases that were initiated to help establish this program. The first phase was to pick 6 communities to help identify where we're going to start this. We call it the pilot phase. From that, we had our legal team work with those communities to help establish BCRs to help this process out. And the gist of it is that when we have individuals that are coming to our communities and they're expressing the fact that they address that they don't know that they weren't allowed, that they weren't supposed to be bringing drugs into the communities. We want to try to take away their expectation of privacy to the extent where they can't say that. They can't use that as a defense to say, I didn't know that I wasn't supposed to do that, even though it's illegal. And that comes with a BCRs that's with our legal team. It comes with proper signage that's posted everywhere that basically states, upon entering this community, you will be searched. No ifs, ands, buts about it. You will be searched. You, your luggage, your packages, everything you have will be searched. And we're going to take their expectation to think that they didn't know that, to the point where we're still looking at putting it into, I guess making signs up. We're putting it into our, I guess our airports. Some of the airports, there's out of Winnipeg, and have special signage that actually indicates the fact that, even on the tickets, so to speak, that, upon entering these communities, you will be searched. Through our pilot phase, we've identified a couple setbacks, one of which is receiving the adequate applicants to establish this new initiative. And we've spoken at length to some of the political powers at B. One of the main areas is that we've identified that to be a special constable with NAPS, you must require, even a constable with NAPS, you must require a valid driver's license in the province of Ontario. Unfortunately, a lot of what our analysis has indicated is that a lot of these individuals don't possess the valid driver's license to go with this program. So we're working with a few of the tribal councils, Matawa being one, to try to circumvent this process, to try to get individuals the proper licenses that's required. Some of the communities also follow suit with the same concern, where they require individuals within their community to have driver's license for liability insurance, things of that nature. So we found that was an issue that we came into. So it's a little bit, we're setting it back a little bit. It doesn't mean that the whole program is in and of itself is done. These are what pilot phases are for, to get rid of the hiccups that come in. So that's the little bit of an update on that one. So stay tuned. Some of the other initiatives, although in keeping with the theme of border control, where we've listened to a lot of the chief and councils that are out there, a lot of the communities about what we have going on. We've established and we've focused on enhancing security at the community borders. We've engaged the provincial governments for sustained funding. We've received funding in ways of in two avenues that we have. So through the proceeds of crime grant, we've secured a number of automated license plate recognition camera systems, and those will provide surveillance and intelligence gathering capabilities desperately needed to effectively disrupt the flow of drugs and other associated criminal activities. So what these ALPRs is what we call them. They're combined with a CCTV camera, and they'll be established at the entry points of your communities, should you want it in your community. So what that'll do is it will engage every vehicle that's coming in. The camera systems themselves, the CCTV camera, will also engage that vehicle. It'll engage the vehicle coming into the community as well as leaving the community. So this is a great importance to us, just regarding our geographical logistics. So it'll afford our NAPS intelligence unit the ability to monitor potential Southern Ontario street gang members who are increasingly entering the First Nation communities in Northern Ontario to capitalize on the lucrative drug trade. This activity has the potential to contribute to an increase in guns and gang violence and to harm both the involved parties as well as innocent and unsuspecting community members. So with these being established at our entry points coming into the community, one of the primary benefits of these ALPR cameras is the ability to monitor and track vehicles entering and exit community. This can help prevent unauthorized access and reduce the risk of crime. They can also aid investigations of crimes, providing valuable evidence by capturing license plates. Vehicles of interest can quickly be identified and their movements tracked. The presence of these ALPR cameras can also serve as a deterrent to potential offenders, knowing that their vehicle is being monitored and can discourage individuals from engaging in illicit activities. So by implementing these cameras, it demonstrates a commitment to the safety and well-being of the community members. It shows that we're proactive and dedicated to protecting our community. And the use of the cameras can also facilitate collaboration with other law enforcement agencies and sharing our information. With these cameras, these CCTVs, as well as these ALPRs, they're called, they can help prevent and deter drug trafficking networks and crime groups from tracking vehicles and entering the community by identifying problems and anomalies that may indicate suspicious activity. These cameras can also be established with vehicles of interest. They can help law enforcement with alerts related to vehicles connected to serious investigation, meaning Amber Alerts. They can look at for missing persons. That's one of the big areas that we're looking at for these individuals, that we have people that go missing from our communities. We don't know when and where they have left. So these will help us with that, to track those individuals if they're in vehicles and whatnot, and general officer and community safety. So we've established a bunch of these cameras that'll be rolled out in the next few months. To a few of our communities. They have the use of it's what's called Starlink internet systems. Everyone's aware of the Starlinks. and they're required to give in remote geographical areas to help the communities where there's no electricity. So at least we can still have the ability to maintain them. The second initiative that we we applied for and were successful with getting a grant, they're called spectrometers. So a spectrometer is it's a machine that analyzes drugs. So it's a major one of those major border control things that we have, where we have individuals that bring drugs in. We want to know whether or not what that drug is, the safety of the drug. So as part of NAP's ongoing efforts to enhance community safety, we've secured through these grant funding 10 spectrometer drug analyzers. The equipment is a significant investment for community safety to combat the ongoing drug epidemic in our communities. So again, a spectrometer, it's a scientific instrument used to identify and analyze the chemical composition of substances when they're seized. In the context of drug enforcement, spectrometers can quickly and accurately identify unknown substance, including any illicit drugs such as fentanyl, cocaine, and methamphetamines. And basically how it works, you take a small sample of the drug, it's placed in front of this spectrometer in the container it's found in, a baggie or what have you, and it uses infrared to analyze the substance molecular structure. The results are then compared to a database of known substances, allowing our officers to quickly identify the compositions. So it can greatly aid in our efforts in several ways. So it's rapid identification of unknown substances, reducing the risk of exposure to our officers as well as community members. It's the enhanced ability to identify and track illicit substances, helping to just disrupt the supply chains. It'll allow more accurate evidence collection and analysis, supporting successful prosecutions. And it'll improve intelligence gathering, enabling targeted enforcement efforts. So these spectrometer units would be a valuable tool in our ongoing efforts to keep our communities safe and to combat the opiate crisis. So again, they're a large number. We've secured 10 of them through a grant. We've secured 8 of those ALPRs also through grants, upwards of $200,000 worth. So pilot phases right now, they will be rolled out eventually to the majority of the communities, pretty much all our communities that we encompass. Other areas that, again, these are areas with our added increased complement that we're just looking at, helping out our border security within our service. It's been the initiative since myself taking office a little bit over 2 years ago, which is my background was drug enforcement for anyone that knows me, and I've been very instrumental in accomplishing that goal and helping to accomplish that goal within our communities. So those in a nutshell are some of the areas that we're looking at to increase our initiatives, along with our winter road initiatives. Even though the winter roads are classified as the King's Highway and they're the jurisdiction of the OPP, we've still established an initiative every year to help engage individuals traveling on the winter roads. We've increased our presence on the winter roads. We've working with the communities of with OPP to help stop individuals. An example is working with the MTO out of Pickle Lake to go to the northern winter road there to ensure that the tractor trailers are secured and to ensure that they meet the standards. Out of Smooth Rock Falls, there's been investigations that have led to seizures of drugs on the winter roads from entering our communities. So, and a lot of it is just the increased safety that we want to have our officers put out there, just so that we could, continue going down this path. So those are just a few of the initiatives that we have undertaken as a service with respects to border control and safety. And that's the time I've got for you today. Thank you again for allowing me to speak here today. Thank you again.
I know that there are questions, but we only have 25 minutes for Chief Quazis for his presentation. Chief Quazis, if you want to make your way up, it's a potential solution. It's a potential solution and some options that Chief Quazis would like to present. Chief Nagoji, can you make it brief while he's making his way up?
Oh, yes, I can make it brief. Just one question that maybe I did bring it up with Deputy before, but It's the bylaws that First Nation creates. How can we apply more pressure to the government so that they can be enforced as well in the courts?
Great question. So currently what I also sit on a number of bylaw committees. One I sit on with a number of individuals within this room to help look into those bylaws, to help try to figure out how we could provide enforcement as well as provide prosecution on those. So it's an ongoing process. I don't have a quick answer for you right now, but it is being tabled. I also sit on another committee with the Canadian Association of Chiefs of Police, where we also speak about individuals and from a broader perspective, even with the OPP, about how we can, look at these bylaws and help with the enforcement. It's not like the officers won't do it. It usually comes down to the prosecution. How can we prosecute some of those bylaws, which will aid in the ability for us to do the work that we want to do. So it's enforcement / prosecution. That's one of the areas of concerns that we're looking at, but it is on the forefront with us. Thank you again.
Rich, and again, thank you very much to Brad Deuce and the Anishinaabe Police Service for the brief presentation. So now I'd like to introduce Gary Kozis, again, separate topic, but related. Chief Kozis from Niskandaga, who also has a team. I believe there's somebody online that's going to be helping with the presentation. So a reminder, Minister of Indigenous Services Canada, he's here, will address the Assembly right at 1 o'clock. And so we need to get to that right at 1 o'clock. Chief Kozis.
Okay, Miigwech, Adam. I know there's a lot of chiefs are out there, but this is a very important topic regarding our sovereignty. It relates to the children that we've been discussing the whole week, because all these social issues come in one, and we're all impacted. We put a checkpoint this year. We reach out to other communities, neighboring communities that are on the same corridor with our Matawa corridor. So there's 5 communities that put this checkpoint together, and it's very it's eye-opening for me myself what the stats are. We use our own funds because we love our community members, we love our children. This border security is very important, from preventing from losing a loved one. We have lots, we've seen lots, we hear lots every day, losing a loved one due to a drug overdose, kids getting apprehended. So it's I'm a little disappointed, the quorum is very small. When we talk about our own social issues, it's very, I think it's very important that we should listen to each other, because we all have same issues. Hearing the Naps here about his presentation, and we have a checkpoint that has only security. They're not police officers. When we call for a police to come when we have an incident, there's nowhere to be found. There's a jurisdiction issue. And the Winter Road is recognized as Highway Traffic Act. So where is the justice on this? Here, neighboring friend there from Round Lake, same thing. He's paying his own funds to trying to protect their community, even along the coast. Where is our justice? You know, there's lots happening there. I travel back and forth through the winter, you know, just to see who's around. You know, Ministry of Transportation, they told me they're going to be there. I never see them. It is very serious thing that's happening on the winter road. We have truckers that don't even have proper license. And we have truckers that are impaired. And we have contractors that are delivering, carrying substance. And when indigenous person carries that, you get handcuffed pretty well. We know what's the difference with our justice system here. You know, we're trying to save lives. We'd start this prevention. And when you guys seen these presentations, we hired two securities. One is Guardian Mingize. You're going to see the stats in there. We have that camera. We asked Thunder Bay Police to help us on this. So we capture everything. We capture everything what went by. And the camera captured 2,600 people traveling on that road. License plates were captured. You know, there was seizures, but nobody's charged because they're not police. You know, I did meet with OPP in the fall. They told me, we're going to travel to your community. I said, come right ahead. The road's open. Nobody never show up. We probably have at least 7 accidents. The last one just recently here, we tried calling the police to go investigate the accident. Nobody to be found. OPP says it's not our jurisdiction. And they recognize it's a Highway Traffic Act. All the police services recognize that as a Highway Traffic Act. And where are they? So that's one of the things we want to share what we did. You know, we stood up 5 communities. They all agreed because everybody's tired of losing a loved one, seeing child without food on the table. And it made a lot of difference this year. It made a lot of difference. We spent $500,000, almost $500,000 to do this from each community's contribution. So I got another person that's going to do a quick presentation. We partner up with Craig Onquin. He's a K-9 handler. So he helped us a lot and helped our security lots. What needs to be done. So Randy, if you're online there, you can share what we went through. Thank you.
Jay, quick way, Ananji Pramaj and Randy Indigenous Cosm. Can everyone hear me okay?
Yeah, we can hear you. Go ahead.
Okay, okay. First of all, I'd like to tip my hat and say Chimigwech to Chief Koozies. He's a true leader. He's got a heart of gold. I know this has hit his family, like it's hit my wife, Betty Crawford, which is an Attawabascat band member, and myself, Algonquin. That's how you get Cree-Gonquin. Gary called us in a panic, and like ourselves, we've lost a loved one in our family from the drugs coming in from Toronto, from the drug gangs to Moosonee, where we're based out of. And our one of our loved ones was murdered in Moosonee as a result of exactly this. And I retired for 31 years as a police officer with the Ontario Provincial Police, 7 of those years in the drug unit, and 5 of those years undercover. And my wife and I said, that's enough. Somebody's got to do something. So we bought 2 drug dogs, certified, qualified drug dogs, started a security business and to save lives. Not about money, about saving lives. We buried too many of our friends and our family members, and we had to do something. I want to tip my hat to Chief Nakaji of Fort Albany for allowing us to start our business at Fort Albany, and we had great success. And from there, we went to Nescandica, Kashechewan, Attawabascat, Fort Albany, Summer Beaver, and we're going to North Caribou next week. It's very frustrating. We expected NAPS and the OPP to be there more than what they are, and they're not. They haven't shown up, and we would like to see them there more often. Some nights at 3 o'clock in the morning, it's pretty doggone remote on Highway 808 all by ourselves. We've seized every type of narcotic that you can mention. We've seized alcohol in large quantities. We're seizing them off people that you would never think would be doing it. We're talking truckers. We're talking people from communities that we're supposed to be, you would think would be respectful. We're getting them from people, but we're very, very neutral, and we do a thorough job, and everybody gets searched. We have we worked very hard to have a quality system in place. Our dogs are certified in both Canada and the United States. They're high quality. All of our dog handlers are certified canine handlers, and they're OPP officers retired, NAPS officers retired, or military officers. We come there with a wealth of experience. Our business is 98% First Nation members, and we take great pride in that. The rubber hits the road when it comes to public safety, and Chief Cousy is 100% right. With Bill C5 coming now, we've seen over 250 to 300 tractor trailer loads of materials going into Webequie, going into the communities. The people we're seeing and turning around cannot justify why they're even there, and we're turning them around. Who do you know in Webequie? Oh, somebody. I'm going to visit. No, you're not. We're turning them around. We want to know who you are. But you got to remember, we're not police. We're just out there in the middle of the bush with a checkpoint and turning people around. So I tip our hats to the people, the security, to Jack McKay and his folks, and also my own members for being out there and doing the job they're doing. In the summertime, we go to the different communities and we do all their do the festivals. We've been in Nescandica, we've been to Summer Beaver, and what has happened is the first day we get drugs with our dogs. Second day we get a little bit of drugs, and the third day we get nothing. And next thing you know, we go to the clinics and they say there's a lineup for Suboxone. There's no fights, there's no arguments, the dances are fine, there's no issues, there's no assaults, and there's no domestics. Now, the answer to solve that isn't having a canine at every community 24 hours a day, 7 days a week, because it's not possible. But we need funding for these communities. And NAN, this is where we need you. We need funding to be able to fly into these communities, to be able to get to these checkpoints, to work in conjunction with NAPS, to build a better relationship, to build a solid relationship. But that's just one of many things we do. The education section, the people that are 60 years old and they're doing drugs, they're 60 years old, they're doing drugs. But our kids are where it's at. We have to get in, and our company, and I know there's others, but we want to reach and touch these kids right from grade 3 right up into the grade 12. The drugs are just as bad as when they used to say about cigarettes, where they added on a picture of a package of cigarettes. We want to make it so vile that nobody wants to go near it. What's happened out on Highway 808 at the checkpoint, we've shut it down. We've shut it down. And proof of that is our company contacted every clinic of the 5 communities, Nescandica, Summer Beaver, Casablanca, Fort Hope, and Webequie, and they've had 0 overdoses since that checkpoint. 0. You'll never be graded on what you prevented, but you will be graded on what happens. The results when there's a suicide or an overdose or serious domestic where there's violence relating to drugs. I think we've done an amazing job, and I'm not saying our company, I'm saying the chiefs. The chiefs of these 5 communities have stepped up to the plate and have made a difference. And North Caribou, same thing. We're heading there for 40 days. We're looking forward to meeting the folks there, but they're trying. What we need is funding. With Bill C5 coming down the pipe, we are going to have every piece of riffraff from the city are going to bring their drugs to sell it. It's going to come from construction workers. It's going to come from anyone coming in there because there's so much money to be made. When a bottle of booze can be sold in these communities for $300 or $400 and they pay $18 for it out down south, or when you can buy a gram of pot and even marijuana, and I tip my hat to the chiefs, no means no. 0 means 0 because this pot they're bringing in is laced with fentanyl. It's killing people. It's just as evil as the cocaine. And what our young youth don't realize that. And that's why we need to focus on education. And our company is very well versed in this. We have most of our guys have either done time in the drug units, we're either canine handlers, or social workers, we have elders, we have folks that are willing to ready to step up to the plate to do this. In the summertime, what's a little different than from NAPS? And I understand the deputy chief, he is right. They're handcuffed. They can only do so much, but we can do a lot. We can do some things that they can't. They can stand back and watch at a house when we can go in with a BCR and under a bylaw and go in and search a house with consent to go in, and their guys cannot come in only to keep the peace from the road. I totally respect that, but we're here and we're willing to go and do it. Is there dangers? You want to believe it, but if it saves one life, it's been worth it. I think the big thing we want to stress is the assistance from NAN for funding for the education side into the communities for the youth, and also getting ahead of these winter roads. I think winter roads should be planned now for next year, and we should have meetings with NAPS, with the OPP, and with the tribal councils to be prepared for the following year. Like I said earlier, and this is in closing, I can't tip my hat enough to Chief Cousys, and when I look around and I see Merle Loon sitting over there, one of the chiefs, and we used to work together when I was seconded to NAPS, so we all know each other. I just look forward to trying to do more of what we have. We have 2 dogs right now. We're going up to 4, and we're all over the province, and we're willing to help the communities. I think it's a deterrent. I know we've had a couple cars come up to the checkpoint. They see the dog, they turn around, and then they go on down the road and head towards North Caribou to take the route around the long route to get to Nescanica because they know that they're not getting past our dogs. So in closing, I want to say, Chimigwech, I thank you very much from the bottom of our heart. My wife and I are in this business because we love our people, and it's sincere. And if there's anything we can do, Regina versus Winter opened the door to search and seizure. It opened the door. The Supreme Court has made that if you come to a community, you're going to be searched. One thing about our guys we know that law. We try to teach. That's one thing we want to do is we want to build our communities, the youth in the communities. We don't want to come in and do a flash in the pan where we bring our people in for a week and we leave and you guys go, what's going on? We want to train your own youth in your communities so they can work with us, know the proper way to search, the proper way to seize stuff, the proper way to document, the proper way to do it safely, and become security guards, get their licensing. We can help them even with that. But in closing, I want to say thank you very much. It's been an honor to work with the communities we've worked with so far. And if we can save one life, folks, if I get your attention save one life, it's worth it. Big much.
Okay, Miigwech, Randy, thank you for your comments. And on closing here, Chief should consider this draft resolution about winter road safety, the community safety that we need. We need that protection. Our young people are dying. Our children are not eating properly because of the drugs that are going to our communities. And for myself, like I never thought this could be this much within a short period of time that people travel, people turn around there. There's probably some human traffickers that turned around. There's lots happening. And we have industry drivers that are pushing to deliver stuff. You know, a lot of those, they are impaired drivers. That's what we find. You know, and it's, and I'm very happy that we reach out to Cree Algonquin with their dogs, with the LPR camera. We have all the information. We collect all the license plates that went through there, even the truckers that were turned around. So with that, I think we have to prepare a draft strategy plan to deal with the funding, the funders, the cost, begin to pay by the First Nations. You know, work has to begin collectively. It's the only way we're going to prevent our young people, to prevent our community. So I thank you all for listening. You know, we have to assert our jurisdiction. You know, we always say it's our land, and I think we have a right to do this. It's our sovereignty. You know, miigwech.
Miigwech, thank you for the two presentations. Just to let you know, Deputy Chief Brad Deuce will be here until I think about 3 o'clock, and he'll be around if you have any questions for NAPS. And Gary, of course, is here throughout the day. Chief Quazis talked about a resolution, so it's now 12:56. So it would take me 3.5 minutes to read it, and there might be some issues that do you have a copy yet of the resolution? Has that been handed out? Okay. So the minister will be here, I believe is on her way, and will be here in 2 minutes. So I don't think we can get through the resolution in 2 minutes. We were hoping to do that, but if not, what we will do is we'll come back to deal with this resolution once we get through all the resolutions. Or sorry, once we get to resolutions. Yeah, I don't think we can do it in 2 minutes. So with that, again, thank you for the presentation. I'm going to turn it over to my colleague, our youth co-chair, to get into the next presentation, maybe do some housekeeping just as the minister makes her way to the assembly room. So I'll give it to, yeah, you can come on up. Abin.
Good afternoon, everybody. I'm excited to be welcoming the ISK Minister, Galmasti address. And this afternoon, I feel like our schedule here will flow nicely. We have the mental health and addictions discussion following the Open Chiefs Forum. And Galmasti will be here for part of the Open Chiefs Forum. So I hope that we can spread out our concerns and what we have to share so she can hear all of it and people have a chance to speak today. Is she coming? Oh, okay. All right. Okay. I'd like to remind the chiefs that Three Paces is here and to visit and talk with him and to really take that opportunity to create a dialogue today. And I'd also like to remind everybody that if you are a survivor of Indian residential school, there are quilts in the back here to honor your experiences and your testimony. Miigwech. Additionally, if you are attending Monday's announcement, please do speak to NAN, Representative Lori. She's out in the hall. Anything else? Any other housekeeping items? I guess we're just waiting on. Yeah, why'd the chicken cross the road? While we wait for the Indigenous Services Canada Minister, would anyone like to teach me a Cree word or say anything? Oh, yes, please go ahead.
Thank you, Chief, for recognizing me. I'm not going to teach you a Cree word because once again, I don't know the language, but real quickly, I just want to make an announcement that Poplar Hill First Nation is applying for funding through ISK to work with the Mennonite school that was right across the community. So this summer, we are going to be working with the gathering. I think I talked with Ann and Betty. NAN's going to support us. So I'm just announcing that on behalf of Poplar Hill First Nation. I know that many communities in the north had many youth attend that school. So they are stepping forward. They are moving on it. So I just wanted to let everybody know that you will get an invite. And I will make sure that we invite NAN youth. Okay, I guarantee that we will do that on behalf of the Chief of Poplar Hill. We will make sure you guys come and be part of that. It's important that you know our history of where we've come from. Thank you.
Miigwech. I guess so. Guess we'll wait on it. Anyway, does anyone want to take me up on my offer and teach me a Cree word? Oh, wait. Chief Nakaji, do you have something to share? Oh, Chief Nakaji, you know what? Teach me a Cree word right here, right now. I remember last time I saw you, you guys taught me Milogishipayo for good morning. Do you have one to share today? Tell me a bone.
I guess I'll teach you Minotagushin. Nice evening. And I guess it's that time of season now. So what pops in my head when you asked that question was Niska. So
Niska?
goose, yeah, it's spring season, geese coming.
Oh, nice.
Can wait.
Can you say good evening for me one more time so I can try and say it back? And say it slow for me.
Minotagushin.
Minotagoshin. Oh, miigwech, thank you. New word, guys. Hey, where is she? Where'd she go? I know, everyone's rushing us. Holy jeez. They're saying Gillipy over and over again. I know, and here we were rushing. We just do the resolution? You know what? I bet you as soon as we do the resolution, she'll come walking in. At the goats. At the goats. Yeah? The hell? It's 1:01. Watch you do it.
So we were told the minister was on her way. Obviously, it's taken a few more minutes, and I'm thinking I'll get right into the resolution. But only if I can do it quickly. You have a copy of the resolution. Are there any issues with the resolution? It's titled Emerging Issues on Territory-Wide Winter Road, All-Season Road Jurisdiction, Draft Strategic Plan and Call for Proper Funding. I think it was handed out just a little while ago. Is there any issues with the resolution? Just want to get an indication whether there's going to be. You don't have a copy? Or? Okay, yeah, go ahead.
Chief Taylor, good evening. I just have a question on it. Because in my community, we have our own community roads. We have a road that we don't know who owns it, but it's not our jurisdiction. So when we want to have security coming into our community to do searches, How would that fit into this resolution?
Okay, that's a very valid question. I'm wondering if, Brad Deuce, are you still around? If you can help with that question, I know you're on your way, but we will sort of take that aside and discuss it when we come back to the resolution. So thank you very much. I'm going to turn it back to my colleague. Where is she? Oh, Mayabin is just having a quick discussion with the minister. So NAPS, I'm not sure that they can help you, but I'm hoping just to have some dialogue and sort of go in a direction where we understand the response. So with that, I will turn it over to my colleague, Mayabin, to introduce our next guest.
Okay, Wache, everybody. I would like to introduce the ISK Minister, Galmasti. She's the Minister of Indigenous Services since 2025. She's a member of the Liberal Party. She's a member of the Cree Nation of Waswanipi, and she's the former Deputy Chief of Waswanipi and the former Grand Chief of the Grand Council of Crees, the USG. As a young Indigenous woman myself, it is amazing to see her in a position of power as a matriarchal woman. And I am just really like a little bit starstruck right now, I feel. So I'm going to pass it over to her, and hopefully we can keep our questions and comments till after her address. Miigwech.
Okay, perfect. Thank you. Thank you, Mwabn Janaskum Neji. Apishtamin Gajibet Duxnian Otenhau Jazinet Skadagood. Wajagam soy Mandy Galmasti in Sangaso Nagoni we Higan Jab Chistmo Canada to Becha so Jaji Wijabit EU Otenhau Canada Chi. Thank you. I just wanted to acknowledge Miabin and thank her for, introducing me and welcoming me in this space to be able to speak to you. My name is Mandy Galmasti. I'm just translating what I said in Cree. I am the Minister of Indigenous Service Canada, appointed by Honorable Prime Minister Mark Carney. It's really a pleasure to be here with you today. I want to thank the chiefs of Anishinaabe Nation and acknowledge the work of Grand Chief Alvin Fiddler and the Deputy Grand Chiefs, the elders that are here with us, the Women's Council, and in my language, Usnijud, the Young People's Council. Merci pour votre accueil et votre leadership. I know that there's a lot of power and strength in this room in advocating for their members, not only for the members of today, but also those that are to be. I also want to acknowledge that there's, with that power, a lot of responsibility in supporting everyday families, children, protecting the future, and building the strength of your nations. But I also want to acknowledge that we are in an urgent moment right now. For progress to really hit the mark, we must deliver real, measurable outcomes for children, families, and communities. This means that we have to act in true partnership and be guided by your priorities and by your leadership. I'm happy and I'm honored to share this space and being able to understand what it means to be a leader in a table like this. But I also know that I am now bearing the responsibility of representing and being the face of Canada and the history that that comes with. So I do want to say that I have a lot of bridge building and trust building to do. But I hope that you have the confidence in me to know that when I come here, it is with the intention to empower you in who you are as First Nations and respect who you are as distinct nations. I want to also today announce that $738 million will be provided to strengthen health services, governance, and emergency management for First Nations communities. This will include $283 million over 2 years to strengthen First Nations governance and capacity building. Through programs like band support funding, contributions to band employee benefits, professional and institutional development, and tribal council funding, we know that these investments are going to provide First Nations governments with the important resources and tools that they need to further support and strengthen their governance structures, planning, and core administrative functions. We want to ensure that we are working with you to continue delivering service and advancing priorities, especially the ones that we know are at the heart of every community, issues like housing and building the future of your communities. We are also investing $400 million over the next 5 years to support essential health services in remote and isolated First Nations communities. This funding is critical and will help support things like nurses and other health professionals, digital tools, and frontline care services. Supporting First Nations health services in communities where nursing stations have already been transferred expands access to communities, expanding access to community paramedics, and supporting options to receive care closer to home means that you are able to make those critical choices in how you want to receive care. Outcomes in this space are clear: strong frontline care services, service in community, service in your language, and fewer disruption for families, and not having to leave home are a part of a critical care pathway. Finally, we are also committing $55.6 million over the next year through the Emergency Management Assistant Program, or EMAP, as many of you might know it to be, to strengthen preparedness, response, and community capacity. As this world is changing, First Nations communities are often the ones to see and feel it first. They are disproportionately affected by emergencies. In 2025 alone, we had more than 45,000 First Nations people from over 73 countries, from over 73 communities in this country be displaced due to wildfire. There's a shift in our future that we must address. And for us to do that, we must collaborate and work together. This funding is going to go towards supporting the preparedness and mitigation efforts that we have seen be successes. This also includes enhancing initiatives within the Fire Smart area and providing essential emergency coordination. We know that this is one of the foundational areas that we can really help communities ensure their emergency management process. Separate from this funding announcement, EMAP will continue to fully reimburse eligible emergency response and recovery costs so that communities feel the support that they need when they're in crisis. I also want to acknowledge today the community of Sheshwan. On March 17th, I had the opportunity to visit the community alongside Grand Chief Fiddler and National Chief Woodhouse Nepinyak, and had the opportunity to also meet with evacuees in Niagara Falls. I saw firsthand the challenge of what it means to be an evacuation center. And I also saw firsthand what it means to find strength and resilience in a time that is very stressing for our First Nations members. I want to assure communities that we're here to continue supporting them for as long as it takes. But more importantly, we're working with communities and partners at every level of government to ensure that our next steps include restoring clean water and getting everyone home safely. I also have to be transparent and frank that I know that there are ever-evolving challenges in this space. I want to recognize the strain that displacement places on families and that efforts are continuously ongoing to ensure that evacuees continue to have access to the support that they need while they are away from home. This includes health, wellness, and community supports determined by them, acknowledging who they are as First Nations, ensuring that culture and support are reflected in that process. At the same time, while we are looking to help with progress in Sheshwan, we know that essential health services have to remain in place. Work is underway with our partners to restore safe water. Our focus is on a safe return and a long-term solution. We know as spring is coming, the season of the hunt is soon going to be underway. Many people are looking forward to their goose break, heading back to the land, being able to engage in their traditional activities, and find relief from the stress of being in an evacuation center. We want to do everything that we can to support that process. I also want to speak today about child and family services. Everything begins with children and their precious lives. We have a shared goal to keep First Nations families together and support children so that they can be in community, so that they can feel safe, loved, and most importantly, proud of who they are as First Nations peoples. We must ensure that we protect, maintain, and honor strong connections to their home and to their culture. Les enfants doivent grandir en sécurité, entourés par leur famille, par leur langue et par leur culture. Oji dwashin de magnod jaji mugre magnoda jaji shatagnoda jaji ada odimono nashke jaji noktada e ada iwi don nashke et shetaxada danishkanashda. Too many children are still separated from their families. This must change. We know that when First Nations lead this direction, this is where outcomes improve. In Ontario, the leadership has shaped a new path, one that I want to honor and acknowledge. On February 26, 2025, there was the signing of the Ontario Final Agreement with a plan of $8.5 billion over 9 years to reform Child First Nations and Family Services in Ontario. This agreement not only respects your authority over decision-making for your children and provides secure, flexible funding that recognizes the higher costs of living in a remote and fly-in community, it is also enabling priority for you to advance throughout negotiations. I will do everything that I can in this space as minister to work with you to ensure that while we are addressing the implementation process of now, we are planning into the future and how we can gather the information and data to show that the success of outcomes driven by First Nations directly has critical impacts on the lives of First Nations children. The OFA agreement includes funding for prevention, First Nations representative services, post-majority supports, capital and housing, and also includes dedicated housing funds to keep children and families together and support reunification. What matters now is the delivery for your communities, strong prevention, support closer to home, and funding that reflects the realities of the North, so that children continue to grow up feeling loved and connected to their land, their language, and their culture. But funding alone is not enough. True change comes with self-determination. Leadership is driving that change here, and my department will stand with you as a partner to honor and support the work that you're doing. I'm looking forward to hearing the Canadian Human Rights Tribunal's decision on this agreement. I hope they will honor the leadership and the work that's been carried out. Let me also turn to another file, Jordan's Principle. Earlier this year, we had the opportunity to commit $1.55 billion in funding for Jordan's Principle until March 31st, 2027, to ensure that children continue to have access to essential services in the period in which we work on reform. I want to recognize that certain changes were created in the last government that introduced uncertainty for families. I know and understand that families need predictability. They need to have consistency in service. I've heard from many leaders across the country. I've heard from families. I've heard from the parents of children who use Jordan's Principle, and even from service providers across the country. Jordan's Principle must function better to respond to children's urgent needs. We've prioritized moving forward to make it more responsive, sustainable, and easier for families to navigate. In 2025, we are focusing on tackling the backlog of urgent needs and improving decision-making based on the needs of every child and every family. Since February 2025, we have addressed urgent overdue requests, which have dropped by more than 90%, taking them from 5,000 outstanding requests to 400. I want to also say that I know more must be done. Families and providers have addressed and faced delays that are unpredictable and are challenging and are taking a toll. Stable funding is what matters, and it gives families certainty and allows communities to ensure that they deliver those services with confidence. Les familles ont besoin de la clarité et une réponse rapide. C'est pour ça que nous continuons de travailler avec vous et travailler avec l'information que vous donnez pour assurer que les prochaines étapes vont refléter la réalité des familles autochtones. Every First Nations child needs to ensure that their reality is reflected in the reform process. For us to succeed, we must listen and learn and ensure that our next decisions are aligned with enhancing your opportunity and your responsibility to move forward with a path that is driven by consistency and continuity. I also want to speak about Choose Life. The same urgency drives our work with the Choose Life Initiative. Choose Life remains for many communities a lifeline for children and youth facing substantive mental health challenges. I also want to address, in some cases, a loss of life. That is why this initiative is critical and needs to be delivered in partnership with your communities, with NAN member organizations, tribal councils, moving into the space and uplifting, supporting land-based programming, language, cultural camps, clinical counseling, peer supports, and prevention planning. I want to once again acknowledge young lives are lost in too many communities, and their memory is going to guide this work, and we must honor it with the decisions that we make. Since its launch, the initiative has helped thousands of young people reconnect with who they are, their culture, their community, and provide ongoing care, but also reinforce the respect of who they are as First Nations people. We have seen what is possible when we act together, and we must ensure that we move forward in partnership and acknowledging what communities want to choose for themselves. In NAN leadership, in NAN territories, in service providers, in communities, we've seen that they've built strong supports for children and youth, and that progress is what matters. Protecting and building these successes for me is a priority. I look forward to continue working with partners to expand access and in-community mental wellness programming so that children, youth, and families can ensure that they have the local supports when they need them the most. I'm also hearing clearly that families need to understand what supports they can expect, and that leadership needs to be able to plan and communicate to them with confidence. For us, that means building on what we know works and moving into a more stable, sustainable footing so that supports remain clear, consistent, and reliable for children who need them now, but more importantly, will also need them in the future. My focus is on healing and hope, but also knowing that I have to be guided by your needs and your direction. I want to recognize NAN's leadership in advancing control over health programs and services. We share a goal, a healthcare system where First Nations in Northern Ontario have greater control over decisions that affect them, that affect service, their needs, and their priorities. Transforming the health system to support First Nations control is a collaborative process. While it takes time and sustained leadership, we know that its impact will be the most profound. Nous avons ensemble travaillé pour se diriger vers des services dans des santé concus et dirigés par les Premières Nations. Together, we are negotiating a charter implementation protocol. This is a milestone that we're working towards to ensure transferring federal funding so that First Nations can, for themselves, design and deliver services based on what their priorities are. There is more work ahead, but with each step forward, we are bringing nations closer to self-determination. We have to stay focused on the long-term vision, but we must always ensure that we continue walking that path together and uplifting one another. I want to also speak a little bit about water legislation. I know that caring for our people also means that caring for the conditions that are around them in their life. Clean, safe drinking water is one of those foundations. Generations need to access clean, safe drinking water. It's central to well-being. It's central to survival, and it's central to culture. L'accès à l'eau potable est essentiellement une composante de la santé et la bien-être des communautés. It has been clear that legislation should reflect your priorities and your authority over water. I'm working hard with the Prime Minister to introduce legislation, which the Prime Minister himself indicated will be tabled this spring. I also want to acknowledge the leadership of those of you who have helped push this legislation to ensure that it will bring stronger protection to your communities. It will also respect your rights to self-determination and reflect your priorities and your concerns. We want to continue investing in water and water infrastructure. And in the meantime, I also want to acknowledge that we have been able to attain 151 long-term water advisories being lifted since 2015, many of these in the northern part of Ontario. But we are continuing the work, steadily responding and trying to ensure we lift the remaining water advisories that are in place with an action plan, with information, with planning, and ensuring that every step that we take helps communities that continue to be affected. We want to ensure that we're continuing to build on progress because we want to protect the resources that have matched the scale of your priorities. At Indigenous Services Canada, we are not facing major savings reductions in response to the current economic pressures. I want to acknowledge the decision of the Prime Minister to ensure that he protects the investments in First Nations communities. It's our government's distinct duty to First Nations people, and the opportunity that we have to move forward needs to be based on stronger, renewed relationships, especially in the moments when we face a crisis. In Budget 2025, priority is given to housing, water, and other resources to close the socioeconomic gaps and continue building infrastructure. Ces investissements vont soutenir les priorités des communautés et de leur développement à long terme. We are also looking to work and continuing to review internal costs to direct more funding to communities and to reduce duplications so that there is clarity in service delivery. We are investing $2.8 billion for urban, rural, and northern Indigenous housing. We are also increasing the Infrastructure Bank's Indigenous infrastructure target from $1 billion to at least $3 billion. As for water, we are continuing to invest $2.3 billion over 3 years to renew the First Nations Water and Wastewater Enhancement Program and to support safe drinking water, wastewater treatment, and operations and maintenance. I hope and look to community to continue working with me to advance in this space, to uplift me and help me make the decisions that best suit you, but also to know and understand that as I push these files through government, I need your support, I need your leadership, and I need your community capacity behind me to ensure that we are making the right decisions for members. I also want to address the challenge of applying the Indian Act. This is really one of the toughest things to undertake as a minister. When I chose to come into this space, I knew that there would be a lot of work that needed to be done to address identity, belonging, and rights. For generations, the Indian Act has imposed rules that were determined based on who belongs and who doesn't, and often the reality of dividing families and communities, even in my own. Policies such as enfranchisement forced First Nations people to give up their identity in exchange for basic rights. These decisions had long-lasting consequences, and addressing them remains essential. Bill S2 was one step of that work. We wanted to work towards reinstating entitlement to enfranchisement individuals and registering more than 3,500 people across generations. It will modernize the Indian Act, and it will remove outdated language, and it will make it easier for individuals, particularly women, to be connected and to reassociate with their natal lands. This bill was shaped through direct engagement with First Nations and those who are directly impacted by enfranchisement. I know that this work is critical. As part of that process, second generation cutoff remains a critical and deeply personal issue. One of my first public statements as minister was the determination that I wanted to introduce a second generation bill. My intention was for the fall of 2026. Some of the things in that process have changed. I want it to be understood and known that with the process that is in place right now, the work is not finished. The question is not about whether or not we will lift second generation. The question is simply about how. I know that in the recent few weeks, there has been a lot of positioning to support a one-parent rule. I want to respect that communities have the right to decide for themselves. If you feel that a one-parent rule supports your community, that is your path to take. I also want to be clear that there are other communities who want more than that, who want a different option. It is up to us to work together in this space to find that pathway forward. It is up to us to ensure that when we look to the outcomes of the collaborative process that was launched with First Nations, rights holders, and organizations, we are reflecting a path forward that is diverse, that respects everyone's voice at the table, and is based on lived experience. We have proposed solutions for First Nations across the country. And in early 2026, we put in place an advisory committee that was established to assess the proposals from the collaborative consultation process. That phase of work is concluding. Following this, for the first time ever, formal consultations with rights holders will begin on second generation cutoff and Section 10 voting thresholds. We remain committed to advancing this work carefully and collaboratively, and in a way that supports First Nations self-determination and rights to choose for themselves. The goal is a long-term solution that is First Nations-led, all nations. This assembly brings together expertise, lived experience, and solutions rooted in realities of Anishinaabe Nation communities. Nous allons continuer de travailler ensemble avec le respect et la détermination. For me to move my work ahead, I turn to your leadership and I seek direction, advice, support. We will move forward together with accountability and respect and focus on the results that you're seeking for your members. I look forward to continuing this work with you. Miigwech.
Miigwech Minister Mandy Galmasti. We will be opening it up for question and comments. However, before we begin, I would like everyone to be conscious of the time we have today and the opportunity we all have together to be speaking with her on this platform. I would like everyone to be mindful of sharing this space, of sharing the voice with others as well, and to try to keep your questions direct and concise so we can make sure everyone has an opportunity to say what they need to say. And as youth co-chair today, I will be prioritizing the voices of women and youth during this. So I'll also be doing that. So to begin with for questions and comments, we have Chief Kustachin Matadawabin lined up online currently. So if you would like to begin, please go ahead.
Hello, can you hear me?
Yes.
Yes. Good afternoon, everybody. Good afternoon, Minister. Thank you for being there. Thank you for taking the time to be with us as we had discussed such important issues and matters before the nation. And In all due respect, you're sitting there as a minister, as a political body, and as a government that continues to have control and still undermine our dignity and worth with their policies at play within Canada and within departments. And it's good words that you said and the announcement made with funding. But at the very heart of these issues is still, and especially in the remote north such as ours, and I'm sure you can attest to it because you being a Grand Chief and you being a life carrier woman, as a woman, a water carrier. And it's hard to trust what any government representative says to us when the spirit of intent of our treaty hasn't been acknowledged or honored for so long. And yet we have political bodies of our own making that try to advocate and present these issues at these tables. And I can only speak for my community and the hardships we continue to face. We did state a humanitarian crisis 3 years ago, and no one ever really came to our community. And it's really sad because I keep telling people, even our own advocates, NAN, COO, National Chief, to spend a day with us and just not just to bear good news, but to let our people know that they see them, they matter, and they need to be heard and seen. We're still, a lot of our communities are still working in third world conditions, and that the government of this day wants to expedite a lot of processes to access minerals, energy on our lands, exploit our lands without our consent. And how can you have a partnership, a true partnership, and forging forward when your rights are being undermined, when you're not acknowledged as the rights holder on this lands? Mr. Nundagan, Mr. Gabbage Ahohemagan, it's hard to reconcile something when our truth hasn't been heard. There should be no more advocates out there, and that's what I keep saying. What my fellow community in Cash is going through, it's how the systemic approach, it's how the piecemeal approach has been killing our nationhood for a long time, and we're still doing it today. We know what we want. We know what it needs, what we need to do in our communities to get it to a safe level, to a comfortable level where we can feel safe. But right now it's not. Everything what we try to for, we always seem to be baking in our own land. And I don't want to depend on the government forever, but it's also, but I realize that this is our resources. This is our money. And we shouldn't be in this state. So for me, that's how I feel. I feel frustrated. We come to these tables and we often hear the same spiels, whoever the ministers at that day is. And I don't know why we keep doing this over and over again. And I strongly urge NAN chiefs, there should be no more advocacy out there. If this government is really going to fast track everything, fast track our issues, the bread and butter issues that we're dealing with. We just got back land back. We're now 5 times larger than our reserve status is. And I just got news that yesterday, and somehow it doesn't make me feel proud of the work that's been, because it was already rightfully ours to begin with. And we've been sandwiched in a box for so long, and it over the years crippled our community. I'm not saying I blame government for everything, but a big part is these systems at play. And we all got to do something together. We got to be more assertive. Nagong punigitiapan, Mingresh Kitin, Granaskumuntin, Minister. And I acknowledge you today. Mingresh, I'm sure you have your own story of where you came to be, how you came to be in that place, just like every one of us. And I respect your position. And I respect you as a woman leader, as our own. There's no ill feelings, but you gotta understand, as a woman coming from my community and trying to help my community be healthy and prosperous. You know, it tears me apart. You know, it tears me apart. We have a lot of stories, a lot of things. I'm gonna put you on and ask what you meant. Sagi hitting ginista. What you?
Miigwech. Miigwech Chief. Miigwech Chief Kusasha Matadawabin. Is there any response from Minister Galmasti at this time, or you don't have to? Oh, okay. 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 All right. That's clear. Okay, Miigwech, for sharing your statement. I very much appreciate it. We will be moving towards Chief Gary. His last name is? Oh, Chief Gary Kuzis.
Okay, bonjour, Miigwech, giving me this opportunity to speak. Miigwech, Minister, for your presentation. I know we met a couple times, but the thing is, I'm hearing same language over and over, minister after minister. You know, our boil water advisory is 31 years, and we went through with 7 prime ministers already. You know, and when is it going to be resolved? You know, there's a lot of losses within our community with that boil water advisory. There's one young family there that lost a loved one while they were getting water because of this boil water advisory. And there's a lot of trauma within that facility, that infrastructure. That's a failure from the department. We didn't create that water treatment plant. It's supposed to be a healthy living product that was provided for us. Now, the lives has been lost. You know, elders can't keep up boiling water for a lifetime. You know, second generation, my grandkids asking me, Papa, am I going to get water like this? I have no answer for that. You know, all the infrastructures are failing. I know you're paying a big price of the evacuation. There's a big price tag, yeah, every day. You know, displacing Saskatchewan. I'm on the same boat as him, as Saskatchewan. I got evacuated twice with that infrastructure. and our healthcare. We got evacuated. And there was a limitation to repatriate the people. That's how we got treated. Now, when is this going to be fixed? No. How many more people will die on these infrastructures with the failure of the government? Prime Minister on December on Chiefs Assembly, he said they fell. The whole world hear that. And, you know, I just want to bring this up because there is so much frustration. You know, we have commitments after commitments, but there's no action. The healthcare today is, it's falling into pieces. Our own First Nations have to pay the travel to take our members for their appointments. I haven't heard any government talk about the drug epidemic that we're having today. How is that going to be fixed? Because it impacts and connects with everything we're talking about here. I like to hear that drug epidemic, when is it going to be fixed? Same thing, mental health grows when you lose a loved one, almost every day. You know, saying partner as treaty partners, and hearing the government, the Prime Minister himself saying it, they fail their duties. So how is that going to be fixed? You know, we are the first people in Canada. We should be prosperous with all of our resources that we have. And now there's dictators that are trying to take over our lands. We don't get a penny out of it. You know, we got to put it in a box, as a colonial box, as a reserve. Now, these things has to be looked at. You know, I want my future generation to live healthy. Today, you can't. You know, hearing the governments, First Nations are going to prosper. How are you going to do that? The province and Canada, that's the same language I hear. When elections were put in, you know, the language was Canada's not for sale. Now that language that got swallowed up pretty quick from both levels of government without recognizing First Nations. All the Bill C5, First Nations were excluded. Where is the accountability? Where is the true partnership that was signed with our treaties? You know, the Crown said people will be happy, people will be prosperous. These are very important things that we face today. So, but I thank you very much for coming here and listen to us, our frustrations. You know, a decade went by already for my community, and hearing you that you lifted 150 boil water advisories, for sure not mine. Mine is 31 years. boil water advisory. And our health system is falling apart. On those two infrastructures, the water and the healthcare system, we got evacuated on those. Yeah, our programs are on hold. These programs were taken to court. Choose Life, Jordan's Principle. Then Canada province holds the money against First Nations. So I thank you for listening and miigwech. So thank you.
Good day. Miigwech for sharing your political statement. I am gathering that there is a feeling of mistrust of the government. There's a need for our self-determination, affirm this is our land. We need our voices heard. As we've been saying over the past few days, we need treaty accountability and to move on from empty promises. There's a very continued frustration with stagnant infrastructure development. So I appreciate the statements. Again, we're short on time today, and I really want to hear everyone's voices heard. So I request kindly and respectfully, not to dishonor anyone's lived experience, but I request kindly and respectfully for us to remember the short time we have and to please ask questions very directly and concisely, because we have quite a long list growing here of who's speaking. We have, we're going to be passing it. I'm just going to go through who's on the list so far, and then I'll pass it over. So try and remember where you are. We have Chief Carla Duncan, followed by Chief Sherry Taylor, followed by Chief Archie Wabas, followed by Chief Sunny Gagnon, followed by Chief Matthias Anderson, followed by Chief Merrill Loon, and then finally Chief Bruce Achipiniskam. And then Chief Aaron, Proxy Aaron Gaka-Badam. Miigwech. So I will be opening the floor for Chief Carla Duncan, please.
Hi, good afternoon, Minister. Thank you for giving us this opportunity and coming to visit us. Same as all the other leaders in this room, I have many different urgent issues, but I come here on behalf of, I'm with the Independent First Nations Alliance. There's 5 communities that we work together, and to be considerate of people's time, to give everybody a time, I'm gonna read my questions. Minister, we are here after another fire in one of our communities. At this very moment, they are recovering the remains of a child at this very moment. After a house fire in KI, a child is gone, a home is burnt to the ground, and families are left to carry that loss. That is not new to us. Our communities have been raising these concerns about fire safety and the lack of resources for years. We have said clearly that these conditions are dangerous. What is going to be done differently right now to make sure we are not back here again after the next fire? Known risks and gaps in funding. We have been raising concerns about inadequate fire safety funding for years. These risks are not new. They have been clearly identified, and we have said repeatedly that they are put our people in danger. Yet our communities are still living with limited fire protection and prevention supports. So I'm asking you directly, if these risks are known, why has funding not changed to reflect that reality? And how many of our children need to die before something is done about it? My own grandson was living in this house that was not safe, and they had fire like chimney fires often, and we have no firemen or like funding to hire people for these emergencies. Accountability, IFNA and KI jointly filed a human rights complaint outlining serious fire safety risks in our communities. IFNA filed provincially and KI federally. These concerns were clearly documented. We followed up and were told not to request updates or risk delaying the process. That was 7 months ago. Nothing has moved. While you may be directly responsible for the commission, the issues raised in that while you may not be directly responsible, the issues raised in that complaint are within your responsibility. Now a child is dead. At what point does that become unacceptable to ISK? Housing, overcrowded housing and aging infrastructure are increasing fire risk in our communities. What is ISK doing to address these conditions as part of the fire safety, not just housing policy? And you know, for housing, when we get funding, we are given like a 1 month window, and it's very limited, and it's like we just get the basic housing. So if there's a fire, it just lights up like that. So there's no, it's not sustainable to have these houses, like they don't even last long. Emergency response in our communities, emergency response is delayed and access to services is limited. And we've been raising this for years. After the fire in KI this week, will ISK commit today to putting additional resources in place to improve emergency response in our communities? It's very limited. The line for fire safety protection, fire resources is very limited. It's like an option. It's not even essential. We can't even hire a full-time police, fire or emergency services to be available. Investigation. The chiefs of the Independent First Nations Alliance are calling for an investigation by the Auditor General into the Canadian Human Rights Commission, following a pattern of systemic slow walking of not only our complaint, but other serious First Nations concerns. If serious concerns like this are being delayed while communities remain at risk, what is ISK doing to ensure that this does not continue? So one of our main concerns, one of them is like the response that they got 7 months ago, where they were told not to keep coming back, not to ask about their complaint. So they want to find out like who gave that response. It was incompassionate, like they were telling them not to inquire about this complaint anymore. So we want to know like who did that. It was anonymous. It was just like a general email. And so those are my questions. Thank you for listening to me.
Miigwech, as we're being conscious of time right now, it is now 2:00. So we only have so much time with the minister today. I would like to give her an opportunity to respond. However, before doing so, following her response, we will be transitioning into the Open Chiefs Forum. I'm going to keep the lineup we have going right now of who's queued to speak. And then following that, the minister will still be in the room. However, we are no longer doing a Q&A. So she will be listening to your concerns, but she cannot answer at that time. She has to leave soon. So I'm going to open it up to the minister to have a response to these first few concerns, and then we will continue with this lineup and she will be listening. Egode? Egode.
I know that I've only had the opportunity to receive 3 questions. I will be in the room, and I do want you to know that I will actually still be within the vicinity of the forum. I do have some pull-aside meetings with some chiefs on some files that have been requested to meet. But I want you to know that I am here. I have 2 staff in the room. If you want to have a direct follow-up, I'll try to make as much time as available to you. I know I've had some really big questions. I've had some big questions on some big files. I want to first respond by giving you insight on how it feels to sit in this chair. And I want to first and foremost say, I can't imagine what it felt like for non-Indigenous ministers to sit here, to not have understanding of what it means to be a First Nations person in this country, to not understand what it means to grow up in a community, to not understand the importance and connectivity of family, and to not understand the importance and priority of your culture. So I want to first acknowledge that anybody who sat in this chair before me as a minister likely was trying to do the work of serving you. But I also want to say that did not have the shared reality and lived experience that I feel I have with you. There is a long history of what Canada did and perpetuated to First Nations people in this country. Everybody around this table, including myself, is a victim of that in some way, in some form or another. For the change to occur with how you have a relationship with government, there has to be a reflection of what you want that change to be. I've had the opportunity to be in this kind of meeting on many occasions, and it is really challenging to often hear the same question. For a relationship change to occur, somebody has to go into that space and work on 3 things. First, to change the mindset of the minister themselves. I get the opportunity to do that. Other people have asked to be in this seat and they have said no. But I've chosen to come here, fully aware and understanding when this mandate was given to me that I was going to encounter the brunt and the force of all of the mistrust that occurred with this ministry. So I want to acknowledge that. I want to acknowledge that that is a truth, but I also want to ensure that in looking forward, it is my intention to come into this space and do work in the space of changing and shifting the vision of the minister, not only for myself, but other ministers who I believe will be Indigenous ministers for the future to come. That is part of the work that I have to do, is to rebuild that relationship and that trust with you. I also want community to know and understand that for me to have success in delivering what you're asking me to deliver, it has to be a working relationship. And I'm also here to teach as a minister the capacity of how government makes decisions, how they respond to questions. And while I also want to say there are many outstanding issues, I have to empower you as First Nations communities to make those decisions for yourself. I'm not here to answer what the fix is. I'm here to give you the tools and resources that you need to implement that fix. For me to be able to offer that to you, it is a working relationship. There's also the very harsh reality that a systems change does need to occur. I'm not the first minister to come here and the question is asked to them, but I want to be the last. for that systems change to occur, there does need to be the structured collaboration of the intention of how to work together. While very much acknowledging that there's a history in place, there also has to be the visioning of what that next step is, what that next phase is, and understanding the capacity to deliver on the very real asks that I hear from over 630 communities across the country, and those who wish to become communities. We are in this ministry at ISK the 14th province. And I frame it in that way because we do everything to provide service from birth to death and everything in between: education, healthcare, identity, providing your documents for, your status card. We do everything. We are the only ministry that does that. And we have to work with over 700 different organizations, communities, First Nations. I am in a space of trying to bring the position of minister out of one that tries to give a solution for all and to respect your distinctness as First Nations, to ensure that I'm reflecting in programming your unique language, your culture, your relationship to your territory, but also the spectrum of communities. There are some communities in this country that are extremely high capacity. They do not even come to us for service. They're independent. And there are also communities that really need the support of Indigenous Services Canada, and they need that capacity to be built. Historically, this country has treated everybody with the same approach. That's why for me to ensure that I can successfully introduce a system change in the relationship with First Nations people, I have to first and foremost acknowledge that we are different, that we have different needs, that we have different capacities, and to build in that space. I know that, every time something is shared about Canada and, everything that has been outstanding, it is not something directed to me. I fully want to acknowledge that, I want to respect everybody in this room. I look to you as a colleague, I look to you as a relative, but there is work that needs to be done. And while I can try to work with you to acknowledge historical issues, I also want to be sure that part of that conversation is speaking about the future and how we can shift to ensure that we're working on a plan that not only uplifts you, but also harmonizes the collaboration across First Nations. I think this is one of the things that building capacity, empowering First Nations communities, teaching you the system of how government makes a decision is a critical part of the dialogue that needs to be had. I also want to share that it is often challenging to be in this space and to be responsible for a federal role, but to also face, the unintended consequence of the reality of a provincial decision. And this is part of the discussion that has to be had. Relationships with First Nations need to be a whole of government's approach, not simply a federal one. To shift the process from individualized, siloed, fragmented decision-making to one in whole of government. To understand that there is the truth of the history of outstanding and unfulfilled service, commitment, province, to pushing and moving forward into a place where the path is one that is driven based on protecting culture, identity, language, territory, and creating the space for solutions to be brought in place. This is very ambitious. This is very ambitious. And I have to, ask myself, is this something that I can fulfill as one minister? I don't know. But I know and trust that what I start will be carried forward and brought forward by communities. It is not solely the responsibility of the minister. It is First Nations communities that have to help other ministers who will succeed to be sure that there's a new path, a new process, and more importantly, a new action. This requires essentially a redirection of the system. I'm here to make sure that it is understood that I am one of the few ministers that is trying to work herself out of this space. Indigenous Services Canada provides operations support to communities, I truly believe that communities' right to decide should also be followed by communities' right to implement for themselves. And hoping that in working with you to define that pathway forward, we can identify steps where essentially in the future, Indigenous Services Canada does not exist because communities have undertaken the responsibility for themselves. This is my vision as a minister. This is the pathway that I'm working towards. But I also want to be clear that for me to have that success for you, it does require the collaboration. This is part of the bigger, aspects of how I'm trying to lead this file, trying to support communities. I also want to be, clear that there is a lot when I come to meetings and I'm asked the question, when will this be done? And for me, the question is, how can we help to ensure that we are no longer asking that question, but moving and working towards what is the next step that we're going to take to finding solution for this? There are different responsibilities that come with this role. There are different files that come with this role, but I know that my success lies in having a good working relationship with you, being transparent, telling you what I can do, what I cannot do, and telling you how I believe this file can move forward by giving you the tools and resource that you need to advance it. But there's often a lot of challenge that has to be faced. And I think the best case is in Muskrat Falls. I want to acknowledge, I know that there is a life lost by a child. I know that the CHRT has, provided a response. And while I do not have authority over the CHRT, I can very honestly say I do not agree with the response that they did provide. When there's challenge, when there is issues that are faced in community, we have to work together to collaborate to trying to do that. And sometimes that can be timely, sometimes that can be quick. But I want people to know and understand that my intention in coming in this space and choosing to become a minister here is really to make sure that I'm building something that is going to uplift those future First Nations leaders that will be at this space. I will do everything that I can to help you resolve what I am in the time that I have being here. But a greater part of this work really lies in ensuring that we define our relationship with the Crown. We define the future outlook of how we want provinces to work with us, how we want federal government to work with us. And I say us because there will be a period in my life where I will no longer be Canada. And I want to be sure that whatever it is I leave behind, Canada is serving me as a First Nations person in this country with the greatest expectation of high quality, equitable, and fair treatment of First Nations. So I'm asking today, to really create that pathway forward. How can we do that? How can we work together? I know there's a lot of questions around promises that are made, funding that's put in place, health, infrastructure, water. I'm there to work with communities to be sure that they know and understand what that next step is. But I'm ultimately and essentially there to empower you to do the work. And while some things can be done quickly, as I had said, some things do also take a long time. I want to acknowledge that reality as well. I will leave the rest of the time for questions, but I really do appreciate, I know some of these conversations are tough for Canada, but I do come here knowing and understanding that ultimately at the end of the day, you are advocating and trying to determine the direction for the best life for your members. I want to acknowledge that work of leadership. It's a very high level of responsibility to be in charge of your members, to be in charge of your community. You're governing for them now, but you're governing for the ones to come. And it's my intention to do that with you and support you in this space as well. Yeah.
Chimigwich, Chimigwich. That was very powerful. That really resonated with me, that necessity for the mindset change of the fix, always looking for the fix. What are you going to do? And I appreciate you speaking to the importance of knowledge is power, of being politically literate and understanding these systems, taking the time to read books about this, taking the time to read books about political theory. And I also acknowledge your desire for a system reform and coming together as a whole community to collaborate to create a pathway of communication between the governments, to create a succession for that. So Chimigwich, we're going to be transitioning away from the questioning period and we'll be moving forwards into an open forum. As I said previously, we're going to be keeping the order. And before Minister Galmasti leaves this questioning seat to go find a seat in the room, I would like to request for the chiefs and the audience today to allow her space as she is listening to the floor as we proceed with our open forum, and she needs to be hearing everyone's voices. It's frustrating having these colonial time limits, so we're trying to make the best we can of it in our short time this afternoon. So before she moves away, I would like to ask Grand Chief Elvin Fiddler to please come to the front to thank Minister Galmasti for her words today. Miigwech.
Yeah, miigwech, Minister, for joining our assembly today. I just want to just say miigwech to you on behalf of the assembly, our chiefs, leadership, all the citizens of the Stabas Nation. Miigwech. Here's a little gift for you.
Mike, Teacher Minister, okay. Oh, wow.
You can smell it. Oh, here. Yeah, and we haven't eaten yet, so.
No, I see.
Where will you be sitting?
Is this okay?
Oh, yeah.
He asked me to sit.
Right here's okay?
Yeah.
Okay, we're going to be continuing forwards with the Open Chiefs Forum, and I'm aware of the agenda. It may seem that we are skipping over the mental health and addictions discussion. However, I believe the mental health and addictions discussion will be an important component of the Open Chiefs Forum as people share their dialogue today. I'm going to be passing it over to the person next, the chief next in this lineup, and that is Chief Sherry Taylor, followed by Archie Wabas, Chief Archie Wabas. Miigwech.
Okay, Miigwech. Thank you, Chair, Youth Chair. Good afternoon. You know, who am I addressing now? The minister is still in the room. Introduce myself, Wapshka Nimki Benesekwe, Manigan Dondem. Sherry Taylor, Ogamakwe, Ganugamin First Nation. You know, I've heard some words here today, and the government of Canada has put one of our own in the place to be part of the discussion that needs to happen with our communities, to lead that way. But yet, when you say you want to build trust, how you do that is by giving us the time. Because we give up a lot of our time for our own, away from our communities, away from things that we need to take care of at home. And I would appreciate, you know, it was a disappointment to hear that the question and answer period is going to be over. I sit here today, you know, with 1,000 of my grandmothers behind me. I do not sit alone. They're here with me. And I speak on behalf of the spirit and intent of our treaty, as it is supposed to be done in true partnership, as you say. Our community of Ganugamin has had 2 outstanding, they're still there, states of emergencies in our community. One was because of essential infrastructure that failed, that Canada has failed to uphold in my community. The other one came from mental health and addictions. It also came from violence due to gang violence coming into my community. I've had a fatal shooting in my community in October of 2025 that took a young person's life. We are still addressing those concerns and issues as we speak today. During those states of emergencies, you know, where we're trying to address mental health and addictions, health, safety and security is number one. That's a priority for our people in order for them to feel safe in their own homes. How do we address that? We've had to take matters into our own hands because Canada continues to do next to nothing. I don't know how many different ministers that I've seen come into my community in my capacity as chief, and those that come before me, my predecessors, have met with ministers and have still seen no change. We're still talking about the same things that we did 20, 30 years ago. In Kinugamin, we have been diligently applying for money to open up aftercare programs, living spaces, pre-post treatment, security, safety, mental health and addiction, addressing all of those gaps, all those needs that we need in our community. It wasn't that long ago, I had a young girl come into my office, the building where I'm working, come in with a parent rope burn around her neck. That is a cry for help. That is something that I need to address as a leader right away. And still we see the gaps in service. We see the systemic failure that are embedded in these hospitals, in the way that people think about us. We submitted many different things on behalf of my community, and just to name a few, we have put into emergency treatment plan for our aftercare center multiple years. We submitted under PIOC regarding our state of emergency for additional security. We applied under Indigenous Capital Grants Program for our youth hub, inquired under Health Canada and Addictions Program, but never told when intake would be. No transparency. Numerous applications under CHRT for transitional housing for my people, to no avail. As you see, we are trying to help our community. Like you said, it's not only your responsibility. We have been trying. We have been doing whatever there is necessary to take matters into our own hands and to help our people. We've had to fund a lot on our own because we care, because we love our children. You provide a funding announcement today, but how much of this will actually be available for our community, for my community like mine? Well, it sounds great, but in reality, to me, it won't make any difference, because I will have to still submit proposals and compete with the rest of my brothers and sisters for that little bit of money that's made available. So I come here as a true partner, as my ancestors have done before me, willing to sit down at the table, make the necessary changes that's needed today. to save our children. I ask you, what guarantee is there for us, a community like mine, to guarantee that I have safety and security, that I have services and health and mental health and addictions that are going to be there for them? I'm hoping that, that there will be some changes. And you being one of our own, I'm hoping that you'll do that for us and to really commit to ensuring that our voices are going to be heard. Say thank you. Chimigwech.
Miigwech Chief Sherry Taylor for sharing that powerful statement and the way that the youth crises, the spiritual youth crises of mental health and gang violence are impacting you as a leader, impacting your well-being, impacting your community's well-being. I hear your calls for transparency, for communication, and I hear the power of love in your voice speaking about the kids. I really respect that and honor that. And that important question you raise of, how many of the funds are actually available? How much longer do First Nations have to rely on proposal-based funding? And I hear your intergenerational advocacy and your call for a true camaraderie rather than relying on these games of broken telephone, it feels. So Miigwech, we're going to be moving to Chief Archie Wabas.
Thank you. Thank you, Miigwech. I would like to thank Minister of ISC for being here. Miigwech, thank you. First off, I would like to say thank you. There are some things I would like to say thank you for. We just received funding from ISC to deal with our community mental health issues. A funding of around 900,000, and I thank you for that. Thank you for that. It's to deal with the families that are having mental health issues, losing their loved ones and things like that, grieving, trauma, things like that. So we're going to start working on that in our community. So thank you. The other thank you I would like to say is that your involvement, ISC's involvement with the Ontario Final Agreement. And it's near to completion, I think. I hear. So I thank you for your understanding. I thank you for signing the agreement. Yeah, and I hope that it will be in operational soon. Chimigwech. The other thank you that I would like to say is there were three things I had in mind. The third thing I forgot what it was, so it's going to come back. So anyway, in dealing with community issues, there are so many. There are so many issues that that you never heard of. Maybe you hear some of the issues, but we don't have a media. We don't have a everyday media in our communities or in our region to report certain things. You don't hear them. Everything happens. It seems to be everything happens in behind the scenes, isolated incidents, things like that. We talk about partnership, true partnership. Okay, let's exercise that. Let's put it into an action. Okay. What we should be doing is like the way we've done with OFA, like the way we've done with our mental health funding. We worked with ISC. We work with NAN. We work with other organizations to help us, to guide us, into what we're looking at, what we need for our community on mental health issues and dealing with these. So there is this collaboration and cooperation. We had meetings. I don't know how many meetings we had. Since the time when we lost one of our band council member passed away about a year ago. That's the time I stood up and say, we got to do something. And I wrote a letter. On my speech, I called on everybody. I called on NAN. I called on the government of Canada, Ontario, everybody. It's time to look into how we can address and resolve the issues that we have. So that's one model of true partnership and cooperation, where you sit down together, where we sit down together and solve these issues that we have. Same thing happened with OFA, We got together, we sat down together, we cooperate, That's a true partnership in action. Right now, as we sit around here at the Chiefs Conference, we're talking about these issues. Lack of so many things. We have a partner, I think. We have a true partner, which is Government of Canada, ISC, that we need to sit down with. We have a long list of issues that we need to resolve. One of the critical immediate issue is NIHB. Like our people are really fed up with the services, what the services is providing to our people. Like the response time and their bookings of their flights and their delays of they miss their appointments and things like that. So the way to deal with this is to sit down with you and try to come up with a solution. I'd be willing to sit down with you right now. Let's talk about it. Okay, come up with the an action plan. Maybe we need to look at the policies that are in play. Maybe we need to look at culturally appropriate program service delivery for our people, meaning that, okay, give us that program, we'll do it ourselves. I'm flexible. I would like to explore options. I would like to, work with the government, work with the organizations, work with the chiefs. That's me. Okay. So I offer to you that we sit down together, like right now, starting now, and continue have these meetings to address and to try to resolve these problems that we're having. Okay? Miigwech. Thank you.
Miigwech. The next speaker is Chief Mateus Anderson from Casablanca. And I'm just going to list off who's next so they're on standby. Following Chief Mateus Anderson from Casablanca is Chief Merle Loon from Mishkigaugaman, followed by Chief Bruce Achipiniscum from Martin Falls, and then Aaron Gakabekam, proxy from Fort Severn. So please, Chief Mateus Anderson from Casablanca.
Can I before the other chief speaks, I guess this is an open forum, right? An open forum.
Yes.
We have our guest here listening. Does she have to respond to these questions that we raised? I'm just wondering. Yeah? Okay. And I forgot to ask for, Chair, can you recognize Ramon to speak?
Yes, I do. I recognize Ramon to speak.
I'll give him a few minutes to, Miigwech.
A good day.
Don't worry, I'll only take 15 minutes of your time.
Shut
Wache, Ramon Karakwape, Nishnakasun, Arovskat Dosting, Mixototem. Hello, I'm Ramon Karakwape. I'm from Arovskat First Nation. I'm a part of the Eagle Clan, and I'm on the NAN Oshkatazak Youth Council. And this time I wanted to ask you a question, not as a minister, but as you, who you are. The one thing that I always think about constantly on my journey as a youth council member and growing into the role of what I'll become is what drives me. What brings me to these meetings? What brought me to the position I'm in? And the one thing that when I see you on our Facebook, native social media, or on YouTube or with press conferences and the work you've done, that's the one thing that I thought about. Why do you do what you do? Who do you do it for? What's the one thing that when you wake up in the morning and inspires you to say, okay, this is what's going to push me to get to where I want to go? And how do you view that helping shape the path that you're creating for others that will follow you or look up to you, like other youth, or even with chiefs here sitting earnestly, asking questions from their community with the issues that we're dealing with, because we see you as a figure, as a point of power. But I also want to introduce that bridge so you can show who you are outside of being a minister. Because I may be wrong, but a lot of people in here may not know who you are. And I want to give you a platform to speak on that before more questions might come where, what are you going to do for us? What are you going to do this, that, and the third? I want to know why you do it, why you do your work. And if you want to respond or not, that's my question. You guys.
So we're going to go to Chief Matthias Anderson and then Chief Merloon Mishkigaugaman.
Wajé, Matthias Henderson, Dishnekaz, Donji, Asabanagan, Chief Matthias Henderson. It's my first month in as chief, so I'm very excited to develop a good working relationship with you, Minister Mandy. Yeah. I would like to give you this letter. Yeah, but for context, I'm from Casablanca, and my community is a small island. It's about 5% of the reserved land. It's just we're pretty much all bunched up together in that little island. And 95% of our reserve is you have to go through bodies of water. We need to build bridges, and we don't have money to build bridges. So we're forced to build on Crown land. I used to look after a good chunk of major projects in my community before becoming chief. So we have a lot of infrastructure on Crown land. So my request is to help. I'm looking to open a file for addition to reserve. It's been worked on, not worked on for the past 30 years for Casablanca. And I'm hoping we can sort through this in 2 years rather than 30 years. There's multiple chiefs that's been tackling this addition to reserve. We have a lagoon system, airport, a new high school, and 10, no, not 10 homes. A band camp. It's a former Valor camp. We pretty much, there's over 24 community members, families that are living in the camp because we're forced, because we don't have homes, right? There's no houses available because in our island, there isn't enough serviceable land. We don't have enough water or sewer infrastructure to expand. We're forced to build outside. And we just made a loan for 10 houses. We call it the North Reserve. It's on the mainland. We have to cross about 8 kilometers to reach that land. It's on Crown land at 8 kilometers. And the 10 homes are on our own reserve. And we built the road, we built the power infrastructure, the power line, and we have water and sewer trucks ready to go through Crown land. This is our own source, our own funded. We're using our own money to expand onto Crown land. And the operations and maintenance to maintain this, it's not covered by ISC. So the only way it can be funded is through if it's on reserve land. So this is where my request comes in. I would like a addition to reserve file to be opened with Casablanca Lake First Nation. Miigwech. Yeah, I think that's pretty much it. Yeah.
That's Miigwech. So I would just like to announce that the minister will be leaving in the next 10 minutes for a meeting. So there are a few more people lined up, 3 more people. So I appreciate if people could be mindful of time so everyone can have an opportunity to speak. I'm sorry about the time constraints. I do apologize. However, I want everyone to have an opportunity. Okay. Yeah, she's leaving to meet with NAN chiefs, various NAN chiefs. So after next will be Chief Merle Loon from I can't read the right Mishki. Just say Mish. Chief Merle Loon, please.
Yeah, I was just going to say Mish.
Miigwech, Mish.
A lot easier. Chief Merle in Michigan First Nation. I'm not going to talk too long. Just first to acknowledge your presentation, Minister. Acknowledge your attendance, and thankful that you recognize all First Nation issues. We all know too well our struggles as nations, not only here at NAN Nation, but also right across the board in Canada. The one thing I really want to address here in this platform is that NAN is a strong nation. NAN on several occasions stepped up to the plate, if you will, to really address some of these issues that we have collectively across the nation, but also here at NAN. We all know too well some of our struggles. But before I get into the one point I really want to address is I like the idea of a working relationship to be continuous, always to be continuous. That's just how we are as not only First Nations, as people, as human beings. And sometimes our roles will require that. And that's one of the comments I made this morning already, that we always have to be at those levels of governance levels to keep these keep this momentum going when we want to try and address our issues. I like to plan to harmonize for the future. Obviously, we always want to work for the future, for our future generations. I really want to acknowledge that you've acknowledged that as the Minister for ISK. One thing I really want to point out really quickly is, again, going back to NAN and advocating for NAN on behalf of NAN, but also for my own nation and for all nations within NAN, is you'd mentioned that Jordan's Principle received so much funding. But what's unique about NAN is Choose Life is specific to NAN. And one of the things I really like to see is maybe we start those talks to have Choose Life as a predictable funding separate from Jordan's Principle. Because we all know too well the recent bulletins that occurred all earlier in the years, how that adversely affected our program, our Choose Life program, where some programs have to lay off their workers, and some of our communities don't have Choose Life programs anymore. And we all know the importance of Choose Life. You stated in your presentation how Choose Life is a very, very important program to have. And we're so proud of the fact that this is NAN specific. And again, I refer back to being NAN as a powerful nation, because we are. We took the intervener status with our child and family services, and we're on the brink of getting successful there, hopefully by getting the announcement on Monday that will be favorable for us. So I really want to really bring that out. I mean, we know our issues, we know all our everything that happens across the board in this nation, but I really want to really hammer down on Choose Life and Jordan's Principle. How maybe we start those talks to separate that, so we can have Choose Life program here in our NAN nation. I understand other nations are interested and want the same type of program. Why not? We'll be the example again and lead that fight, because I really believe in this program. Thank you.
Miigwech for bringing your concerns forward. So again, she will be, are you leaving now?
No, I'm gonna respond first.
Okay, all right.
Is it okay?
Yeah, go ahead. There's two more people who have concerns, but I think it's good for you to respond now. You have to leave
Okay.
soon.
Okay. But if you could still note them and communicate them to me, because I will be in the building and just have a side meeting, so.
Okay, a good day.
Thank you. Thank you. Thank you for the questions. You know, I really believe in the model of shared responsibility because it empowers me as a minister to showcase your success as nations. So I am very open to having that discussion. I first want to acknowledge, you know, the openness that you have and to have the opportunity to really teach. I know and acknowledge that NIHB is everybody across this country is not adequately served by NAHB. And I want to zoom out beyond what it means to, you know, call NAHB and try to get an appointment. It's not just about planning your travel, your transit, helping you every step of the way. There's also at the other end, when you receive that service, my partner, the provincial government, they deliver healthcare services. And I think for us to truly succeed, there has to be a shared responsibility and space for all partners to come to the table. So I will advocate and ensure that in setting up that discussion, that everybody who plays a part in delivering service to community is reflected in those discussions. I know that there's only so much resource available, and you know, Chief Sherry, she spoke about that. And it is very challenging to create an envelope and know that only certain proposals will move forward. This is something that keeps me up every night. And this is why I think shifting and changing into a shared responsible phase really allows for communities to align and identify what their needs are and collaborate to ensure that as you go forward with funding, you're able to roll out and support one another. And I want to talk about partnership. I have a partnership with every First Nation. There's over 630 of them. You have a partnership with only me. For me to succeed in being a partner for you, there needs to be a greater discussion of what that partnership looks like. And I think shared responsibility is a space that, I'm willing to challenge and push forward to see what that reform looks like. I really believe that communities are empowered when they make the decision for themselves. For me to be able to do that, it really requires that support. And, I think everybody here is familiar when you have a chief, you give him a mandate to do a job. And I want you to know and understand that as your minister, that's also a mandate that you give to me to do a job. My space is to speak to you about the capacity and the resource that I have, how I can action that mandate. Sometimes I will come back to you and say, you are asking me to do this. I can do it in this way. That mandate also needs to be a relationship that has flexibility and to be able to ensure that I can bring something forward for you successfully. And I was very impressed when I read for the first time the briefing notes on Shu's life. While I know that the funding from Jordan's principal comes from a decision that was taken from a court process, for us to transition and to really truly offer that stability moving into a program space is something that I'm willing to explore as a discussion to see what is the potential. We will not have answers unless we ask ourselves the questions and have the opportunity to know that there's a conversation moving forward. In the ATR space, my colleague and I, Minister Alti, do share this responsibility. And we have actioned with our department to move away from the standard 30-year period of an ATR and to really ensure that we're actioning and taking those decisions quicker. A lot of the times, the history in ATR is there's just no information on who this land belongs to. And I'm doing this because we know that the paper trail of land is viewed by provincial and federal governments in a different way than it is viewed by First Nations. And I believe at ISK and at SIR, we have to take the responsibility of, if you don't have the information, take the decision. Don't make the community wait. Take the decision and support them, because we cannot prevent them. We cannot put that ownership or the onus on them. So we are introducing a process. I did receive the letter. Oh, he seems to be out of the room, or I don't see him. But please assure him that we are actively working on ATRs. And I've already started to have that conversation with my provincial counterparts as well. And here in Ontario, I did have from Minister Rickford an expression that he had an interest to move some ATRs forward. So we will be having those discussions, and I'll come back and report to be sure that you guys have information on what that next step is. Lastly, in closing, I guess I'll answer Ramon's question as he leaves the room. I'm going to be very honest. Mandy Galmasti and being Minister of Indigenous Services, you wear a lot. You wear a lot because when people see the chief, everybody thinks they could be the chief. And when people see the minister, there's that same expectation, you need to do this. And there's often this whole entire system behind me that I have to work within that is very challenging. And, I've learned through leadership that you really have to give grace when people are upset with you because you haven't done something. And often it's just because information is not shared. That's why I believe that in building capacity, you also have to do the teaching of explaining, here are the steps that we take to reach a decision. Let me tell you, BCRs are way easier than getting a cabinet decision because it is a very complex process. And I can hear my staff laughing in the corner because they know sometimes that decision-making process can take years. and the fragility of the political system shifting and changing is why I think the responsibility is so heavy for a minister to try to make decisions as quickly as possible. But who am I personally when I am not a minister? I'm a mom. I have 4 kids. I was a very Yamsho youth. I was actually a teen mom. I graduated high school. I had 2 children. I went to college. I had 4. I almost stopped going to school because I didn't want to make it any higher than that. But, you know, I'm a mom. I'm married. My husband and I this fall will celebrate 28 years together. I'm very committed to culture. I'm a culture carrier. I actually do a lot of beadwork. I do a lot of sewing. This is not my work though, but it is my aunt's and I'm very proud of her. She's very, very talented. These are also from my nation. So I really respect artists. I respect the storytelling that they have. And I'm really honored to share who we are as First Nations people. You will often see me behind the Prime Minister dressing and looking in a way that represents First Nations people, because I know that when I was young, there was a period of time where there was a female prime minister for a very short period of time. And I looked at her and I thought, wow, she doesn't look like me. Maybe one day somebody will. So I want people to turn on the TV and see leaders in that space, like myself, like Minister Chartrand, like Buckley Boulanger, and they're seeing somebody that looks like them. That's really important to me. And that means that you have to go in those spaces. And sometimes it's really hard to go in those spaces. So the values that I have gained in leadership, sometimes through leadership lessons that were challenging, but really gave me the takeaway of knowing and understanding that you have to have compassion for people. You have to care, you have to give grace, you have to communicate, you have to give as much detail as possible. Sometimes you are restrained by the Crown to share detail, and it's hard for me, but you know, I'm always trying to empower people with information. And I'm really somebody who believes in youth. I'm a big supporter for youth. And anytime students or youth ask me, I make it a priority to show up for them. But I also know that being in this liberal space as an MP, as a minister, there are not enough of us. We are 6 in the Indigenous caucus out of like 169. Well, it's changing, hopefully going up, but there's only 6 of us, and that's not acceptable. We need to have more voices in that space. It's a really hard system to be in. I'm not going to sugarcoat it. It's a hard system to be in, but if we don't expect that system to change and work for us, we're not going to see it unless we go into those spaces and create that change. And it's the energy that we bring into that space about collaboration and working together and communicating. Those things create the change that we need. And as a politician, I think the thing that I understand the most is you will never reap the fruits of your labor. You must know and understand and accept that the decisions that you make will benefit those in the future. And know that what you're doing will be felt later. Sometimes if you're lucky, here and there in the same space. But you're working for the future. You're working for now and you're working for those future members to be. I also want to say something that I've told many First Nations groups in this country. Sometimes it's gotten me in a lot of hot water, but I don't care because it's a truth. There is a power in your vote. I know that you depend on the chief or the grand chief to advocate for you with government, but there is a power in your vote. When my nation stood behind me and voted for me, I saw the federal government responding and reacting in files in my riding in a way that I had never seen before. And that is federal and provincial. So I encourage you to hold them accountable to you, to participate in those elections. It may not always be the outcome that you want, but participate, exercise your voice in those spaces. You have to. You have to, because as long as we stand by and do not express what our needs are, we will not have an answer. So I encourage you to vote. Support your candidates, whatever color the party is. Exercise that right to vote. And I will share a secret that helps me as a minister. Every morning, we have a discussion about what the position is of how government is viewed. And very often I receive a long list of interesting articles about myself and my performance. I am able to successfully convince and advocate my position when I can say, communities behind me, they believe this. This is what they want for themselves. And I can also help direct into a new path when I say community has expressed this is what they want. Every statement that you make either helps or hurts that pathway forward. I'm empowered by your voice. I'm empowered to go and see other ministers or the Prime Minister by your voice. I want you to know and understand that I respect that voice. We may not always have the same opinion, but there's always strategy to work together. Collaboration is the cornerstone to who we are as First Nations people across this country. We collaborated with everyone, First Nations or not, and we have built this country. We need to exercise our space and be present in it. Rita, miigwech, thank you. I will make sure I follow up with the questions for everybody else who spoke. Wajegam swa.
Miigwech, Mandigal, for giving us your time today, your time and listening and validating and witnessing everybody's statements today. I also am very grateful for.
Where's my time? Minister, you're leaving.
Oh no.
You're leaving without giving all the chiefs a word. I had the NAN. I'm from Martin Falls. I told you before the issues we have: wastewater, infrastructure issues. Those feel-good thoughts today won't do.
I'm really sorry. I don't want to interrupt you, Chief. I do want you to know that
People
I'm
die
gonna
right
meet
now.
with the Chief of Kasheshwan, but I will
People
still be in the
die.
building. and
People
can-
die today
You wish to have time
because
with
of
me?
your infrastructure
I can allocate.
shortfalls.
I would like to say that the meeting she is going to is with Kassechuan. She has been pre-booked by the NAN chiefs. She has to go. She's been listening and taking notes. She will be available to hear your
I was on the
concern.
docket. I was on the docket here to speak.
Chief, I don't want to take your time away from you, but I do want you to know that I am still in
Wastewater.
this building and I'm
Our
willing to
community
have
can
the
grow.
meeting with you.
Our
So I'll leave
community
you
can
to
grow.
organize with it.
Today, we're on boil water advisory, same as Nishkandaga. We're gonna break down like Saskatchewan because our wastewater system is failing, inadequate. NAN, help us. Get a kissing ass.
Okay, Miigwech. We're going to be continuing with the open forum. Up to speak next is Aaron Kakabekam. Kakabekam. Sorry. Ooh. If you would like to speak, proxy from Fort Severn, would you like to share? And whatever you say will be recorded and given.
Okay. I share the same sentiment as Chief Bruce. Again, my name is Aaron Kakapetum. I'm the proxy for Fort Severn First Nation. There are many needs in our communities, and infrastructure is one of them. You know, one of the most urgent issues is water and wastewater infrastructure in our remote communities. You know, many communities lack reliable access to safe drinking water, aging or undersized water treatment systems, inadequate or failing sewage and waste systems as well. The communities that I work with are in desperate need of new water and wastewater facilities. Many of these facilities are at the end of life and are being held together with Band-Aid solutions. And this directly affects the health, safety, and the quality of life of the First Nation people living in these communities. So the question that I ask is, does ISC intend to continue funding infrastructure transfer initiatives and the development of First Nations water authorities? Miigwech.
Miigwech.
Miigwech, Aaron, for that. And again, that'll be noted and taken to the minister. So miigwech. So that is the list so far. So chiefs, a couple of things we can do. We can continue the Chiefs Open Forum that was on the agenda. So we can continue doing that. Chief Taylor, just a note. We also had the agenda item, mental health and addictions. I know we've touched on that in a variety of subject areas throughout the last 3 days. But we can spend some time again talking about that as part of wrapping up the Chiefs Open Forum. We do have one more agenda item, the IRS Indian Residential School Response Strategy. There is a resolution as part of that, and then we would get to resolutions. So we have 10 more resolutions. Of course, we're mindful that we need quorum. So I'll take your call. If you want to continue with the Chiefs Forum, but Chief Kuzis, Gijsta.
Okay, good afternoon. I'd like to recognize a youth. He's got something to address to Geronimo Kadakwabit. Thank you.
Miigwech, Geronimo. Make some room for him there. There we go.
Geronimo Kalakwap in addition to Kasin, Dushin. Hello everyone, my name is Geronimo Kalakwapit. I live in the community of Adawabaskut First Nation. Just want to acknowledge everyone that's here, all of the chiefs, grand chiefs, all our leaders, wherever you come from. And I'm here today to talk about an opportunity that has that me as a grassroots youth and others as well have established over the last couple of months. And it's about the something called the United Nations. Sometime later this year in April, actually from April 20th to May the 2nd, Ramon here, Ryan, and Cohen will be attending the United Nations Permanent Forum on Indigenous Issues. It's the 25th session, and it's one of the largest global actually, it might be the largest global platform for Indigenous issues you could find anywhere in the world. And a part of the reason why I decided to talk about it today is to let you know that we as NAN youth that come from the NAN territory are going to be going to this forum from April 20th all the way through May 2nd. So just around 2 weeks. And how that came to be was it was a process. And one of the biggest shockers that came to me was that there aren't any of our leaders, to my knowledge, that go to these international forums. More often than not, I hear that we are sovereign people, that we are true nations. And part of the reason why we're going to be going there is to talk about our treaty, our rights, who we are on a grassroots level. I can't go there speaking on the behalf of any First Nation, but I can go there speaking on behalf of myself, Geronimo Kalakwapit, who resides in the community of Adawabaskut First Nation. And part of the reason why I'm bringing this up is that maybe sometime in the future, I would like to see many of our leaders there, our nations there at this forum, because we come to events like this, regional events like Chiefs Assemblies, annual General Assemblies, whether it's NAN, Mashkewa, Ku, whatever have you. And we also attend national events too. for that to have direct discussion with the Canadian government themselves. But I don't see too many, at least our leaders here, on the international level. And because treaties are an international agreement. Treaties are recognized as, international agreements, international contracts. And I truly believe that we need to start going into these spaces to talk about that. For me, I grew up on the land most of my life, the waters. I think I spend more time around on the land and waters that surround Adawabascut than Adawabascut itself. And I'll be going there to talk about our land, our water, who we are as Indigenous people, who I am as a Omashkego Kinenu. And how we came across this was through the advocacy work that I've done with the movement I created called Here We Stand. And I'm sure most of you know this now that we are at a crossroads with many, many of our issues in regards to our rights. For me, that's what's most important and at stake here, our rights, inherent, treaty, or otherwise. And it's important to go to these international forums to talk about that, to exercise our sovereignty. One thing that I've picked up these last couple of days is that the chiefs are asking for real affirmative action, less rhetoric and more affirmative action. I've been doing a lot of listening, and a lot of the work that I do is more on the grassroots level. I just do it. And so this is one good way for you to bring your issues directly to the international stage. For other countries to hear you, and just not Canada, and to show the rest of the world how Canada treats their First Nations people. And it's really, really important, I believe, to be at these international forums. And we're going there on our own dime, on our grassroots level, as youth. And that's something I just wanted to bring up here. It's just not about attending the United Nations Katapago, just to go to New York, because that's where we're heading, the United Nations headquarters located in New York, Manhattan. But it's about building a proper pathway to assert our rights, our treaty rights, our inherent rights on a global stage, to bring the voice of our people to the rest of the world. That's what this is about. And I'm hoping this at the next forum next year, we could see more of our people there at these forums. The registration process, the accreditation process shouldn't be too difficult for our individual First Nations to accomplish. We always talk about action. We always talk about us being a sovereign people, sovereign nations. Let's start going to things like this, because we're going to go there as grassroots youth. This is something I brought up to the Mushkegowuk chiefs at their annual General Assembly maybe a week and a half ago here. And they're all for it. They agree. Anyways, I just wanted to bring that up. We are going to be going to this forum. Should be around 2 weeks, 2 weeks and a half in the US. It'll be me, Ramon here, Cohen here, and Ryan, 4 youth from our region, to talk about the one thing that we hold so dear to us, that's everything to us, our home, our rights, who we are. So I don't want to take too much of the assembly's time. I do tend to talk a lot for those that that know me. I'm a kind of quappet, like this guy. I'm just joking. All right, I'll go ahead and leave it there. I'm not sure if these three wanted to say anything. Ryan, anything to add, or if anyone has any questions? But we're not going here to speak on the behalf of your individual First Nations, but to speak on a grassroots level as youth and for treaty, for our treaty. Good day.
Good day.
Watch it.
That's it. You got you. And best wishes on the journey. I'm sure that you will have a powerful message. Yeah, you got you. Any more issues, Chief Loon?
Chief Loon Shiogmung, First Nation. Just to the youth, if you don't mind me asking a question of the youth, going to New York and that UN United Nations gathering. I've been there myself a couple of years back just to kind of observe and see what the UN was all about. And some of the observations I've made during my time in New York and being at the UN gathering was that there was a lot of obviously a lot of nations there, and it's a good experience. It really is. And I just wonder. So I know when I went there, I had to pre-register almost 3 months in advance to let them know that you were there as a participant or representing a nation. So hopefully I'm assuming that you guys got all that squared away, because yeah, and if you're allowed to speak at the United Nations, you're only given 3 minutes, and it's really that's the part, to be honest, I didn't like about the UN when you're trying to raise those issues, when you advocate on your behalf, wherever you're from. And literally, once their 3 minutes is up, they cut you right off. And it's really, and to me, again, when you have other nations trying to raise those issues from all over the world and you get cut off at 3 minutes, it's really another platform that I was kind of, to be honest, disappointed, even though we know we're going there for serious matters and serious issues that we want to raise as nations. So I just wanted to make sure that's all squared away with you guys, because if you don't have all these pre-registration activities all signed up for, then sometimes you're going to have to be kind of that off to the side and try and make your voice heard that way. That's all I really wanted to say about that. Thank you.
You got you. I did see a nod, so I assume you're pre-registered. But
yeah, so we are pre-registered and everything. That's true. There is no mechanisms to enforce any resolutions passed by the United Nations, even if our problems are heard. And I think one thing is that is important, that isn't obvious right away, is that it's also a great place to network. And if you do, going up, getting in your 3 minutes, you speak in front of the entire forum on the main stage, in front of everybody. Probably some of the most eyes some of our people will ever get ever. Sometimes you'll have thousands, tens of thousands, more than that, watching you. And so we will make those 3 minutes worth it. And we are being sent a provisional agenda, and there will be multiple times to speak, just not 3 minutes, one off like that. But they do have multiple different sections throughout the 2 weeks that we can talk. And I think one thing is that when we go there, one of the strategies that can be done is that, yes, we can talk for 3 minutes in front of everybody. Another thing that we can do is go ahead and just talk to the other member states of the United Nations, because I'm sure some of you may or may not know, at the United Nations, chiefs aren't allowed within the actual, or First Nations aren't allowed within the main forums. Only member states, different countries, the Prime Minister would represent Canada and this is a forum for Indigenous issues. One thing we can do is go and talk to these other countries, these other ambassadors, these other leaders within these spaces to go ahead and, let's say, we can lobby their support to go ahead and get them to ask Canada those questions that we can ask them themselves on an open forum in front of the whole world. It would really paint a picture of how Canada truly treats their Indigenous people if we get these other member states to go ahead and talk on our behalf or to ask questions on our behalf, which has been done before. There are multiple ways to get our message out there. As I'm sure many of you know, you have to be creative with it. Anyways, I just wanted to
3 minutes is
say
up.
that. 3 minutes is up. That's what they're gonna do. Just you won't even say
And,
that.
and
They'll
in
just
that
mute.
case, they'll cut you off. You can't even respond. So. I'm glad that Chief Loon brought that up.
Yeah. Yeah.
Migotch. Yeah, again, I'm really glad. Actually, you're going to learn a lot because that is one thing that I heard at the UN. Once your 3 minutes is up, even if you're not done, you're cut off. So what you learn is you learn skills where you can take your messaging and make it really clear and concise and make it impactful within that 3 minutes. Another strategy you're going to learn is what you talked about. It's not only about mic time. It's not only about mic time. It's working behind the scenes and talking to the people. And I'm glad that you recognize that. So the reason I say that is that can also work here. We don't cut people off. It's disrespectful, but I think you will learn skills that will really help in even a forum like this. So you guys, yep. And thank you, Chief Loon. Again, congratulations, best wishes on the journey. Any more open forum discussions? Any more discussions? We are in our open forum. Chief Taylor is here. The other topic was the mental health and addictions, I'll say crisis in our communities. I know we have talked about it. I'm sorry, my colleague is calling me. Sorry, just conferring with my colleague. So, Chief Taylor, I was going to give it to you if you want to speak to it, or whether we've had some discussion already. But I'm going to keep the forum open. I'll go to you, and then Chief Gustajan Matarawaban following that. So, Chief Taylor.
Good afternoon, Chief Sherry Taylor. I know that we did have various discussions throughout the last couple of days addressing important topics such as mental health and addictions that are plaguing our communities, affecting our children and our families. I wasn't present this morning when there was some discussion on health transformation. I apologize for that. I had another meeting, but I wasn't sure if anything came from those discussions in regards to mental health and addictions. I know I want to be respectful of time, and I know that we still have some things on the agenda. So with mental health and addictions itself, I dealing with things on my own in my own community. I did reach out to NAN, and they're providing some support to me in regards to meeting with hospitals and kind of getting to having some uncomfortable discussions with service providers, because I think that sometimes you need to do that in order to get to where you need to be, in order to address the real issues that are happening in real time to my people. So I wanted to know, like, is there a way that we can do something now as NAN, where we can address some of the real issues that we're facing as communities as we work on things in the long term through health transformation? Miigwech.
Miigwech, Chief Taylor. I am looking around the room. I don't see the staff. I was just going to provide a summary unless Andrew is coming up to respond. No? Okay, I'll come back to Minue. Okay, is it separate?
Yeah.
If it's separate, let me finish with this.
Yeah,
and I'll come.
maybe what I told the
Okay, go
minister
ahead.
is to put that partnership in action, meaning that we need to sit down with them. Like we need to have that forum, that table, whatever you want to call it, and start dealing with the issues that we're talking about. A lack of funding on certain things. Number one priority would probably be NIHB. You know, let's fix that now. Like have a table with them and get that thing going. You know, we need that table. We need that. Our advocacy work would be make it better. If not, why not entertain First Nation manage it? You know, and that kind of thing. Yeah. Thank you.
Miigwech.
Yeah, there's an announcement here. I don't know if you guys received an email. Indigenous Services Canada, Ontario Region Chiefs Update 3:30 to 4:30. They're having a meeting at 655 Bay Street, third floor boardroom. They have Michael O'Brien, Regional Director General, and Lisa Westaway. They're going to be talking about the fund. What do you call that fund? Let's see here. They're going to be talking about the Strategic Response Fund. So it's happening at 3:30. Right. Thank you.
Miigwech. So I want to be respectful. I know Chief Gustajan Matarawaban has been standing by. I was going to go to her next, but I want to finish what Chief Taylor was asking about. So Chief Taylor, I know you weren't here, but just a brief response. When health transformation was being discussed, there was a bit of a plan, but the idea was to have a process where we deal with immediate priorities. And NAN has identified as part of their presentation 2 immediate priorities. One is medical transportation, which is NIHB. The second was mental health and addictions. I believe those are the two priority areas. Mental health and addictions, it was recognized there's so many dynamics, so many aspects that it might take a bit longer, but the idea is that we get to it now, today. And so I think they've picked up on some of the messaging. And so that is one of the immediate priorities, as well as NIHB and medical transportation. So that was somewhat discussed, just to respond. Okay. Is that fair? Or do you want to expand? Okay. Quick response.
Just sorry, just really quickly, I just wanted to talk about there's actually 2 different things going on at the same time. And so for NIHB specifically, the innovation table is looking at shorter term, but still like strategic process of medical transport, as well as longer term planning through health transformation, where we're doing a research project that is doing engagements on what needs to change with NIHB, and then doing a fiscal analysis of what it would cost to implement the new NIHB with those changes. So 2 different things going on specific to medical transport at the same time. Thanks.
Miigwech. Online, Chief Gustajan Matarawaban, go ahead.
Hello, can you hear me?
Ganun go ahead.
Okay. Good afternoon. I was gonna chime out, but I needed to get to somewhere myself. But I just remembered, but you already brought it up in HIB, one of the things that are gonna be prioritized. But I just wanna make sure that it's covered too, in case it is gonna be addressed immediately. I have, and I'm sure a lot of communities go through this. I have patients, I have a lot of our members that are displaced because of dialysis treatment, whether it's hemo or renal dialysis. And it's sad because at one point we decided to go see our patients in Kingston, our members that are receiving treatment. And I'm going to try to make it short, but so we ended up calling one of the lead in NHIB files was to meet us in Kingston, which she did, and we met and patient services there. We wanted to find out who was making decisions on behalf of our nation, our members, and who's taking a lead on this file when it comes to hostel and service. So we found out that a lot of this work that's been done is by Kingston General, that the hospital, running the hostel along with with Wawat. But when we got there, it's kind of like a hostile situation. Like it's kind of like it was non-inviting. But anyways, we went through the other doors and got to see our members. And we ended up having a discussion table with the key players. They didn't like it because they said we were intruding. But all we want to do is find out for ourselves what was happening to our members. Because a lot of that time when I talked to our members, they kept saying, I don't want to come home in a coffin, which they literally do. It's sad. We're losing a lot of them out there and they're returning home in a coffin. But but my point is there's no care for them out there other than the treatment. It's not a life. And a lot of these members are living in hotel rooms. A lot of them have been staying there for 4 years or more, 2 years, until they can't be helped. And a lot of them have different pathways. A lot of them engage in addictions as well. And there was this young guy that called me, and he was upset and he was crying, and that's what he was saying. He was asking for help because he wants to be placed in a room that has a kitchenette. He says, I'm tired of eating out from the cafeteria. It's been too long, 4 years. I want to cook my own meals. I want a job. I want something. But the way they NHIB is handling is downloading it, making them residents of the municipality like Kingston, in order for them not to service them anymore. In order for this person to have a kitchenette, be situated in a kitchenette, they have to move. And once you move the premises, they're on their own. So they're making we're trying to find unique ways to help them out. And a lot of our members are here stuck like that, going to these cities in no regard for their families and their supports, or, it's mental health. They're suffering, they're depressed, trying to acquire these services. And we have a lot of our displaced members going through this just to acquire this treatment. But then sometimes in the end, the outcome is not good for them. So there's a lot to this story, but that's one of the files we've been trying to work at, and we do have some leeway, but it's not right for them to be turned into municipal citizens or residents when they got rooted from our communities and they still belong with us. And I think we should find ways to help them out, get to that other level of comfort, which is having their own little private space in order to deal with this condition, with this health ailment that they're dealing with. It's very serious and it's very disheartening. And I want to bring that up so you guys, when the discussions do happen, that's one of the priorities, because we have a lot of community members displaced because of these treatments, and no regard to their kinship or family or their supports. Minglish.
Chief, and I think you're at home in Advocacy, correct? You're at home?
Of course, where else will I be?
What kind of question is that?
What kind of question is that? Okay,
English. Chief Nagaji.
Been listening all day. Trying to be on my best behavior. So, in regards to the resolution that's here, that presented by Nastandaga, I think we really need to move on that quickly. Because I know we face that back home where we have people from other First Nations or people of different descent, I'll say, coming into our First Nation communities and doing drug trafficking. I know for Albany First Nation hasn't made a few busts in the last couple of days, but it seems like when you cut off the head of a snake, two more pop up. Like when a counselor shared with me this morning, we're having battles, we're having our own war, and that's the drug war in our little communities up north that are we say they're isolated, but the winter roads are there. So I know that that's the importance, and we are doing what we can. But also the assistance with NAPS drug unit, I just want to give them thanks because it's them pressuring, helping us, and also to the community members that are getting brave and stronger to share information. So I want to make sure I acknowledge them. That relates to my next topic, is the mental health, the psychosis that our members go through because of drugs. And I think, I don't know, we have to, forming patients, I don't know, I think we need to really look at that. I know mental health patients have their own rights, I know. But I think doctors need to understand when parents are sharing what they see day to day, and they don't take those into consideration when it's time to assess the patient or member. And those are the struggles, and what happens is our member either gets worse or sometimes we lose them and they don't come back. And that's hard. They have where I know some families strong enough and take things into their own action, but I guess it's harm reduction where I think we need to really look at. But at times too is when someone goes away for treatment as well, we have, or if they come back from jail and they get back, I think that's where I support with the conversation of aftercare. That's what we need so we can jump on those people while they're coming back on right shoulders in the field. Times as leader, I feel like I failed them sometimes when they end up back in the same cycle. I just thought I'd just put that out there, but I think we should try to move this before we lose quorum because it's starting to look thin here.
Chief Nakaji. So two things. One is the resolution you'd like to deal with. The second one is your emphasis on the mental health and addictions. So I want to make sure that's noted in the note taking. Very strong. Going back to the resolution, reality, my Nabian. I know some of the chiefs that have had to go have logged on, so I see the number of chiefs that are logged on right now. But at this point, we don't have quorum to deal with any of the resolutions. We just got a whispering in the ear from one of the chiefs who said, you know, this, and I wish everybody was here, but you know, this United Nations rule of 3 minutes and you're done. If we could do something like that here, then we could deal with all of the so many issues and get to all the resolutions if we did follow that. But I know we do have a 5-minute rule in the rules of procedure, but we don't necessarily follow that. It's in our culture, it's disrespectful to cut somebody off. But the reality is what happens is similar to what's happened today. We don't have quorum and we're not able to pass your resolution that you're talking about and the 9 other really important resolutions. And it's very unfortunate when that happens. One of the things we try and do is deal with resolutions as we go. So when we deal with a health topic, we deal with the health resolution. If it's education, we deal with it right then and there. So we try and do that. Unfortunately, there are times where we can't, and they're done at the end of the day. The idea was to deal with resolutions on the end of day 1, again day 2, and then again day 3. Now, the reality is we didn't have a 3-minute rule where we cut people off, and we had really good discussions We went to about 6:30, almost 7 o'clock on day one. We went late on day two and again day three. So it's not that we're not committed. It's just that there's so much, and this is just a reminder that maybe we should think about something like that. It's not my place, but that was a chief that actually whispered that into our ears. And to be respectful of each other, because we did, again, during the minister's visit, we were following a list. Our youth co-chair did a really good job to remind speakers that we want to be respectful to the others that wish to speak. So if you could be clear, concise, and that'll allow more speakers. And we just didn't have time. We ran out of time. So something, I wish there was more people hearing, but I'm glad that that was brought up. So again, we do have one more agenda item, and I'd like to turn it over to Connie to get into that topic. You got
So at this time, I'd like to call upon Deputy Grand Chief Matatawaban, and he will be giving an update on the NAN IRS response strategy that they've been developing.
Vache, good afternoon. Yeah, it's it is somewhat difficult accepting the situation we're in today when we lose quorum. I hope moving forward, and I hope maybe for each council listening in, for each council member listening in from back home, make a motion, you know. Chiefs meetings are allocated 3 days. We need to fulfill that so that we can get the business at hand to get done. I just wanted to share that as a suggestion moving forward. Times like this, we do need you. We do need the leadership. We do need the leadership to be here, present, to provide their support, to provide the support that is required, needed, especially for this file. In hindsight, I guess we should have presented this resolution at our last meeting. But because of many factors that come into play, we find ourselves trying to wrap up or finish up work that was left undone. And this is one of them. The IRS, the strategy, we needed to have one. We need to have one in place. But we also needed to complete the process of engaging with the communities, engaging with the survivors. We were doing that as well over this past few months, trying to finalize the work. And it was our hope that this resolution would be supported and passed at this meeting, so that the work could continue, or you would provide the mandate for the executive to carry on the work, to advocate for continued support in terms of funding to carry on the work. This Indian residential school response strategy, there was a resolution 2110, and it was calling upon the leadership of NAN to develop a strategic response to the identification of unmarked graves and the recovery of missing Anishinaabe children from Indian residential schools. As a survivor, the residential school continues to live within us. It continues to be an issue for us, not only for me as a residential school survivor, but for our intergenerational survivors as well. That experience itself didn't stop with us. It carried on after we left the residential school. And so that work, therefore that work needs to continue. Following the direction of the chiefs through Resolution 2110, the first step was establishment of the Reclamation and Healing Department and the appointment of technical staff to carry forward this survivor-led initiative. Through this same resolution, the Niganagabuan Elder Advisory Council was formally established with a mandate to guide, advise, and uphold the integrity of the work. This report flows directly from this mandate. From the beginning, the strategy has been shaped and grounded by survivors, families, elders, and community voices shared through gatherings, forums, written narratives, and engagement across the NAN territory. The strategy reflects those voices. It honors the leadership of survivors and families. It affirms the sacred responsibility of bringing children home. It sets forward the path for restoring healing, truth-telling, accountability, and sustained action within our territory. It is both a record of what we have heard and a commitment with what must continue. This report is we present this response strategy to the Chiefs in Assembly with humility and with resolve. May it guide us in carrying this work forward in a good way, with strength, with care, and with unwavering dedication for generations to come. With the resolution from the Assembly, it would provide support for the NAN executive to call upon the provincial and federal governments to commit to the Indian residential school mandate. The funding obtained through the mandate of this resolution would prioritize the implementation and continued development of Anishinaabe Nation's residential school response as an evergreen document, including providing adequate support for NAN's Reclamation and Healing Department. This strategy is included in your Chief's kit. It starts at page 55. I hope it can be reviewed. I hope it you can look at it. Like I said, the work kind of fell behind a bit. And I wish we could have done this at our previous meeting. But we couldn't do it without completing the document, without completing the process of engaging with our community voices, our survivors, and people that participated at the assemblies or at the conferences. That being said, I know we don't have a quorum, but we present a report regardless. So far as we know, the government's sunsetting this work right now as we speak at the end of this month. And as I said, work got delayed through different circumstances, change in leadership, just things that transpired over these last few years. And just this past year, we did our best. We did the work. We carried out the conferences, engaged with the voices, community voices, and came up with the strategy. I don't know what else to add, or I don't know what else to say, knowing that we don't have quorum, knowing that the resolution will not be dealt with. But if there is an opportunity to carry the work forward, we will. We will continue. We have a lot of work yet to be done. As we speak, there is a conference happening across the hall that involves the ground search work that is currently ongoing. And it's the 4th annual conference, bringing our technicians and our teams together to provide their updates. And NAN has been doing this in partnership with Anishinaabe. And So that's why there's a bit of a mix-up in terms of why there's two concurrent conferences going on. So I've been going back and forth, making sure that just to ensure that that if I'm needed on that side, I would I'd be available. We have a good turnout across the hall. We have a number of people from across the nation, across the country, and they find the work very informative. Feedback we're getting is that Anishinaabe is leading the way in terms of doing this work as well, providing the right information, providing the information that is required to carry forward. Egon mas kubo kikituan just me quest tagia kiabskai steak. Mr. Nain Dagon now hegi Hispanic chistatic to Chikanuin jagatik chigi bimurte mga kaho nagaskatun chigiat koyaski stano. Egon be shagidin daw tatchapan man idin daw tatchapan. Sagapan hogan hanak. Muna ma gidu chagato chigi stano kegon. Egon mas kut kema mitrin jagatik kinone tiga istaiga bet nuktabek. Chishi keme ko kuma hanak. Ega me chishi naga chapatono. Me go jenu stano chavatun. Kikis kendenano. Aka chukumas kun stan is the one neva kinakastrano. Pego ebepo. West Americas nagasconum. Then dagon no magesti biak, no magesti taek. There's no just taek who have this one. That way to gisha opanike on gaisha pagusen muyak, gaisha pagusen muyak, gaisha no stepaniak, gaisha in the stamban. Pehtatenan, kintohtatenan, Gabriel Montameke gona. Pehtagon. Yakuma pek to habatuson. Shabubanek, must kisasman pe muhte mga kiabat. Ako tutan na stagay kiustipanek kaho. Hewi ta histogan hanak, hewi ta stanoch. Hewi ta stanoch homa kayan muntakik. Anostroma master tagian muntatik. So with that, guys, thank you. I know I can't ask for your support now. I'm very aware that we've lost quorum. Pache, migas.
Okay, so the floor is open for some comments. Your name and your nation.
Proxy Roger Wesley from Constance Lake First Nation. I just want to start with the big Kichimigwech mic for that report. You know, something as big and important as this shouldn't be just dropped because of quorum issue. I don't know what our policies are in regards to electronic voting, getting outside support after the fact. But in Constance Lake, we utilize a system that allows that when we need to do a vote to council. If we don't have quorum there, they're not online, the majority of the council members will vote in it and wait for the outside to decide, or the ones missing. I don't know if that's available to our policies here, but if it's not, maybe it's time, because this is not the first time I've been to a NAN Chiefs meeting and this problem has happened, where chiefs, we're getting pulled from all directions. And sometimes it seems on the last day, the afternoon of the last day, bodies start to walk out. And it's no fault of anybody outside of the pressures on every one of us. Getting called in the back, getting pulled over here, dealing with something back home when we're at these meetings. But we need to have a way where when this does happen, we can still make a motion and get something on the table, on the floor, and seek supports the day after via Zoom calls, via telephone calls, via email or text. The technology is available to us today, unlike when the policies were devised for these votes. I'm willing to make a motion to explore such things. This is a very important file here.
My mother is a survivor. I'm a child of a survivor. And many of us are impacted by this residential school experience. And passing it off because no quorum is a real shame to the process we have in place. And we need to update it. We need to upgrade it. And I'm willing to make a motion to do some work on that end, so we can get this motion passed here within a week by calling out to the chiefs that had to step out. They didn't step out just because they're going to dinner. They stepped out because something's happening at home or they're getting called to another meeting. So out of respect of all the chiefs that are gone or that have to leave, I think we owe it to them to adjust and upgrade our policies as per passing a motion. And again, Mike Kitchemiigwech for sharing I missed the first half, but I know where you're coming from. Miigwech.
Thank you for your comments. That is a big challenge that we have as chairs to make sure that the business continues and that the mandate is given to NAN. So with that, I'm going to ask Grand Chief to respond to your comment. Are you going to respond to him? About what he said?
Sure.
Great.
Chair. Can I make a comment quickly on the resolutions that we're talking about here? This is not just one resolution. That's there's about 10 resolutions that we were supposed to deal with in this conference. In our last conference, I don't know if we dealt with the resolutions. I think it's a carryover from the last chiefs meeting that we had. We had to carry over those resolutions to here. And we just lost the quorum and we didn't pass a resolution, did we? Yeah, we did. At least one. Yeah. So there are like 10 resolutions that we need to deal with. And these are very, very important, very important to, mandate our executive to work on these files, projects, programs, advocacy work and everything that we need to try to get these things going, fixed and what have you. So we were here just talking, basically. We need resolutions to bring them into light and action, right? I don't know, like when I come to a chief's meeting, I want to be here. Like I want to be here and help other First Nations. And let's find resolution on these matters, then rewrite them up and pass them. So if this keeps up, next conference, if we're not going to do resolutions, I think we need a better system. I think we need a better system. Like I don't know how many chiefs are here. I don't know what's our quorum. Like, is it 25 plus one or what?
23.
23. You need 23, and we'll probably just have 16 people here, or yeah. So I don't know. I don't know what you guys think. Like the way I wanted to, the way I asked for one time is first day we should have dealt with the resolutions. I've told AFN that to the same time, like the same idea. I told them like we couldn't complete the AFN resolutions, and they've been sitting there for a year maybe or so. So I've told them on the first day do the resolutions. Yeah. On the first day do the resolutions. Yeah. And there could be additional resolutions the day after. Until we come to adjournment. Yeah. Yeah, like I don't know, leaving here without passing these resolutions, there's no work mandated for our executive. You know, we came here to talk about these things and no action. I guess we're going home and say, okay, what did you guys do? They're going to ask me. So what happened? Like, did you pass any resolutions, or we only passed one? you know, like, so what's going to happen? Like, you guys been talking about this and there's no action. Yeah. Resolution takes actions, right? Yeah. So that's my 2 cents. So I don't know. Maybe we need to do a follow-up just to deal with the resolutions, or call for what do you call that? Piggyback a conference or something? I don't know. Say, what do you guys think? You know.
Okay,
Right.
thank you, Chief Wabas. So I'm gonna go to Gary, but to respond to your comment, Grand Chief is gonna talk about that in his closing comments, how the resolutions not being addressed can be done. Yep.
Just to help out before I know there's 2 chiefs that want to speak. We've already gone off topic. We're still on the IRS, residential school survivors. Is that what it's about? If not, we can come back to you. Is it about the?
Oh, it's just
residential
about the
school?
quorum.
Okay, so we'll come back to you. We'll come back to you. We would like to respectfully finish the residential school topic.
So as part of the residential school topic, as you know, they were across the hall in their own meetings. So as part of that, there was a request to have a special honor song to be done by Walking Bear for the residential school survivors. And also that in the back, there are blankets for anyone who wants to take one for if they're a residential school survivor or someone in their family who is a residential school survivor. And I also just wanted to acknowledge the words that I used earlier, and I had said leftover blankets. Those were the words that I was given. There's leftover blankets, and I just want to apologize to have, diminished the value of the work that's being done to honor residential school survivors. So I take back those words for the record, that I myself is a residential school survivor, and so is my mother, and I know our experience. So I just want to apologize officially to the woman that's been doing the work for our residential school survivors. So at this time, I'd like to call upon the drum to do that special honor song for our survivors, because we do live with their experience every day in our communities.
So there was a request that it was not on the agenda, but we were asked if we could include it as part of the residential school agenda item. So I'm really hoping that they are standing by. If not, we will continue and start the closing protocols and begin to close the assembly if we don't have them here. But before we do that, we will go back to the discussion that we had on quorum. So are we ready to proceed with maybe what we can do in the meantime is Connie can go back to the quorum discussion. Is that fair? Or do you want to? Okay. Going back to the quorum discussion then, Chief Quazis.
Okay, good afternoon again. It's very disappointing to see we lost a quorum. We have our young people looking at us, how we do business. And we always say they're our future. And seeing this quorum that's lost before we even deal with important topics. Maybe we should shorten our agenda on next assembly. Some of these agendas are not immediate, what we've been talking about in the past few days. But there are some urgent ones that we have to discuss. Yeah, I was in Kiwewan there in Moose Factory, and there was no quorum again. We couldn't even deal with resolutions. So I think we have to look into our system, the way we do business. Maybe a 1 day of resolutions. After, or even shortening our agenda. We have too much topics on our agenda. When I was listening to Sunny, he wanted some solutions, and there's no solution here. A lot of us came out here with to participate on this conference. We do have lots of issues within our communities because we're multitasking. So I just want to bring that up. Maybe that could be shared to other chiefs. How we could resolve the issue here we're having. We're leaders. I'm elected to speak for my community and to bring something home. And it's it's pretty hard to move forward. We have big files that we had to move fast, and with this system, it's failing us. I think we have to revise our assemblies. So may I make it?
Migach, Chief Quizis. Before I turn it over to Chief Nakoji, I just want to remind chiefs that are still here, and I know there's several that actually had to go and are logged in online, that this is actually something that should be talked about as part of the review. How are we going to operate? And Simon is still here. Stand up, Simon. And Simon is involved in the review and coming up with some other options because, as you say, it doesn't work when this happens. And so let's look at other options. And so please reach out to Simon or respond when he reaches out to you to look at Anishinaabe Aski Nation. So thank you, Simon. Chief Nagaji.
I don't know, maybe it's just a suggestion. It's regarding, I know chiefs in the past have mentioned having just 1 day on resolutions. But listening to others is that maybe the first day, but also could we have a special assembly just to deal with resolutions for a day, if it's even in person or Zoom?
I think Grand Chief, as part of his closing address, will provide some comments to that, and we hear you. Yeah, Chief Loon.
Chief Loon, Michigan Nation. Just a really quick remind our nation. We always talk about traditional law, and you need to incorporate our traditional law in our practices. We always say that, including NAN. And I think really this falls into place why traditional law needs to take effect when we want to pursue resolutions. A long time ago, our chiefs used to sit around for days knowing each other's stories and discussing stuff that they were facing as nations. And no one would leave until those discussions were done. That's traditional law. They followed the traditional way of doing things. Set aside the corporate way of doing things. And if you want to focus on resolutions and, for lack of better words, marching orders, then that's what we need to do as leaders. And we need to respect traditional law. That's what traditional law is about. You know, the trees, the birds, the animals, they're all patient with each other. And that's where we base our teachings from back in the day, before we had colonial systems. And this is where we really, really need to have it addressed and say, how do we incorporate traditional law? Because we always talk about it. And I think really you have to, again, for lack of better words, if you want to talk the talk, you got to walk the walk. That was said at our last conference. And I think really I challenge fellow leadership that we need to do that because it's for our people, it's for our nations, and it's serious. These are serious issues. And I think that's what we need to focus on. I mean, do I want to leave and go home right now? Yes, but I know I have to commit to at least getting my job done to represent my nation. Thank you, Miigwech.
Do I have it or do you? So we did say we are going to start the closing. And I think there's all of a sudden different plans happening, maybe with the other conference across the hall. But as part of our protocols, the process is to have the closing remarks, the closing prayer, and then the drum. I'm going to look to our staff because the drum is not here. I'm going to look to, oh, they are here. Okay, they're ready to go. Thank you. So we will very shortly be turning it over to Grand Chief for closing remarks. So I don't have the details, but the ceremony that was going to take place here that we were asked to have as part of the residential school discussion, I'm told that it will be, something will be taking place across the hall. That, of course, everybody is aware there's a conference happening across the hall. So once we're done here, once we close, people are invited to go and participate across the hall. So with that, I'm going to turn it over to Grand Chief for closing comments. Oh, Archie?
Can the chair recognize Ramon again? Like he asked us? Like a couple minutes.
I promise it's only 6 minutes. Now, I just wanted to reaffirm what Adam had said. I've been talking with the National Site Forum to honor residential school survivors, to hold a ceremony. And I went over there and spoke to the entire crowd and the coordinator, and they want to invite us over there to be a part of the ceremony as we honor our survivors. So I was talking to Alvin and those in here, and if after we finish closing ceremony, if you would like to, please come and stand with the survivors that are in the room across. And Walking Bear will also be a part of their closing ceremonies to honor survivors and honoring song. And yeah, please come with us after the closing ceremonies. Miigwech.
Yeah. Okay. Well, Miigwech, so I think what we'll do, I know the the drum group is here. So I'll just maybe make some brief closing comments just to thank all of you. But we'll move the drum across the hallway along with the elders to say the closing prayers over there. No, we're going to close here. Okay, and then move across. Okay, so we'll do the drum here and the prayer, and then we'll move across. But I just want to say miigwech to all of you, the leadership that's in the room. Miigwech for being with us these last 3 days. I just want to also just apologize to those that were unable to speak directly with the minister this afternoon. I know the minister has already reached out to Chief Hatchibneshkam to arrange a meeting for today and a more in-depth discussion that will happen between the minister and Chief Hatchibneshkam, whether it's in Ottawa or here in the next week or so. So we want to make sure that whatever issues that you wanted to raise with the minister, that your voice is heard. And if you want to speak with her directly or deliver a letter similar to what Chief Matthias did, we will make sure that that happens. I just want to also acknowledge KI, Chief Donnie Morris. I can't imagine the pain, the suffering of your family and community. Just know that we are here, even though we're far away from KI, that we are thinking about you. Our hearts are with you. And whatever we can do to ease your suffering and pain, that we will do whatever we can to be there for you and your family and your community. I also just want to acknowledge Saskatchewan. I know Chief Wesley was here, even though his mind must be elsewhere. That right now his community members are scattered throughout the province because of no access to water in their community. And my wife, Tisa, is a teacher, and she chose last week, as you know, as March break. And she chose to travel to Niagara Falls and spend some time with the families from Saskatchewan in Niagara Falls, especially with the children. She wanted to spend time with the kids. And at the end of each day, she would call me to tell me just about what she experienced that day and to express her concerns about the impacts that being displaced and evacuated far away, the toll that it takes on your mental well-being in your life, especially with youth and children. And she encouraged me to work closely with the leadership, with Chief Wesley and the council to move quickly to fix whatever needs to be fixed at the community so that they can go home, but also to work with the community with a longer term, more sustainable plan to relocate the community to higher and safer ground. So I just want Chief Wesley and the people of Saskatchewan to know that we are with you and that we will continue to work with you to ensure that you go home, because you deserve to be home. I want to acknowledge those that made this meeting possible. And I know that we didn't get a chance to finish everything, that there are some outstanding resolutions that are still on the table. And that's what we had to do last fall when we had our fall assembly, that we had to design or develop our agenda to ensure that the resolutions and the decision-making process took place on day one. And so we will take the resolutions that are left or that were not passed from this assembly, whether to organize a special Zoom call assembly. As you know, we have a monthly call we've started in January, maybe to make that a duly convened meeting where we can entertain those resolutions, or to have a special assembly. I spoke to you this morning about health and the urgency of some of the issues that we need to address. And if we need to convene a special assembly like in the next month or next month and a half, just to deal with those issues, we will. But I'm also aware that we are approaching the spring hunt season, and we will have to juggle our time a bit to make that happen, but it needs to happen. And we will work with you on that to do that in the next month or so, as quickly as we can make it happen. I also want to just remind you of the event that we are planning. It's going to be here in this hotel on Monday. And some of you I know will be staying here for the weekend. And I'm grateful to all of you for making a commitment to be here with us on Monday. It will be from 1 o'clock to 3 o'clock. The official gathering will happen on that day. And we anticipate that a historic announcement will be made by the tribunal. It's something that we've been waiting for a long time, but more especially our kids have been waiting for. And I'm hopeful that after Monday, we will be in a better place to actually start implementing the planning and the work that you've been wanting to do for your children, that we can actually begin that work after Monday. We will make sure that there's a virtual option. I don't know if it's going to be in this room or the next room, but we will make sure that every one of you, including the citizens of the Shabbat Station, to be able to dial in and witness the history that I'm sure will unfold on Monday afternoon. And so I also just want to acknowledge the survivors, residential school survivors. I know they've been meeting, many of them across the room. We will go there right after Walking Drum does their closing song, and an elder will do the closing prayer. But again, miigwech to all of you, through the three individuals, co-chairs, miigwech, the executive council, chiefs, delegates, council members, all the staff, and all the citizens that took time to be with us in the back. Miigwech for being here. And I wish all of you safe travels, and we will see you again very soon. Miigwech.
Miigwech for your closing remarks. I would also like to thank everybody here for supporting me in practicing my public speaking and really welcoming me into the space and supporting my growth as a, I guess, youth advocate or a youth leader. I would like to welcome I'd like to ask for a closing prayer from Barney Batiste, please, if he's here, please. And following the closing prayer, we will close with a drum song.
Yeah, so we're going to have the Lucy Barney show. Anyway, just listening to you talking now, I used to be the chairman of these meetings at one time. And I run into the same thing as you're running into here. It was the same thing. And as a chair, I took my life in my own hands to shut somebody down. It wasn't that easy, but I did it one time and just shut it down when people had a little too long talking. And we did finish the day wonderfully. It worked. But I'm going to tell you one thing, you cannot have a hybrid. It's not going to work for you. You can't go both ways. And one thing for sure, this young man here, your chair, and I worked really hard over the years. Now, this is over the years in asking you, what is your law? Because we were searching for that, of how the meeting should be run. Well, naturally, it should be run under your own law. That's natural. And we've been working at it. And over the series of meetings that this young man has attended, he's come to know. And we had one meeting where he basically took over because he was afraid, like I was, of taking it into his own hands for fear of his own life. So, but by God, he got into the meeting and it worked. It was a real good meeting. One meeting. It was really good. And since that time, he doesn't have to tell me, but I can see it in his face that he wants it to go another way. But that same old business of being incorporated. And remember, for those that might remember, that might have known, it was an elder from the past that told us, don't get incorporated. The elder said, as soon as you incorporate, the terms of reference has you working for the government because it's their rules, corporate rules. You know, you might have bylaws, yes, but you'll still be under corporate law. So that's how you operate. So you can operate either way, no problem, hands down. But I'll tell you another thing that happened to us along the way was the same thing was happening. We run out of the quorum. So the rules can say that the number that you start out with in the morning is your quorum. So if there's 15 chiefs, that's the quorum for the day. And you finish that way. But that didn't work for us either, because it turned out there was only about 15 chiefs that were making decisions for 49. So that didn't go anywhere. So we've tried several things. And one thing that was mentioned, I think is really, 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 really important that you want to think about. And Chief Wawat said it very plainly. There's no instructions now for our executive council because we run by resolutions. That, my friends, is dangerous. What are they supposed to do? Actually, I feel sorry for them. You know, it's not right. It's not right. So we really have to rethink that one more time. But I think you have to be really serious about it in doing that. And Chief from Constance Lake, proxy from Constance Lake, you know, obviously you know about meetings, and so you understand. And I think basically you all do in a roundabout way how it should work. But I'm telling you, pretty soon it's got to work. It's got to work. We have to be professional in our approach. When the minister was up here, if we were together under our own laws, I think it would be far more professional in answering her with the questions that he had. And I think another lesson is Chief Wawat, in talking to her and getting what he got as a partnership, proves the point. He did it in his own customary fashion, and it works. So again, we go back to what are our laws. We do have written information about how we are to operate. Maybe we have to look at it and say it's outdated. And as it was said, we're now doing a governance model, see what it's going to be. And I have talked to the young man trying to do that work, and quite kiddingly saying, how's it going for you? Because it's hard to see what kind of governance that you want to be under in one way. In another way, it's really easy if we look at our own laws, how we're going to operate ourselves. We've got to do it. We just simply have to do it. Because You're going to have Grand Chief Executive Council. You have to give them direction. Right now, they can get in an awful lot of trouble by doing things on their own. And you're going to say, some of the people are going to say, why did you do that? They'll be chastised because they were forced to be able to do something on their own, such as the residential school thing. So they need the power at the moment of the resolution. But then again, they need the power of the chiefs under their own law. When the chief put in his law on the roadblock and putting in all those safeguards that you put in, that's your law. You did it. Yes, there are some other laws that kick in there, but basically you did it. Proof that it can be done. Again, Wabas, what he did, proof it can be done. Absolutely. And the gentleman, I don't know the name, that did the closing prayer for us yesterday, said some words there. I didn't understand it all, but he knows. Again, it's his law. It's his law. When the young people spoke up, in terms of when they collaborated amongst themselves, they have a mandate, they have their law. Traditional. When a woman speaks up, same thing, they have their laws. So this forum needs to do the same thing. I have great respect for leadership. And if, you know, for us to continue to have that great respect, we have to have our own laws. It just has to be. And so I would leave it at that. And all I can do as an elder is give you an idea. I can't do it, but I can give you an idea. It's up to you. We will do that. The other thing that we should not be remiss to do, there are people sitting in the back there, all doing their work. And we have some outside and some in this corner doing their work. If anything, I think you should give these people a real big hand because they're going to complete the work. Give them a hand. Come on. Sometimes I think they are truly the backbone of our organization. Without them, nothing much moves. I imagine every chief in the room has had the opportunity to at least talk to one of the staff members to get help. And that help is always there. So that's all good. So now I'm going to introduce Lucy behind me here to, here's the thing with the Elders Council. We have decided that the language is important to us. And there's lots of loss of language. I have a bit of my language, maybe quite a bit, but I'm not really fluent as these people are. So we have 4 members on our council that are fluent in their language. 4 of them. 4 out of the 5 of us are fluent. I think that's terrific. I think that's a step in the right direction. And so that's why when I come up here, I like to have one of them come up and help me. I have my line. I love it. I say that Yagwasako Niton Gaji Kinomagzin. When did Mega Kanoinda? That's my favorite line. The Creator gave you what you have and you use it. And I'll let Lucy carry on from. She's a wonderful gal, by the way, Lucy. You gotta talk to these elders a little bit and get some of that wisdom that it'll rub off on you, you know? Maybe you can ask her for a date someday. Yeah. Okay, Lucy. Oh.
Miigwech, Barney. Bigwech ito, kanya gumutik walking bear. Kamutik maskwak. Maskwashishik. Eko maga mingwech ito. Uta kabechi ni buchik ushkatisak. Ni gandehe shipechi mastechik atiatil figischik. Mingwech ito miswe. Maghanaka kibeji dostechik.
Ekistisagahachiku, yo, tante kaustichikutan, hutanan ma. Mi questions done, Mese, Winnehan. Muskajuna Bakers Kondishnehasan, the Mendo Dem. Mi quest Kishamando. Eginagachi heya hut oho nistogi shigao e mamoheto nano en dottamo nesta yao ekitamage na miya kashimanto Duspenamun kashimanto chike nagach hedjak miswe uta kaya bachik agibechi apatisachik nesta nagach hek miswe awashishak chichishak shkatisak Kishauk Gata Chakuta Nishnabaya Nation Gatono Nakichenan Kashamanto Which Hena Nesta Goyish Messiah Chatuta Market Nagachet to Siaka Manesta Chabich Nagachak Aniga Bitch of Chick The Spenamon Kashamanto Chawich Hatchakuta Gani Puchik Ka Kaya Patisichikyo Nishnabayaski Gatono Ukamakan Ukamau Grand Chief Alvin, Deputy Grand Chiefs, Bobby Narcisse, Anna Betty, Ajni Paneshkam, Ekumaka, Mike Metarawapan, Nagachikanege, Kayapatisukutapatsino, Kuyashitutakik Shamanto. Which Hekoyestutahik, Chimachik, Janagachet to Sukekamanas to Janagachatas Utanimo, Utakayapatisachik, until Tofasamo and Dead under being. I command the Speno and Kashamanto. Kuyas Gispanek at the Kiriak Beswe. Kitamaganamanan. Nagach Henan. Saga Henan. How me quest. Me quest. Me quest. Me quest.
Miigwech Lucy for your prayer. I'd like to pass it to Walking Bear to close with a drum song. Miigwech Walking Bear. And everybody's invited next door to the ceremony happening. Miigwech.
You are people we're